Hi guys, I'm Dr. Siraj Ahmad, your Faculty of Pharmacology, and welcome to our today's grand recall of FMG July 2025. So along with me, we have our Ophthalmology faculty, Sudha ma'am, Medicine faculty, Santhosh sir, our PSM faculty, Ashwani sir, and Surgery faculty, Sandeep sir, and also Manjunath sir for Forensic. So we are just here to do a little bit of discussion with all of you guys, and then immediately after this, we will start the discussion in just next 5 to 7 minutes. So, ma'am, I hope that you have been discussing with the students. What was your overall take on this paper? How do you think was the examination?
Um, Sir, I think the paper was moderate as to
Right,
whatever the students I have managed to interact with. It was
right.
not very easy, but it was not very difficult also.
Hmm,
The subjects, I mean, जैसे हम बोलते आ रहे हैं और हमने अपने रैपिड रिवीजन, अपने मैराथन सब में बोला था
hmm.
कि it will not be PYQs, it will be PYTs. सो
Right.
लगता है कि वही प्रीवियस ईयर्स टॉपिक से घूम फिर के क्वेश्चंस आए हैं, सेम क्वेश्चन नहीं बट उसके आसपास ही. And there were image based questions, case based questions.
Hmm.
uh, there were some one liners also, mixed bag tha, but the
But questions were mostly clinical integrated जो बच्चे मुझे बता पा
इंटीग्रेटेड,
रहे थे.
हाँ, क्लिनिकल
Right.
क्वेश्चंस हैं. और द लॉन्ग एंड शॉर्ट ऑफ व्हाट आई अंडरस्टूड इज कि अगर हम सुपरफिशियली पढ़ेंगे तो फिर द
नहीं हो
पेपर
पाएगा.
डिफिकल्ट.
बिल्कुल,
तो
बिल्कुल.
वो थोड़ा सा कॉन्सेप्ट बेस जो हमने राइट फ्रॉम द बिगिनिंग हमने स्ट्रेस किया है कि अपने
Hmm.
टॉपिक्स को अच्छे से समझ के पढ़ो,
Hmm.
पीवाईटीज पे ध्यान दो. जिन बच्चों ने ये किया है आई थिंक उनका निकल जाएगा.
राइट, राइट. तो मैम, डू यू थिंक द क्वेश्चंस जैसे कि कंजेनाइटल टोसिस वाला जो क्वेश्चन था या हर्बर्ट पीट वाला क्वेश्चन था, ये सारे यूजुअली डिस्कस टॉपिक है इवन इन आवर रैपिड रिवीजन, या कुछ नया था ये?
जैसे हर्बर्ट स्पिट्स वाला क्वेश्चन तो हम हमेशा ही डिस्कस करते हैं, लाइक
राइट.
इट्स ट्रैकोमा. देन वी
हम्म.
हैव अ क्वेश्चन ऑन एस्टिग्मेटिज्म जिसमें स्टर्म्स कॉनॉइड का पिक्चर है, वो भी कॉमनली डिस्कस करते हैं. रेटिनल डिटैचमेंट वाला क्वेश्चन, acute angle closure ग्लोकोमा वाला
राइट,
क्वेश्चन, these are all standard discussed clinical questions, like these
राइट.
are. तो ऑफ्था में तो मुझे ऐसे ही लगा, और बाकी जो जनरली बच्चों से बात हुई, दे आर ऑल्सो सेइंग कि जिन्होंने कॉन्सेप्ट क्लियर करके पढ़ा है
बिल्कुल.
और उनका तो दे वर हैप्पी विद द पेपर,
बिल्कुल,
एटलीस्ट दे
बिल्कुल.
फेल्ट दैट दे विल पास.
राइट. जैसे कि एग्जामिनेशन जो पैटर्न होता है, जैसे डायरेक्ट ऑप्थेल्मोस्कोपी या इनडायरेक्ट ऑप्थेल्मोस्कोपी, कहाँ पे आपको फ्लोटर्स दिख रहे हैं या किस तरह का रेटिनल डिटैचमेंट है, ये सारे जो टॉपिक बच्चे बता रहे थे, तो ऐसा लग रहा था कि वो डायरेक्ट वन लाइनर टाइप नहीं थे. जो बच्चों को डीप नॉलेज है या बच्चे थोड़ा सा जो क्लिनिकली इंटीग्रेट करके पढ़े हैं, दे वेर द वन हु
हाँ,
आर मोर कॉन्फिडेंट नो इन आंसरिंग दोस.
यस यस, दे वर क्लिनिकल क्वेश्चंस, बट ये पीवाईटीज ही हैं. मतलब ऐसा नहीं है कि बिल्कुल नया कुछ पूछ दिया है, ऐसा कुछ नहीं है. जो
राइट, राइट. बिल्कुल,
पूछना
बिल्कुल.
चाहिए वही पूछा है, बट you cannot just be very superficial with your knowledge and answer these
एग्जैक्टली,
questions, I think, and that
एग्जैक्टली.
was fairly the same with the other subjects also.
एग्जैक्टली. आई थिंक अब नीट पीजी का भी सेम पैटर्न है, वही है. आई थिंक आई विल बी मूविंग टू संतोष सर. सर, मेडिसिन तो हमेशा से ही वही है कि भगवान है पूरे 19 सब्जेक्ट का, एक तरह से देखा जाए तो आपके पास क्या बच्चों का रिएक्शन आया मेडिसिन को लेकर के?
ओके, सो जितना भी मैंने इंटरेक्शन किया है एंड आई हैव गॉन थ्रू द क्वेश्चंस शेयर्ड बाय स्टूडेंट्स,
हम्म.
इट वाज ऑन द प्रिडिक्टेबल लाइंस. कि
हम्म.
ऐसा नहीं कि कुछ वेग या बहुत ही कॉम्प्लेक्स क्वेश्चंस थे.
हम्म.
ऑल द पीवाईटीज, मोस्ट ऑफ
हम्म.
द क्वेश्चंस वेयर पीवाईटीज.
हम्म.
प्रिडिक्टेबल लाइंस में थे, क्लिनिकल विनेट्स थे, बट क्लिनिकल विनेट्स वे नॉट टू लेंदी कि
हम्म.
हाँ 1 मिनट में नहीं हो पाएगा. दैट काइंड ऑफ क्लिनिकल विनेट्स वे नॉट देयर.
हम्म.
लाइक 3-4 लाइन्स, सो दे वर एबल टू पिक. एंड जो डायग्नोस्टिक क्लूज होते हैं,
हम्म.
they were standard, not very rare diagnostic clues.
जैसे यूजुअल क्वेश्चन जो रेड टेल वाला जो था, रेड टेल का बच्चे बता रहे थे, तो वो मतलब उस तरह के क्वेश्चन तो सर बहुत ही फ्रिक्वेंटली आ रहे हैं. ऐसा नहीं कि ये कुछ
हाँ,
नया था. दिस इज
हाँ,
समथिंग दैट हैज बीन कमिंग सिंस लॉन्ग.
या एग्जैक्टली.
सर,
तो
इमेज बेस्ड
स्टैंडर्ड
क्वेश्चन
क्लूज थे.
आपके सब्जेक्ट से कैसा रहा? व्हाट वाज द नो स्ट्रेंथ ऑफ इमेज बेस्ड?
मेडिसिन ज़्यादा कुछ इमेज बेस्ड क्वेश्चंस नहीं थे, एंड अगर होंगे भी तो लाइक रेडियोलॉजी फैकल्टी भी उठा लेंगे कि हाँ
इंटीग्रेटेड के साथ होगा.
क्वेश्चन थे. कुछ ईसीजी बेस्ड क्वेश्चंस थे, बट
अच्छा.
दे वर आल्सो नॉट वेरी डिफिकल्ट क्वेश्चंस.
ओके.
जो मैं बताता रहता हूँ कि हाँ ईसीजी में दीज आर द इम्पोर्टेंट एरियाज की एमआई है,
एम आई.
डिस्टॉक्स है, एरिथमियाज है. तो सेम टॉपिक्स के इमेज बेस्ड क्वेश्चंस थे.
राइट, राइट, राइट. सो यूजुअल क्वेश्चन जैसे कि हम लोग भी इफ वी रिमेम्बर कुछ सब्जेक्ट टॉपिक ऐसे भी आए थे जो इंटीग्रेटेड थे फिजियोलॉजी के साथ बहुत सारे. जैसे एग्जांपल अगर मैं बोलूं, जेवीपी वाला जो क्वेश्चन था,
हाँ,
या कुछ ऐसे टॉपिक थे जो माइटल रिगर्जिटेशन वाले जो जो क्वेश्चन थे। तो ये यूजुअली ऐसे टॉपिक हैं जो आई थिंक आप अपने रेगुलर नोट्स पे भी कॉमनली कवर करते हो, अपने आरआर में भी कॉमनली कवर करते हो इफ आई एम नॉट रॉन्ग, और ये आपके एग्जामिनेशन में भी आया। विल्सन डिजीज एक ऐसा टॉपिक है जो आई थिंक ऑफ्थल और मेडिसिन का इंटीग्रेशन है। तो विल्सन वाला क्वेश्चन सर कैसा था, मेडिसिन में जाएगा ऑफ्थल में जाएगा, कैसा लग रहा था वो देख के?
So, like इन्वेस्टिगेशन बेस्ड क्वेश्चन था, तो आई विल डेफिनेटली टेक इट अप। एंड
ओके।
ऑल्सो झगड़ा तो होगा मेरा बायोकेमिस्ट्री फैकल्टी के साथ, बिकॉज ही ऑल्सो वांट्स टू ओन इट अप।
ओके ओके। नहीं सर, देखिए आजकल के टाइम पे जैसे हम लोग मेडिसिन के लिए भी डिस्कस कर रहे थे, तो व्हाट वी फाउंड कि एक कोई टीचर खड़ा होकर ये नहीं बोल सकता कि नहीं ये मेरा क्वेश्चन है ना। कुछ उसमें बातें रहेंगी, फिर अल्टीमेटली लास्ट में पीएसएम का क्वेश्चन निकल जाएगा, फिर पीएसएम की बातें करके लास्ट में वो पता चलेगा कि वो फार्मा का निकल गया या फॉरेंसिक का निकल गया। मतलब ऐसी चीजें हैं। हमारा कई बार फाइट मंजुनाथ सर के साथ होता है कि नहीं एंटीडोट वाले तो मेरे हैं, मंजुनाथ सर बोलते हैं नहीं मेरा है ना। तो ये चीजें तो अब ऐसा हो गया कि यू कैन नॉट से कि, और वी कैन नॉट से कि ये एक पर्टिकुलर सब्जेक्ट का है। इंटीग्रेटेड इतना ज्यादा कर दिया चीजों को, है ना, चीजों को। जैसे गायनी का हिस्ट्री देख के फार्मा का क्वेश्चन पूछा, तो दिस हैज बीन ऑल्सो आई थिंक वेरी स्टैंडर्ड। और जो यूजुअल टॉपिक्स थे जो बच्चे बता रहे थे, जैसे बैगासोसिस हो गया या सिलिकोसिस हो गया, ये सारे टॉपिक हैं। आई थिंक दीज आर द वेरी फ्रिक्वेंटली डिस्कस टॉपिक इन द क्लासेस।
हाँ, सो वन थिंग इज श्योर कि कोई ऐसा टॉपिक नहीं था जो आउट ऑफ द ब्लू आया है, पहले कभी
ओके
नहीं पूछा गया था।
ओके
मोस्ट ऑफ देम वेर पीवाईटीज।
ओके।
बस पूछने का तरीका थोड़ा सा
अलग था। ओके,
क्वेश्चंस में अलग था,
मतलब
बट
सिंपल
अदरवाइज
सा
इट
है,
वाज ऑन द प्रिडिक्टेड लाइंस।
प्रेडिक्टेबल लाइन आपके अकॉर्डिंग, मेडिसिन डुएबल था, प्रेडिक्टेबल था, और इजीली जो डिस्कस किया गया था वहां से था। चलिए आगे बढ़ते हैं, हम लोग बात करेंगे अश्विनी सर से। अश्विनी सर, आई थिंक अभी हम थोड़ी देर पहले भी बच्चों से बात कर रहे थे और आप तो डायरेक्टली फर्स्ट हैंड एक्सपीरियंस लेकर आ रहे हो। तो आप एक बार फिर से बताओ कि मतलब बच्चों का क्या अपटेक है आपके सब्जेक्ट को लेकर के, कि कितने क्वेश्चन थे लगभग और कितने डुएबल थे?
कुछ बच्चों का कहना था कि पीएसएम में बहुत ज़्यादा क्वेश्चंस नहीं थे, काफ़ी
हम्म
कम क्वेश्चंस एज कंपेयर्ड जो उन्होंने एक्सपेक्ट किया था उससे थे।
हम्म
और ये पैटर्न मैंने हमेशा पाया है कि जुलाई वाले सेशन में कम आते हैं पीएसएम, और फिर दिसंबर वाले में वो कई बार
हम्म
40-45 भी दे देते हैं।
हम्म
फिर दूसरा एक पॉइंट ये भी है कि पीएसएम में जो वैक्सीनेशन है, पीडिया का हो गया, जो पूरा बायोमेडिकल वेस्ट इंटमोलॉजी है वो माइक्रो भी समझ सकते हैं, फिर कॉन्ट्रासेप्टिव्स वगैरह भी हम लोग गायनी से ले लेते हैं। तो
हम्म
पीएसएम एज सच काफ़ी सब्जेक्ट्स को क्योंकि करता है, तो
हम्म,
इसलिए ओवरऑल मिला के क्वेश्चंस दिख रहे हैं, बट कोर पीएसएम के क्वेश्चंस डेफिनेटली एक्सपेक्टेशन से बहुत कम थे।
कम थे।
और
या
नीट के
ऐसा भी हो सकता है कि क्वेश्चन ऐसे थे जो बच्चों को याद ना आ रहा हो, जैसे कि मुझे एक बच्चा बोला कि सर एक पेशेंट को मैगट था, उसको क्लीन किया गया और कॉटन को कौन से बिन में फेंकेंगे? तो मैंने बोला येलो में फेंकोगे? तो बोला सर उसमें भी दो ऑप्शन था, येलो क्लोरीनेटेड, येलो नॉन क्लोरीनेटेड, अब बताइए। है ना, तो इस तरह के भी क्वेश्चन थे जो थोड़े कंफ्यूजिंग थे, है ना। तो
हाँ, वो कुछ कॉन्सेप्ट बेस उसमें नया चीज उन्होंने लगाया है।
पुराने मतलब
हाँ
वही है कि
हाँ।
पूरा नई बोतल में पुरानी शराब वाला कॉन्सेप्ट है कि थोड़ा बहुत चीजें तो है ना चेंज
यस
करेंगे। वैक्सीन वायल
यस।
मॉनिटरिंग पे भी आई थिंक क्वेश्चन एक ऐसे थे, कुछ ऐसे थे जो आप आसानी से कर पाते थे। और इमेज
नहीं,
बेस्ड
एक्चुअली
में
वही बात हो रही है जो सुधा मैम सबसे पहले से ही कह रही थी, कि
हम्म
अगर आप सिर्फ सुपरफिशियल चीजों को जा रहे हो तो क्वेश्चंस इस बार पकड़ने मुश्किल थे।
हम्म
लेकिन जिन लोगों ने पूरे बेस से चीजों को पढ़ा था वो पकड़ लेंगे। अब
हम्म
जैसे क्लोरीनेटेड वाला क्वेश्चन है, तो ऑफ कोर्स
हम्म
मैगट से वो कॉटन स्वैब होकर के आया है, यानी
हम्म
हाईली इन्फेक्टिव टाइप का है। तो
हम्म
क्लोरीनेटेड होगा तो बेटर है। तो
हम्म
इसलिए क्लोरीनेटेड आप कॉमन सेंस के बेसिस पे आंसर कर सकते हैं, क्योंकि
हम्म
उनको वो टॉपिक का बेसिक अगर है तो आप कर पाओगे। तो इसलिए नो डाउट, इसीलिए कुछ बच्चे कह रहे हैं कि उनको फर्स्ट पेपर बहुत टफ लगा था,
हम्म
क्योंकि पैथो और माइक्रो के उनको कुछ क्वेश्चन बहुत लेंदी और पैथो के काफी क्वेश्चन आगे बोले। फिर कुछ
हम्म
बच्चों का कहना था कि जिन्होंने ऑप्स गाइनी नहीं किया उनके लिए सेकंड पेपर टफ था, क्योंकि
हम्म
ऑप्स गाइनी, ईएनटी, ऑप्थेल और मेडिसिन, इसको मेनली वो लोग कह रहे हैं कि सेकंड पेपर में था। बट बच्चे मुझे ओवरऑल खुश लगे
नहीं
और
सर, मोर और लेस
पेपर
मतलब
अच्छा
मैं
था।
खुद अभी रिकॉल कर पा रहा हूँ 8-10 क्वेश्चन पीएसएम के। मैं खुद बच्चों से जो बात कर पा रहा था कि जैसे कि
हम्म
टीबी का पेशेंट है और बड़ा दुखी सा है, बोले कि कहाँ
हम्म।
पे कनेक्ट करोगे, तो कहाँ पे कनेक्ट करोगे? एक तो निक्षय है, हमको याद है जहाँ तक निक्षय, तो वो है ना जहाँ पे हम रिपोर्ट करते हैं, है ना, बिकॉज इट्स
हम्म।
डिजीज, एक ऐसा डिजीज है, नोटिफाइबल डिजीज है, नोटिफाई करना, वही है ना निक्षय?
यस, निक मतलब नो, क्षय
हाँ,
मतलब लॉस ऑफ बॉडी। तो
है ना,
निक्षय मतलब माल नरिश्ड वाला टीबी हो गया। अब
राइट।
निक्षय में रिपोर्टिंग करते हैं, और निक्षय पोषण में खाना देते हैं। तो आई थिंक वो मालनरिश्ड पेशेंट होगा, उसमें 1,000 रुपए पर मंथ टीबी पेशेंट के खाने का होगा, तो हो सकता है निक्षय पोषण होगा। बाकी वो रिकॉल में
नहीं, उसमें ये था कि
क्लियर
कहाँ
होकर
फोन
आएगा क्या
करोगे,
था।
कहाँ फोन करोगे, ये वाला क्वेश्चन था, ऐसे करके कुछ ऑप्शन था, है ना। मतलब थोड़ा सा एटिपिकल सा क्वेश्चन था कि निक्षय को
हाँ,
फोन करोगे, जू विन को फोन
सीधा सीधा क्वेश्चन नहीं था,
करोगे।
घुमा के था।
हाँ, और
हाँ।
ये आपके जो कैलकुलेशन वाला था, इंसिडेंस एंड प्रिवलेंस
हम्म
कैलकुलेशन वाला था। तो आई
हम्म
थिंक जो यूजुअल मैं जो देख पा रहा था कि रैपिड रिवीजन हो गया या यूजुअल क्लासेस हो गए, तो मोस्ट ऑफ द टॉपिक इज फ्रीक्वेंटली
यस,
डिस्कस्ड बाय यू आल्सो। और
इसका
आपके
रीजन ये है कि
हम्म
INI-CT में इसी बार
हम्म
इंसिडेंस का क्वेश्चन आ चुका है,
हम्म
लास्ट ईयर नीट में मीन
बिल्कुल।
मीडियन का क्वेश्चन आ चुका है। तो जो
हम्म
लोग भी केवल MCI की प्रीवियस ईयर पढ़ रहे हैं, वो
हम्म
उनको लगेगा कि हाँ हो सकता है, या फिर वो भी कुछ बच्चे का कहना था 2019 20 21 के कई सारे MCI के भी PYQ आए थे। तो अब
बिल्कुल बिल्कुल
टाइम हमें, अगर हम उस आसपास के एग्जाम्स जो भी हैं सारे टॉपिक्स इंपॉर्टेंट हो जाते हैं, वो
हम्म
जिन्होंने टॉपिक का बेस बना के पढ़ा होगा तो
बिल्कुल।
इजी रहा होगा। तो इसलिए उन इतना इजी भी पेपर हम नहीं कह सकते हैं, क्योंकि अब हम लोग समझ पा रहे हैं कि हर एग्जाम्स के क्वेश्चन उठा ले रहे हैं वो, और थोड़ा
हम्म,
बेस से जा रहे हैं।
बिल्कुल बिल्कुल। तो बेसिक नॉलेज इज वेरी
हाँ।
वेरी इंपॉर्टेंट। एंड जो
यस।
सुपरफिशियल कई सारे बच्चे क्या करते थे कि जैसे पूरी पीएसएम को रिवाइज करना है तो 8 घंटे में रिवाइज कर लिया, उससे काम नहीं चलेगा। या फार्मा हो गया तो 8 घंटे वाले में नहीं चलेगा, या मेडिसिन 20 घंटे में नहीं होगा। यू हैव टू हैव साउंड नॉलेज ऑफ द सब्जेक्ट। तो थैंक यू वेरी मच अश्विनी बॉस, आपसे बात करके। और आई थिंक हम बात करेंगे डॉक्टर संदीप सर से। संदीप सर, आप भी बच्चों से बात किए होंगे, कैसा रहा आपका सर्जरी?
सर अभी हम जस्ट इंटरेक्टिंग विद देम लाइव यार। तो मोटा मोटा सा सर्जरी बहुत आसान है, मतलब एवरी टाइम दे स्कोर वेरी वेल, और
हम्म
ज्यादा बाउंसर्स होते नहीं है। एक आधा थे, मतलब एक डीग्लविंग इंजरी का कुछ उसने फेशियल पिक्चर दे रखा था मैक्सिलरी इंजरी के साथ। अगर
हम्म
वो भी ट्रॉमा में थोड़ा कॉन्सेप्ट लगाओगे तो मिल जाएगा। सर ट्रॉमा हर साल ना एक आधा ट्रिकी क्वेश्चन दे ही देता है, मतलब देयर इज
हम्म
नथिंग हिडन अबाउट इट। इस
हम्म
बार सर्जरी, मतलब अगर आप बाकी चीजों से कंपेयर करोगे, आई हैड अभी अराउंड 27 to 30 questions is what I've gotten. And 27 to 30 questions में 2-3 questions is what I feel is थोड़ा difficult level पे है. But
हम्म
as all of you have been discussing, सर ये PYQ नहीं है, ये PYT है, हम हर बार बोलते हैं।
पीवाईटी ही रहता है
सवाल
ना, पीवाईटी
हाँ
रहता है
सर।
ना, पीवाईटी ही रहता है मोस्टली।
जी जी
एग्जैक्ट
जी।
क्वेश्चन तो रिपीट होता नहीं है सर जी।
सर मैंने एक और चीज नोटिस की है, जो प्रीवियस सेशन में जहां पे सवाल रुकता है ना, इस सेशन में वहीं से सवाल बनता है। तो उसका
एग्जैक्टली
नेक्स्ट, या व्हाट इज
एग्जैक्टली।
द नेक्स्ट प्रेडिक्टेबिलिटी। तो वी कीप टेलिंग इन आवर ऑल सेशंस की भाई देखो यहाँ पे क्वेश्चन लास्ट टाइम रुका था, तो
अब
इसके
आगे ये
आगे
है।
का ये याद रख लेना। बस अदरवाइज इट इज मोर और लेस गुड सेशन ओनली सर,
जैसे
मतलब मेरे
मुझे
हिसाब
अभी
से
याद आ
मॉडरेट
रहा
था।
था सर, मेडिसिन का मुझे याद आ रहा था कि पहले पूछा कुछ नीट पीजी एनआईसीटी में कि पेशेंट को कोरोनरी आई थिंक कावासाकी डिजीज का हिस्ट्री था, तो उसमें क्या दोगे। तो पहले पूछा था कि क्या देना, तो एस्पिरिन आईवीआईजी। लेकिन इस बार संतोष सर दयास की भाई कितने दिन तक एस्पिरिन दोगे, है ना। तो ये
वही है
चीज,
सर।
तो बेसिकली जहां पे पिछली छोड़ा, बिल्कुल सही बोला आपने। एंड आई टोटली एग्री विद दैट कि जहां उसने छोड़ा वहां से अगले एग्जाम की तैयारी है ना। एब्सोल्युटली करेक्ट, एब्सोल्युटली करेक्ट। मंजुनाथ सर,
Sir,
सर कैसा रहा फॉरेंसिक मेडिसिन?
am I audible, sir?
ये एग्जैक्टली
यस,
बहुत ज्यादा ऑडिबल है सर, एकदम।
Okay. Sir, I think one or two questions are very tough, especially the question asked about organized crime.
ओके।
Organized crime, something very new. It is like a bouncer.
बीएनएस।
Yeah, BNS.
ओके, ट्रिपल वन।
And one more question about the 26 BNS.
ओ।
Doctrine of extension, the consent question.
हम्म
Some
हम्म
two, three were difficult, rest all as usual, PYT only.
प्रीवियस ईयर टॉपिक ओनली।
Yeah.
ओहो, इस तरह से चला गया।
वाज देयर
स्टार्ट
इमेज
एक
बेस्ड
सब्जेक्ट
क्वेश्चन?
से हुआ, लेकिन घुस
वाज
दूसरे
देयर
सब्जेक्ट
इमेज,
में।
Cherry red postmortem hypostasis, as usual,
इमेज बेस्ड क्वेश्चन वर देयर इन योर
carbon
पेपर?
monoxide poisoning, and basophil stippling, lead poisoning, very commonly
Oh,
asked.
all right. So, sir, I hope that students are going to get a very insightful recall with all of us. And we are ready to proceed with our recall. With all your kind permission, can we proceed? And our first speaker
Yeah.
will be Dr. Ranjith, sir, with pathology, followed by ma'am. I hope you're also ready.
Yeah.
Yeah.
The
So,
doctor.
sir, thank you very much for joining all of us. मैं आप लोग को एक एक करके कॉल करके बुलाता रहूँगा. And the first person that is going to start will be Ranjit, sir. Welcome to the session.
Thank you, sir. Thank you, Siraj, sir. Thank you
Continue with pathology. Thank you
again.
very much, sir.
Amazing.
Bye guys, have
Speech.
fun.
Thank you, sir. Thank you. Thank you, sir.
Thank you, ma'am. Thank you, sir. So what we'll be doing is we'll be quickly going with the question, the right answer. If there's any problem, put in the comment section. We'll definitely look into it very soon. Fine. Okay.
And
So,
next, Amali.
Ready for the game?
अच्छा वो अपने आप ही वो नहीं उठाते
Just give me a second. The studios. Yeah. Just a second, guys. One second. Just give me a second. Okay, I'll start this recall. So let that video, it will be disturbance for some time and it'll be gone, right? So this is the first question, what we had, the symbol of the pedigree chart, right? So if you have a arrow mark, we have discussed in the classes already, it's about an adopted child. There are two things. If it comes in the next exam, please remember, dizygotic twins will be like a downward, but without a line in between. A monozygotic twins will have a line in between, right? That's how twins are represented. And if you look at this, if there are dotted lines, it's an adopted into the family. If there is no dotted lines and there's a bracket, that's about adopted out to the out from the family, right? So these are two things which you have to remember if it comes to the future question, right? That's an easy question. Tell me, was this question there? Let me know if there is any wrong wordings or the wrong options. If there is no wrong wordings or wrong options, the answer is very simple. Kaposi sarcoma hai, ek tumor ka vessels ka tumor hai, right? So vessel ka tumor will be reddish in color. Because it's a tumor, the blood will be a little bit altered blood, so it'll have a purplish color, right? A purple red and elevated lesion will be the perfect description for a Kaposi sarcoma. Can you guys hear me? Dr. Shubham says the voice is not clear. If the voice is clear, do let me know. The option D is the right answer. Perfect, guys. Perfect. If there's any mistake in the question or the options, please put in the comment section. I'll definitely take care of that, right? There are two questions in occupational lung disease. I'm sure this will be discussed in PSM as well as in medicine. The clue is very simple. Eggshell calcification tha, and an occupational history is there. And the right answer has to be in silicosis, right? Whether it be an X-ray or not an X-ray, eggshell calcification is equivalent to silicosis. And this dusra question of the occupational lung disease is a person who's a smoker and also a cement factory worker, that's an asbestos exposure with years developed mesothelioma. What's the answer? Perfect. The answer is to be an asbestos lung disease, right? Or asbestos induced mesothelioma. Mesothelioma, whenever the question has mesothelioma, answer has to be an asbestos exposure, right? Perfect. So there are two questions in occupational lung disease. Again, like all of the faculties discussed, it's an integrated session. So these questions will be repeatedly discussed again and again, right? So I was told that there is a clinical history with an image of a teratoma. I'm not sure if this is the exact image. Fine. Perfect, Dheeraj. I'll change to it. Sand mining industry. Okay, in the silicosis question, there was sand mining industry. I'll add on to it. Fine. Thank you, guys. Fine. Okay, perfect. So if we had a question of an ovary cystic mass with hair follicles and the teeth structure, answer has to be a mature cystic teratoma, which is an perfect. Thank you, guys. Which is an benign condition, right? Mature cystic teratoma is the answer and it's a benign condition. Amazing, great, right? So let's go on to this. I was given clues of Chinese eye appearance. That's the slanted eyes, right? And also about 5P deletion. There was a confusion whether 5P deletion is with Cre-Do chart or 1 Hippo-Lindo. It has to be Cre-Do chart. 1 Hippo-Lindo chromosome is in 3P, not in 5P, right? 5P deletion and your Chinese like unslanted appearance, it has to be a Cre-Do chart syndrome. That's the right diagnosis here, right? Great. Let's go to the next question. If you have any concerns, do let me know. I'm going to keep it faster so that you can get used to it soon. Dr. Raj, mature or immature teratoma can be differentiated only on a microscopy. On gross, we cannot differentiate it. Fine. Okay. Possible, Arun, if you're writing for NEET PG, stay till the end. Fine. And next question is multiple hematomatous polyps and also the oral mucocutaneous hyperpigmentation. Obviously, the answer is Peutz-Jeghers syndrome, right? Anything oral, perioral melanosis or oral hyperpigmentation patch with a colonic syndrome polyp has to be in Peutz-Jeghers syndrome. Again, this was a very, very easy one, right? Block to change. I think there was one more question on Down syndrome. People said there are questions on Downs as well as Cre-Do chart. If IP was not there, and still if the slanted eyes there, high pitch crisis, still go with Cre-Do chart. Fine. Okay, Zati, I'll do it. Fine. So this question was a bit tricky. I'm not sure I got mixed response. Some said it's a non-Hodgkin's lymphoma, CLL, and some said it's a question on anaplastic large cell lymphoma. If the question is on anaplastic large cell lymphoma, the answer is simple, translocation 2-5. If the question is smut cell and CLL, right? If you had CLL and if you have smut cell, okay, I'll take it into guys. Masum and Mani, thank you for it. Fine. The answer has to be in CD5 positive, CD23 positive of the CD markers. Was both the questions there? If it's a non-Hodgkin's lymphoma and it's about smut cells and CLL, the answer has to be CD5, CD23 positive. If it's about anaplastic large cell lymphoma, the answer has to be translocation 2-5 because the ALK gene and NPM gene has a translocation. Fine. Okay. Fine. So see, this is for follicular lymphoma. That's a non-Hodgkin's lymphoma. These two are for Burkitt's lymphoma. That also is a non-Hodgkin's lymphoma. Fine. Okay, let's go to the next one. Both were there. Okay, but Tommy, I'll add on to it. Fine. Great. This is a very simple question. Classical feature of gynecomastia, tall, stature, sparse hair, a male has to be a Klinefelter syndrome. What's the right answer? Come on, fastest finger first. A, B, or C, or D. A is 45X0, monosomy, that is Turner syndrome. This is normal karyotyping, right? 47XS plus 21 is Down syndrome, trisomy 21. The answer is your 47XXY as a classical case of your Klinefelter syndrome. Perfect. Okay, so we'll add that question as well at the end. Fine. So fibrillin 1 gene mutation, right? That's a very simple question. Which is the answer? Marfan syndrome is the right answer, right? Fibrillin 1 gene will be muted in case of a Marfan syndrome. Just add on, tell me this, whether this was a one-liner question or a scenario-based question. Was there a scenario of a tall person, subluxated lens? I'll add on to it. Otherwise, classical fibrillin 1 is a clue and the diagnosis perfect Marfan syndrome. Okay, let's go to the next one. Was there an image in this? Some students said there was an image, or some students said only HP bodies was mentioned in the question, right? Multiple small, whenever you had the question of central implication, answer has to be a molluscum contagiosum. Dr. Jazeer will also discuss about this, and microbiology also will have a quick chat about the molluscum contagiosum, right? Do let me know whether there was an image in this question, that's all. No image? Fine, perfect, let's take it down, okay? Great. Eosinophilic bodies mentioned, fine, Big Tommy. Eosinophilic bodies or images or your Henderson, your molluscum contagiosum bodies, the answer is molluscum contagiosum, right? Pap smear ka fixator. This is a very, very important question. The answer has to be in 95% ethanol. Formaldehyde is not the fixator for pap smear. Formaldehyde is a fixator for biopsies, not for pap smear. The answer is 95% ethanol, not formalin. If you are written here, please make sure you don't make the mistake next time, right? Great. Thank you, guys. What is the question? A simple one-liner, right? Pro-apoptotic factor. The only one is a pro-apoptotic factor is Bax. Some of them said the question was directed as which of the apoptotic factor will activate your cytochrome C. That also has to be in Bax. Fine. Okay, Gino, I'll definitely add on to that. Fine. Okay. So this question, I just want an answer. Was the options blue color, green color, or was the options trisodium citrate EDTA? The one thing was sure, the coagulation studies Vacutainer was asked. The answer is a blue top Vacutainer, the light blue Vacutainer, and it has trisodium citrate. Whatever was the question, we'll add on to it, fine? Okay, sure, Money and sure, Tom, we'll do it, fine? If it's a color, answer is simple, blue top Vacutainer. If it's the content, it's trisodium citrate, right? Thank you guys for the confirmation, right? Was this question there? Because like you guys said, some students said only Creduchat was there. Some said Creduchat was also there. And also a single transverse parma case, that's a simian crease was there, which is Down syndrome. If it is not too different, great. If it's two different questions, one was Creduchat, one was Down syndrome, fine? Okay, Shubham. Let me know about that also in the comment section. It is a different question. It's the same question, the Mongolian slant as well as a single parma crease. The answer is simple. It's a simple case of a Down syndrome. Fine. Okay, let's go to the next one. Basophilic stippling, like Manjunath has said, as a classical case of your lead poisoning is where you see the basophilic stippling. There was one more question with the INDFC anemia. That's why I marked INDFC anemia. But yes, you'll have basophilic stippling in case of a lead poisoning, right? So let's go to the next one. Was there an image in this question or only history? Eta, perfect. Great. Okay, guys, I'll add on to it, fine. Was there an image or was it only mentioned in the bronchoalveolar lavage, a crushed ping pong appearance? HIV history, crushed ping pong appearance. This is the GMR stain of the bronchoalveolar lavage. The answer is pneumocystis jirovecii or pneumocystis carini. Fine. Okay, Dr. DPK, I'll add to it the paint history in case of a lead poisoning. Fine. Pica with anemia, I have put it later, Shamals, I'll add to it, right? GMS stain cupping. This is a GMS stain cupping. That's a crushed pink ball appearance. The answer is a classical case of a pneumocystis jirovecii. Perfect. CD count was given. Okay, I'll add on to it as well. Fine. Okay. HPV, the most common cancer in the head and neck. Obviously, cervical cancer is the first one. If it's in head and neck, I'll go with oropharyngeal carcinoma. That's the most common in the head and neck region, caused by human papilloma virus. Fine. Okay, great, guys. Fine. So someone said about the pica and anemia question, right? A child with a history of eating sand and the image is given like this. What's the diagnosis, right? That's a lymphocyte. The cell is smaller than the small lymphocyte. So the answer has to be a microcytic anemia. With a history of pica, the answer has to be an iron deficiency anemia, right? The medical minute, even if the oral cavity was there, oropharyngeal carcinoma will be a better answer. Fine. Okay, pica wala has to be an idea. That's an easy one, right? Okay, let's go next one. This is the only question I said might have been a little bit of new for some of you, right? Or this is a very old repeat. If you have seen that repeat also, that's great. SOD1 gene mutation is classically SOD1. That's nothing but superoxide dismutase. In the superoxide dismutase is mutated with respect to your amyotrophic lateral sclerosis, right? I'm sure this must have been covered in your medicine as well, fine. Abhi, IDA and paint, I think the different questions hai. Paint wala hai lead poisoning, IDA is pica wala, that's different question, right? Even if head and neck is not mentioned, if only HPV is mentioned also, the answer will be oropharyngeal carcinoma, fine? Okay, got guys, that's all with pathology. I've just gone to quick recall of all the questions so that you can get a hang of it, and if you're giving a NEET PG exam coming by, I'm sure this will help you guys, fine? Okay, SOD was in the options. Okay, so this was in the options. I'll change it soon. Fine. Okay, Big Tommy. Okay, got it. Fine. Fine, Dr. DBK. I'll change that. Some students said it's also anaplastic large cell lymphoma. Some said the smut cells or the basket cells along with that CD markers. I have given both onto it. Fine. CD marker, Big Tommy, is CD5 and CD23. If it is CLL. Okay, Santhosh is also helping us with the SOD1 mutation, and I'm sure he will also take up that question. Fine. So that's all with pathology. Sudha ma'am, next to you, over to you.
Thank you, Dr. Ranjith, for that almost complete recall of pathology that you've given us in such a short time. Ophthal was, how was Ophthal? Ophthalmology, you had 40 questions. Ophthalmology was difficult, many questions. But everybody is saying that there were many questions, but you are not being able to recall. Because I asked so many kids, hardly like 10 questions I have with me, though everybody is saying that there are like 25 questions. Okay, let us see if we can recall them. Yeah, this question definitely, this I think all of you would have been able to recall. This is the question on Sturm's conoid, which is a repeat question. It is a PYQ. And it's a PYQ, not even a PYT, this Sturm's conoid. And it was asked, I think, that this depicts which kind of refractive error. So yes, so this depicts regular astigmatism. I don't know whether they had both regular as well as irregular astigmatism in the options. The answer to this is that this is depictive of regular astigmatism. Yeah, so that was the question. Was this the question? Only astigmatism was there in the option, so of course that made it even more easier. So it is not, you don't have to even think about regular astigmatism. So ye to chalo easy question mein aa gaya. Right. Now the next question, again, one of these two images was there. Ab I don't know ki kaun sa tha, right? Which of these was there in the option? The first one or second one? Yeah, this is number 1 and this is number 2. I think it was a complete image based question जिसमें image दिया हुआ था और हमें diagnosis बोलना था. Yeah, the first one. Okay, so the first one is Herbert Spitz, which is seen in trachoma. ये था, this was the question. Yeah, correct. So the second one is HD spots, which is seen in VKC, vernal keratoconjunctivitis. So ये second वाला नहीं था. It was not the second one, it was the first one. Correct. So this was also another direct question. क्योंकि ट्रकोमा जो है ये हमारा, we always say that एक question तो ट्रकोमा से या फिर विटामिन ए से ज़ेरोफ्थैल्मिया से एक्सपेक्टेड है ही. So this is like a sure shot question. ये भी we have to count it out in the easy. Yeah, they just asked whether it is Hubbard Spitz. Yeah, so ठीक है. So the first one, this is also another easy question. Up next, I think there was this question which said that there is a patient of pituitary adenoma who is presenting with bitemporal hemianopia, and what is the site of the lesion? Something like this. Pituitary adenoma, bitemporal hemianopia, dono hi, these are the two keywords. Pituitary adenoma, bitemporal hemianopia, we always say it so many times in the class, the site of the lesion is optic chiasma. है ना? तो ये भी easy question है, तीसरा easy question है. Next one also, this is a direct question जो बच्चों ने recall किया कि अच्छा, they asked optic chiasma is being compressed, and what is going to be, अच्छा, they said optic chiasma is being compressed and bitemporal hemianopia. So you had to choose pituitary adenoma as the answer. Okay, pituitary adenoma is compressing the optic chiasma. What is the expected field effect? That was the question. Right? So pituitary adenoma is compressing the optic chiasma. Yeah, what is the expected field defect? That is bitemporal hemianopia. हाँ, so वही ऑप्शन में विजुअल फील्ड डिफेक्ट्स के नाम थे. A patient with pituitary adenoma, which is causing compression of the optic chiasma. What is the expected field effect? The answer is bitemporal hemianopia. Yeah, ये भी, this is, I would not even call this a PYT. This is a PYQ. ये बहुत बार आ चुका है हर एग्जाम में. Right. Now the next one. Next, there is a question which says that there is a myopic patient who presents with complaints of flashes and floaters. Probably it was mentioned that there is a deep anterior chamber. ऐसे कुछ था, that the keywords that I could make out in the question were, they said that the patient is a myope, or they may have said high myope. They mentioned that the anterior chamber is deep, and they said that there is a complaint of flashes and floaters. Right? So if all this is there, then it is, the answer is obviously rhegmatogenous retinal detachment. It is rhegmatogenous retinal detachment, rhegmatogenous RD. Rhegmatogenous retinal detachment. Right? And I don't know whether they actually gave this image also. ये मुझे पता नहीं है, कुछ बच्चे बोल रहे थे कि image था. ये image था क्या? This image of posterior staphyloma. This is typically a picture of posterior staphyloma. There was no image. नहीं था, ठीक है. So let's leave that. So that means the question was this kind of a question, that there is a myopic patient and complaints of flashes and floaters. What is the diagnosis? IDO finding. Yeah, so was rhegmatogenous detachment there in the option or no? Rhegmatogenous RD was there in the option. So what were there in the option? Okay, posterior staphyloma is the IDO finding. Correct. So they said that posterior staphyloma is seen on IDO. Okay. Posterior staphyloma, they said that myopic patient hai, and on IDO it shows posterior staphyloma and rhegmatogenous RD. Okay, there was no image. So again, rhegmatogenous and RD is there, or RD, whichever is there, that is the answer. ठीक है, तो ये भी, this question also has come, ये flashes and floater, myope, posterior staphyloma, these are like the key words. And अगर ये दिया हुआ है, RRD mention होने में नहीं difficulty होना चाहिए. Okay, now there was this question with Hirschberg test, I guess, जिसमें there was a question of exotropia या isotropia. क्या था? Was it iso or exo? Isotropia, ये जो पिक्चर मैंने डाला है ये isotropia का है. Iso था या exo था? It was exo. It was exo, correct. ये iso है, but the question was exotropia, right? The question was exotropia. ठीक है, लेकिन एक्सो है ईजो है, बट आई थिंक व्हाट दे वांटेड टू शो वाज दैट ये जो तुम्हारा रिफ्लेक्स है, द प्यूपिलरी रिफ्लेक्स, दिस इज एट द लिम्बस, राइट? दिस इज एट द लिम्बस. हाँ, ओके, इट डजंट मैटर वेदर द राइट आई वाज आउटसाइड और द लेफ्ट आई वाज आउटसाइड. The reflex was at the limbus, right? So 45 degrees. Did it say 45 degrees? If either they would have said 45 degrees or they would have said 90 prism diopters. इन दोनों में से कोई एक ऑप्शन में होना चाहिए. Did they say, it cannot be 90 degrees. 90 degrees नहीं हो सकता है. It is either 45 degrees or it was 90 prism diopters. हाँ, तो ये 90 prism diopters है, not 90 degrees. It was 90 prism diopters, not 90 degrees. It is 45 degrees, but 90 prism diopters. But it was not ESO, na? It was EXO. हाँ, ये जो picture है वो ESO का है because the eye is deviated inwards, but it must have, but what you're saying is it was a picture of exotropia. So exotropia, 90 prism diopters was the answer. Yeah, I agree. Question का language different होगा because see, तुम जैसे बच्चों ने recall किया है. Yeah, now I'll come back to that previous question जो हम discuss कर रहे थे. Some of you are saying that there were two questions. One was on rhegmatogenous RD and the other question was on posterior staphyloma. Were they two different questions? Were they two different questions? They were two different questions. हाँ, एक्सो था. I agree. मैंने picture ये I have put the picture of ESO, but because some students told me ESO, that's why. एक्सो होगा तो the eye will be deviated outwards. But if this is at the limbus, then it's 45 degrees or 90 PD. Okay, so myopia and posterior staphyloma were two different questions. So what was the question on posterior staphyloma? That posterior staphyloma is seen on indirect ophthalmoscopy. What is the diagnosis? If posterior staphyloma is seen on indirect ophthalmoscopy, the diagnosis is myopia. Was that the option? Myopia tha option mein. Posterior staphyloma is seen on IDO. Was that the question? Okay, we'll come back and we'll come back to this question because we will have to get to the root of this. I'll just add it in the final recall. We will add it in the final recall. There were two separate questions. Okay, this question, the answer is 90 PD, bacha. It is not 90 degrees. It's not 90 degrees. Then there was a very easy question that there is a patient who presents with sudden onset pain, redness, and the important keywords were that there is a hazy cornea, there is mid-dilated pupil. Hazy cornea, mid-dilated pupil were there. Did they say that it is an elderly female patient? It said that there is an elderly female patient, sudden onset pain and redness, hazy cornea, mid-dilated and fixed pupil. And did they say shallow anterior chamber? Right? So, ye to obviously this is acute angle closure glaucoma, if this was the question. Acute angle closure glaucoma. Acute angle closure glaucoma, or it can, they may sometimes say acute congestive glaucoma also. Yeah. So then there was a question about a contact lens associated corneal ulcer. I believe that there is a patient who is a contact lens misuser, and he develops a corneal ulcer. And did they mention the question ring ulcer in the question? Ring ulcer mention किया था, contact lens misuser and ring ulcer, these two words, keywords were there. हाँ, तो ये दो keywords अगर है तो हमें पता है कि हमें क्या मार्क करना है. It is acanthamoeba. Did they mention ring ulcer or they didn't? If they did not mention, ring ulcer. Were there two questions on keratitis or one question? There were two questions on keratitis. Okay. So there were two questions on keratitis. What was the question on contact lens misuser? Okay. There was one question which says that there is a long branched ulcer. Was it an image-based question? Long branched ulcer? See, contact lens misuser सिर्फ अगर mentioned है and ring ulcer mentioned नहीं है, image mentioned नहीं है, तो was there pseudomonas in the options? Was there pseudomonas in the options? No? See, some of you are saying that they mentioned the shape of the ulcer. If they have to say contact lens ulcer, some history of pseudomonas, they have to say that it is a ring-shaped ulcer. If they have mentioned something like this, then the answer is acanthamoeba. And then you are saying that there is another question where they are saying that there is a long branched ulcer, something like this. Pseudomonas was not there in the option, so ring ulcer hoga. And there is a long branched ulcer. The second question on keratitis, a branched kind of an ulcer. Did they mention something like this? Did they say that it is painless? Was the word painless mentioned? Did they mention it was painless? Long branched ulcer with desquamation, and they mentioned it was painless. Then the answer, obviously, if they say painless, तो वो dendritic ulcer है. Branched ulcer with desquamation, and if the word painless is mentioned. See, these are the keywords. Contact lens misuser में if they don't mention ring ulcer, तो फिर हम acanthamoeba नहीं mark कर सकते. Similarly, if they, unless they say painless ulcer with desquamation, then only we can mark dendritic ulcer. So these options, or they have to, or it will be HSV or something like that. What was the question on meibomian glands? What was the question on meibomian glands? Can you recall it for me? Okay, did they say that there is a painful lid swelling? Was the question, did the question say that there is a painful lid swelling and the point of maximum tenderness or the pus point is at the lid margin? Pus point is at the lid margin or at the base of eyelash? Yeah, base of eyelash mentioned tha. Base of eyelash. Base of eyelash means it is stye or it involves the gland of Zeiss. Was this the question? Or did they mention it is lipogranulomatous inflammation? Or did they mention lipogranulomatous inflammation? If the question is lipogranulomatous inflammation, then the answer is meibomian gland and it is chalazion. But if they say it is at the base of the eyelash, then it is gland of Zeiss. Okay, different. Yeah, I think all of you are just very, very tired. Like one person is saying yes and the other person is saying no. If they have mentioned base of the eyelash, it is Zeiss only. Gland of Zeiss. It is the gland of Zeiss. So we'll come back with the, I think the questions were probably too clinical. So that's why some of you have just got confused as to what exactly the question was. So let's go to the next recall. We will come back with a full recall of the questions and with all the options. So I will give over to the next faculty who is next in line. Okay, it is Dr. Oishika.
Hi,
So,
ma'am.
and this time second paper was full of gynae.
Yeah, I heard.
Yeah, so now I think, but I think it went well.
Yeah,
Most
hopefully for everybody it was very good. And obviously you never feel good coming out of an exam. Hopefully the result will tell us something else. Yeah.
Yeah, anyway, over to you, Dr. Oishika.
Thank you, ma'am. Okay. So hi guys, welcome to the OBG recall. And I heard the second paper had a lot of questions. So obviously I talked to as many people as I could and I tried to get as accurate a recall as possible, but that had not been possible. But basically I have gotten a basic idea of what were the topics from which the questions were asked. And here's hoping you guys will be able to help me pinpoint what was the exact question so that we can discuss the answer. Right. Okay. A lot of questions. Okay. Full OBS was there. Okay, great. But luckily for us, OBS is not a very difficult subject, right? Right? Okay. So let's start with this. Yes, Hagar's question. So I believe this was the question that was given to you. This was the question that was given to you, and they had asked you what is the sign. So what are we doing over here? Bimanual palpation. And what is the area where we are doing the bimanual palpation? It is between the body of the uterus and the cervix. What is this part called? This is called the isthmus. So this is a soft isthmus that is getting compressed between the two hands. So what is this? This is Hagar's sign. So I believe this was the picture that was given to you. Right. So this is at the isthmus. So this is a soft isthmus, Hagar sign. Bluish discoloration is a separate sign, Dr. Shalu, that will be called Chadwick or Jacquemer sign. So in that you will have a completely different picture in which you will be shown the perspeculum of a cervix that looks slightly blue. Right. So this was question number 1. Question number 2, I think, was percentage fixative that is used to do a pap smear. And the answer is 95% ethyl alcohol or ethanol. Ethyl alcohol, ethanol, all the same thing, right? So 95% ethanol is the fixative that is used for pap smear. I saw a lot of kids mark 90%. I don't know if that was in the options or you're not able to recall it was actually 95%, but the answer was 95% ethanol. Okay, moving on to the next. This is the one in which I keep drawing a silly diagram. OCP prevents all except. So above the level of the umbilicus, everything, the risk increases. Below the level of the umbilicus, the risk decreases. So ovarian decreases, endometrial decreases, colorectal cancer decreases, right? And above the level of umbilicus, which will mean your hepatocellular cancer, HCC, the risk increases, breast, the risk increases, and this is where it gets silly. Cervical, the risk increases. And in cervical specifically, the risk of adenocarcinoma increases, and this is a reversible risk. अगर ये OCP लेना बंद कर देंगे, तो the risk of her cervical cancer will go back to normal, right? Yes, exactly, Dr. Devaki. Okay, so what is COPE app test? We'll just come to that question in a little bit. The next question, I believe there was a question that was asked on Bishop score. So they had given you the different parameters कि इन्होंने examination किया and what were the different findings that they found, and they asked you what is the Bishop score? What is the Bishop score? So yeah, what is the Bishop score, guys? What did you guys mark? So 2 centimeters dilated will have a score of 1. 20% effaced is going to have a score of 0. Soft cervix is going to have a score of 2. Midline is going to have a score of 1, and vertex at -2 is going to have a score of 1. So what is the total score? 3 plus 1, 4, 5. So the answer is 5. This is an unfavorable bishop. So if they had asked you whether this is a favorable or unfavorable bishop, then the answer is, remember, favorable is what? Favorable is more than equal to 6. More than equal to 6 is favorable. Usse kuch bhi kam hoga, that will be unfavorable. That is number 1. Number 2, method in which slight variation in which they could have asked you the question was, in which case will you use oxytocin? So remember, oxytocin is used only if the bishop is favorable, if it is more than equal to 6. Otherwise, you will use some other induction agents like prostaglandin. Not just 7, it is more than equal to 6. So it is unfavorable. So over here, it is unfavorable. So if these were the exact parameters that were given to you, your score will be 5. Okay, I believe another question, every question I know had a scenario. Now, the thing is, everybody is not able to give me the exact scenario in the recall. So I have just, boiled it down to the essential points that were required for you to solve the questions. If there were any additional details that were given to you, please let me know in the chat box so that we can frame the question better. Right. So yes, remember shoulder dystocia, I've always told you helper, H call for help, E for extend episiotomy, and L for legs. What do you do to the legs? You flex the knees, hyperextend and abduct the hip joint. The answer is McRoberts maneuver. McRoberts maneuver. Absolutely correct. All of you guys are right. Coming to the next question, I believe an image was given to you. So it was either of these two images, and they had asked you what kind of cerclage are we placing. I believe these were the two kind of images that may have been given to you. So do tell me, was it image number 1 or was it image number 2? Was it image number 1 or was it image number 2? Whether the right eye was outside or the left eye. The first one, this one was given, all of you, sure. All right. So what did you guys mark? Yes. So what were the options, guys? Was it Shirodkar, McDonald's, and two completely separate options, or was there modified Shirodkar, modified McDonald's? What were there in the options? Okay, so understood. This question, this image was not given. The first image was given. I want to know what the options were. So one was McDonald's, one was Shirodkar's. What were the other two? Modified was there for both. So modified McDonald's and modified Shirodkar's. What did you guys mark? So this is definitely not McDonald's. This one is McDonald's, guys. This one is McDonald's, where we are using a purse string suture. The basic difference between McDonald's and Shirodkar is ek to the presence of thread versus tape. So you can see over here, we are using tape. Over here, we are using a thread. Right. That is not the main difference. The main difference is, even though this is a difference, the main difference is Shirodkar is a higher cerclage. We place it higher up on the cervix. So they had given you a history of recurrent pregnancy loss was also given. So higher on the cervix means what? You will see in the picture that there is a dissection of the UV fold. Not the UV fold, but not uterus, uterus is not here, vesico-vaginal fold. So what we are doing is, this is a vesico-vaginal fold and we are pushing the bladder up. So that is the way that you will identify Shirodkar. Now, how to identify? No, McDonald's is not the answer. The answer is either Shirodkar or modified Shirodkar. So what is the modification of the Shirodkar technique? Modification of the Shirodkar technique is, at the end, none of the suture material is visible to reduce the chances of infection. So what do we see over here? That after placing the tape, we have buried the entire tape. The knot is not visible. Knot is not visible. Knot is not visible. The entire tape has been buried in the vaginal fold. After we cut this, we suture this back again after the tape has been placed. So the answer is modified Shirodkar. Modified Shirodkar. Helper mnemonic, I have already told you. H stands for call for help. E is extend or make your episiotomy. L stands for legs, which will be your macroburts. P will stand for what pressure? What pressure? Suprapubic. Suprapubic pressure. This will be your second maneuver. 90% of your babies will deliver with this. But if this does not work, then you have enter maneuvers, which will have your Wood's corkscrew type of maneuvers and Rubin's maneuvers. And finally, R is roll on all fours. So this is your Gaskin's maneuver. This is your Gaskin's maneuver. No, the answer is not McDonald's. The answer is modified Shirodkar. Okay, I believe the next question that was given was, after placental delivery, bleeding is not controlled by oxytocin. What will you do next? So what I want to know in this question is, was this a normal delivery? Was this a cesarean delivery? Was this a normal delivery or was this a cesarean delivery? So if this was a vaginal delivery, the next most logical step is going to be what? It is going to be balloon tamponade. But if they have given you cesarean section, then the easiest thing to do, what were the options? What were there in the options? Balloon tamponade, was compression sutures there in the option? Was compression sutures there in the option? So if compression sutures were there and LSES was given to you, if it was given to you, then you could have gone for compression sutures. Then I believe there was another question that was given to you. This is what they had asked you to identify it. Was that what the question was? They had asked you to identify the specimen. Ye kya hai? You see a tumor that has a lot of hair. It has some cheesy caseous material. It has a lot of things. What is this? Excellent. So this is a teratoma. So I don't know what the other options were, but if it was given as a spotter, then plain and simple, this is the easiest question you could have gotten in OBG. Right. Okay. Moving on to the next question. A woman had a delivery and after that the mother developed abdominal pain, breathlessness, hypotension and tachycardia. So we are talking about a third stage complication जिसमें अचानक से collapse हुआ है. There has been a sudden collapse. There has been a sudden collapse. Right. And shock was out of proportion to the bleeding. So remember, immediately after delivery, if the woman collapses, we have three differentials. So the first two things that can happen is uterine inversion and you can have amniotic fluid embolism. And a little later, you might see bleeding. After placental separation, you can see PPH. Right. But what you see over here is shock was out of proportion to the bleeding. So bleeding is not much. Right. So this patient could be having uterine inversion or amniotic fluid embolism. But examination revealed this. What is this? What is this? Same picture. Great. So this is uterine inversion. This is uterine inversion. All right. Great. Okay, moving on to the next question. So there was a question where they had given you a clinical scenario on a woman who is in labor. Retained placenta was in the options. Okay. So if it is retained placenta, guys, remember, retained placenta rarely ever leads to sudden collapse immediately after delivery. Retained placenta mein, what will be the problem? In case of retained placenta, the reason why the woman goes into shock is bleeding, right? What do we see over here? Bleeding is bleeding is not that much, but the shock is out of proportion. And in the examination, you see this. What is this mass? This is the placenta plus uterus that has been removed. Right. Remember, in retained placenta, you will not be able to remove the placenta. Of course, ये जो mass बाहर आया है, that is a mixture of the uterus and placenta. So the placenta is kind of retained, but that is because you did not probably give oxytocin or you pulled the placenta too hard. It's not really a retained placenta. Right. Okay. Moving on to the next question, a patient presented with bleeding per vaginum and tense tender abdomen on palpation. Her BP was also high, 150 by 100, and she is already in active labor, 5 centimeters dilated and full effacement. Fetal heart rate seems to be going absolutely fine with adequate beat-to-beat variability. What is the likely diagnosis? What did you guys mark? What did you guys mark? So whenever you see these words, tense, tender abdomen, and she had bleeding PV also, what are we talking about? What are we talking about? We are talking about abruption placentae. Abruption placentae. So was this a question, guys? This is one of the questions that I got in the recall, and there was another question I got where the placenta was invading the bladder. Ye wala nahi tha. Okay. So I believe another question was there where what they had said was, yeah, what they had said was there was a clinical scenario where they had said that the placenta was attached to the bladder. Placenta was attached to the bladder, and they had probably given you on ultrasound there was a very high color flow, right? So attached to the bladder, remember, we are talking about placenta accreta spectrum or pars, placenta accreta spectrum or pars, right? And this is a spectrum. इसमें बहुत सारी चीजें हैं. There are 3 entities in this. Specifically, they had asked you what is the entity? Is it accreta, increta, or percreta? So remember, I keep telling you this. If this is the placenta, this is the endometrium, this is the myometrium, and this is the serosa. And in front of the uterus, you will have the bladder, right? So placenta, this is your normal. When it attaches to the myometrium, A, accreta, attaches to myometrium. When it invades the myometrium, I, increta. And finally, P, when it perforates the serosa, percreta. So what is the answer, guys? What is the answer? So the answer over here is placenta percreta. So bladder pe it will attach only when it perforates the entire uterus. पूरे uterus को perforate करके आगे वाले organ में जाके चिपक गया है, right? Which means it has perforated the uterus, so it is placenta percreta, right? So this was the question that was given to you. This question on abruption was not given to you. All right. Okay. Then there was a question, there's a bit of a confusion. Was the question, what is the hormone that is responsible for milk formation? Or had they given you a picture of the breast with alveoli and ductal system, and they had labeled this and asked you what is responsible for this development? What was the question? Was it milk formation? Was it responsible for milk ejection? Was it which is responsible for development of these ducts? Breast image with label, right? So what I want to ask you is, what was the part that they had labeled? Was it these ducts or was it these lobules and alveoli? Was it 1 or was it 2? All right. So if they had given you a picture of the breast, see, ductular development is due to estrogen. and your alveolar or lobular development is due to progesterone, So was it a question where in one option you had both estrogen and progesterone? So if there was any option in which both estrogen and progesterone were present, then that will be your answer. There was no such option. In lactating mother, they had asked you what is the hormone responsible for milk production, or they had asked you what is the hormone responsible for development of the ductal and alveolar system. Had they, see, if it was milk ejection, then it is going to be oxytocin. So let's talk about a lactating mother. If it was a lactating mother and they had asked about what causes ejection of milk, then it is going to be oxytocin, right? If they had asked you what is responsible for milk formation, then it is going to be prolactin. And if they had asked you what is going to be responsible for ductular development, only it is going to be estrogen. But they ask you what is going to be responsible for alveolar development, it is going to be progesterone. But if you have to answer a single best for development of your ductular system or alveolar system, basically it is in pregnancy, it is the progesterone that is causing the growth of the breast. So the best thing to mark over here was progesterone. So arrow was given where, guys? Where was the arrow given? Marked both, answer anyone. So in that case, if it was a lactating woman, then it is better to go for progesterone if she was lactating. Right. If she was lactating, then remember in pregnancy, the major hormone that is causing the hypertrophy and hyperplasia in the breast system is progesterone. If we are talking about a non-lactating woman, girl in her puberty, if they ask you single best answer, then it is going to be estrogen. Right. Prolactin is the answer for formation of milk, Dr. Akhil. It is not responsible for development of the breast. Right. Okay, now I believe there was another question where they asked you IUCD is what is an absolute contraindication for IUCD? Absolute contraindication for IUCD. What were the options that were given to you? So remember, absolute contraindications for intrauterine copper device are going to be pregnancy, undiagnosed vaginal bleeding. IUCD was not asked. What was asked? Was it implant? Had they asked you about IUCD or had they asked you about implant? Okay, so implant was asked, that's what you are saying, and they had asked you what is the absolute contraindication. So what were the options, guys? What were the options that were given to you? IUCD only was asked. Okay, IUCD was asked. So if IUCD was asked and if you had a question that said either pregnancy, undiagnosed vaginal bleeding, or if they said active PID or STI, right? Or they said something like Wilson's disease or post-evacuation of H-mole. These are the only things that are absolute contraindications of IUCD insertion. Rest all, if they are a contraindication, they are relative. So if undiagnosed vaginal bleeding was present, this will be your answer. Feeding child, you can give it in feeding child. So I believe there was a question on partogram. Can somebody help me? Achha, MEC classification was asked. So MEC classification, was this a separate question or the same question as IUCD? Dr. Anand, MEC classification. So absolute contraindication means MEC 4. So there is MEC medical eligibility criteria 1, 2, 3, 4. 1 is safe to give, 2 is somewhat safe, 3 should be somewhat avoided, 4 is absolute contraindication. So in OCPs, MEC1 was asked. So what that means is that what is absolutely safe, like if, in which case is it absolutely safe to give the mother OCPs? In diabetes, in hypertension, in HIV, what was the last one? What was the last one? OCPs, MEC1. So one was hypertension, one was diabetes, one was HIV. Can anybody tell me what was the fourth option? So of these, remember in hypertension and diabetes, there is a risk of metabolic syndrome already in this person, right? So HIV is going to be safe. So you can give it in HIV. You can give it in HIV, but the problem with HIV is that depending on what drugs this woman is on, there might be a, sort of enzyme induction in that case also. So I will be needing the fourth option for this. Yeah, so if the fourth option was hyperlipidemia, then please, the most appropriate answer over here is going to be HIV. If hyperlipidemia was the fourth option, then remember the other three options except HIV increase the risk of metabolic syndrome, increase the risk of cardiovascular accidents. OCPs also increase the risk of cardiovascular accidents, right? Okay. So I believe there was also a question. Okay. On partogram, there was a question on partogram. Can anybody tell me what was the question on partogram? I think there was an image-based question and I don't have the image yet. So if anybody can tell me what kind of an image was given to you, then maybe I can help you with that. Right. Was it the old partogram or the new partogram? Okay. So till you guys tell me about the partogram, I am going to, picture was given, Dr. Chinu. What was there in the picture? Where was the line? Was it on the alert line, action line, between the two? What kind of picture was given to you? If you could just elaborate. So I believe there was another question where they had given you, there's a woman with a history of amenorrhea and she has history of multiple DNCs, and they had asked you what is the reason for her amenorrhea. Can anybody tell me? Can anybody tell me? So this is a clear-cut picture of what we call Asherman syndrome. Asherman syndrome. Okay, so partogram, you are telling me there was a picture that was given. It was between alert and action line, between alert and action. Can you also tell me what else was given? What was the exact question? They had asked you, how is the labor proceeding? Was it active labor? What was the kind of thing that they had asked you? Please let me know. Right, moving on to the next question. Variable decelerations are seen in, very, very simple. I have told you this multiple times. Wheel chop, wheel chop. Right, so variable is for cord compression. Variable is for cord compression. Early is for head compression. Accelerations are okay. Late decelerations are due to placental insufficiency. Dilation was mentioned. How much was the dilation? Please, Dr. Anand, let me know the details about the partogram. Or if you could just draw it and send it to me, that would also be helpful. Okay. Then I believe there was a question asking you what is the type of perineal tear. So I think they had asked you that more than 50% of the external anal sphincter has been torn. Was this the question? More than 50% or less than 50%? Was it more than 50%? Okay, so if it was less than 50%, then guys, absolutely right. If it is less than 50%, then it is going to be a 3A tear. More than 50% is going to be 3B, and EAS plus internal anal sphincter is going to be 3C. And if you have the rectal mucosa also torn, it is going to be a 4th degree or a complete perineal tear. So 3A is the correct answer in this case. Now, I believe another question was asked in which they had given you basically a situation where the girl had thelarchy, she had breast buds, and nothing else, and they had asked you what will happen next. So remember, after thelarchy, what do we have? After thelarchy, we have pubarchy or adrenarchy, and after that, we will have the peak growth velocity. peak growth velocity, and finally we are going to have menarche. So what we expect next in this girl is pubic and axillary hair. Pubic and axillary hair. Absolutely correct. Pubic and axillary hair. All right. Now, I believe this was a question that was given to you. They had shown you a maneuver and they had asked you to identify what is the use of this maneuver. Mother took 12-year-old girl to doctor with breast buds and axillary hair, asked about the next stage. So if she already has breast buds and axillary hair, she's going to get pubic hair next. If she has breast bud, axillary hair and pubic hair, then she is going to start growing in height really fast. All right, menarche, remember menarche is the last stage of pubertal development in girls. It is the last stage of pubertal development in girls. Right. So pubic hair, if it was already there in question, then your answer is going to be peak growth velocity. This is the flow chart. So remember, whatever option they had given you, if they had told you just the breasts are developed, then next what is going to happen? Pubic and axillary hair is going to come. If they have given you that pubic and axillary hair and breast both are there, then next she's going to grow in height a lot. If that is not there in the options, then the next step is going to be menarche, obviously. Right. So this is about that. Then the next question that they ask you is this maneuver. What is this maneuver, guys? This I have told so many times. This is the Ridgens maneuver. And I think they had asked you, what is this used for? This is for prevention of tears during delivery. Vaginal discharge in your stages of development. No, don't mark that. So was this the question on Ridgens maneuver or was something else asked? Was this the question on Ridgens? Yeah, they had asked something else. Okay. Moving on, was there any question on ectopic pregnancy and how frequently do you monitor beta HCG? So was there any question on pregnancy of unknown location? They are trying to find out where the pregnancy is. They haven't been able to find the pregnancy anywhere and they're asking you how often they should repeat the beta HCG. When do we check? Very good. So if you do an ultrasound and there is no baby in the uterus, there's no pregnancy in the adnexa, then how frequently do you check? The answer is every 48 hours. Every 48 hours or 48 hourly. So 48 hourly, we are checking for beta HCG. So that would be your answer. I believe there was a question, image-based question on a non-stress test. I don't know what was the aim of that question, what exactly they had asked in that question. So if anybody can tell me, that will be helpful. Why we use this maneuver? So this maneuver is used to prevent tears. Yeah, so the answer will be 48. Okay, great. NST, they had given you an image-based question. Can anybody tell me what was the question? What exactly were they trying to ask in that question? Yeah. Okay, there was another question where they had asked you about co-testing. They had asked you about co-testing. So what is co-testing? Co-testing, guys, remember, is a combination of two tests, pap smear plus one more thing. What is that? HPV DNA. Was that all they had asked? या कुछ और भी था? कुछ और भी था या was that all that was asked? Tear was not in the option. Dr. Anand, can you tell me what were the options in Ridgen maneuver? Can you tell me what were the options in Ridgen maneuver? Then I can tell you what was the answer. Okay. So just let me know what were the options in Ridgen maneuver. Right. And I believe there was another question where they had given you a picture of a unicornuate uterus or they had told you, given you, a Mullerian anomaly that was basically a unicornuate uterus. And they had asked you, why does this happen? So this is due to, was this a question? This is due to failure of formation of one side of paramesonephric duct. Tear tha to protect the perineum. So basically, when I say prevention of tears during delivery, that means prevention of perineal tears. right? Okay. Moving on, was there a question on fetal anemia? Failure of fusion में आपका unicornuate नहीं बनेगा. Unicornuate will be formed when one forms, the other does not form. When you have complete failure of fusion, it is going to be didelphys. If you have a partial fusion, it is going to be bicornuate. Right? Moving on, fetal anemia. Fetal anemia monitoring के लिए, what is the vessel that we used? I have told you multiple times, it is middle cerebral artery. Middle cerebral artery, उसमें हम peak systolic velocity देखते हैं. That is what we see. Order of puberty question I have already told you, which is the one on thelarchy. There was no question on unicornuate uterus. Okay, great. Better if there was no question on unicornuate uterus, since some people might have gotten it wrong. So yes, middle cerebral artery was the answer. Was there any question on flexion point? Where do you apply the vacuum? Where do you apply the vacuum or flexion point? So flexion point, if there was a question, some kids are telling me it was there. It is 3 centimeter in front of posterior fontanelle, or 6 centimeters behind your anterior fontanelle. So that will be your answer. Was there any question on uterine rupture in Tolac? Was there any question on uterine rupture in Tolac? Was there any question on precocious puberty? Yes, absolutely. Absolutely correct. So it is 3 centimeter in front of posterior fontanelle and 6 centimeter behind anterior fontanelle. Can anybody tell me if there was any question on androgen insensitivity or precocious puberty or uterine rupture in Tolac or Bandel's ring? I believe there was a question they had given you 47XXY and they had asked you what is this syndrome? This is Klinefelter. Was this the question that was given to you? Do let me know if they had asked you about what is the name of the ring, or what is the ring that is formed in impending uterine rupture or in obstructed labor. So that is called Bandel's ring. Was there any such question, guys? Tolac pe, what was the question? Can anybody tell me? What was the question on Tolac? Okay, so in Tolac, they had asked you uterine rupture, and had they asked you what is the first sign of uterine rupture? What was the question that was given? Please tell me the exact question so that I can help you. What was the question on androgen insensitivity syndrome? What was the question on precocious puberty? Do let me know. And some people are telling me there was a contraction ring question. So it is not exactly a contraction ring. This is a pathological retraction ring that is formed in cases of obstructed labor. And this has another name. This is called Bandel's ring. This is called Bandel's ring. This is called Bandel's ring. Right. So if you guys could give me some details on what were the questions on precocious puberty, AIS, and what was the exact question on Tolac, and exactly what was asked in partogram, then we can have a better, sort of discussion on this. Right. So that's it for the OBG recall, and I would invite the next person for the class. Thank you guys. All the best for your results. So we have Alekhya ma'am next. Yeah, sign of uterine rupture. Just a minute. I'm sorry, Alekhya ma'am. Sign of uterine rupture while fetal monitoring in Tolac. The first sign that you will see, guys, is going to be fetal tachycardia. The first thing that you're going to see is fetal tachycardia before you see any of the vaginal bleeding, hematuria, before you see maternal tachycardia. The first change, not just in fetal monitoring, overall, the thing that you will see is fetal distress or fetal tachycardia. All right. So with that, I'll hand over to Alekhya ma'am. Thank you, guys. Thank you. All the best for your results. Face presentation, what had they asked? What had they asked on face presentation? Face presentation, had they asked you what is the diameter? What is the diameter of face presentation? Was that what was given to you? So remember, I keep giving this mnemonic sub soft khake off, right? And that is for, your vertex to deflection. And then you have mento vertical for brow, and you have submento vertical for face. So if this was a question, because some kids have been telling me on the WhatsApp groups also that this is the question, right? But if it was not there, then fine, right? And with that, let's finally end the OBG session. You guys must be tired, right? Okay. Okay, Alekhya ma'am, thank you. I'm sorry I took up some of your time.
No problem, ma'am. Chala guys, so you had good time with ma'am. Gynec was such lengthy and tough, but ma'am was so patient answering all your questions. Can you hear me, guys? Okay, now fastly switch to orthopedics. Enough of your presentations. Okay. So guys, I hope you have done really well. I'm so happy. There were a lot of questions which we have discussed in various sessions, your FMG marathon, your FMG TND and all. So I hope you have all answered every question which has come from ortho, right? Yes, yes, Sophie, yes, Chinu, yes, Ashok. All happy faces? Okay. Just a quick recall from ortho, very quick. Okay, the first question is from the IT fracture. Yes, this was the image which was given, and what was the question asked? Was that to answer only the type of fracture or to name the fracture? What was the question? So if the question was to just name what type of fracture is, and you all know it is an intertrochanteric fracture, right? It is between the two trochanters. You can see greater trochanter and the lesser trochanter. So this is an IT fracture, intertrochanteric fracture, usually seen, yes, more than 65 years of age. And what would be the treatment for it? We have discussed in detail that you have to do either a DHS or a PFN. So what did you answer? Yes, this was discussed in very detail, right? IC and IT fractures. Yes, was it PFN or was it DHS? What was there in the options? Okay, if it was identify the fracture, we have already identified long back. Arthroplasty was there. There was a young guy with femur head fracture. Age was not mentioned. Exam is too easy rather than PG. Okay, so fine. So if it was any other question, like if it was 20 a child, that was the question. 20 a child with IT fracture. Yes. So the still answer would be DHS or PFN. Okay. If it was an IC fracture in 20 years old, if it was an IC fracture in 20 years old, then we would have gone for what? CC screws fixation, right? This also we have discussed. We'll go for osteosynthesis, right? So see, that is a CC screws fixation in a reverse triangular fashion. Okay. Yes. Okay, done. So the answer would be either this CC screw fixation if it was an IC fracture. If it was an IT fracture, it should be a DHS or a PFN. Yes, CC was the answer. Excellent. Okay, then this has been explained in very big detail, and I hope you all have attempted it. So one question down. The second one, Brody's abscess. Yeah. So here what you have to identify, you will identify a location that is in the metaphysis, and this is a localized lesion, right? It is a localized lesion, subacute condition, localized and subacute condition. So there are two different questions, IC and IT. No, listen, if it was this, chondroblastoma is one more question. See, this is if it was an epiphysis. So this is epiphysis chondroblastoma. It is a lytic lesion again. And this is Brody's abscess. This is metaphysis. Okay. No image of Brody's was there. Okay, then we'll just strike this off. So no image of Brody's was there. This was chondroblastoma. So chondroblastoma, it was epiphyseal lesion. The knee joint, this was. Okay, so this is the answer. So answer is chondroblastoma. It is again a lytic lesion. It is epiphysis. It is a friend of what? Your GCT. So you will always remember that epiphysis Epiphysis is GCT, right? So one more thing which you have to remember is your chondroblastoma. So chondroblastoma is one more thing which you have to remember in the epiphyseal regions. And one more thing is clear cell chondrosarcoma. So these are three things which you see in the epiphyseal region as well, okay? The site of the lesion. Yes, don't get confused. If it was Brody's abscess, this will be a localized lesion. So if you see chondroblastoma, it is not that localized. It is little bit of bigger image than your Brody's abscess. Okay, if you're telling Brody's are there, if you're telling chondroblastoma. So, okay, fine. Let us assume that 2 questions have come. Very, very happy. So Brody's abscess, this. Yes, usually there will be afebrile because it is a subacute type of condition, right? Subacute type of condition. Okay, Ragini patient was febrile. Okay, fine. So something related to infection was given. So you have to mark it as Brody's abscess, as you all know what are the symptoms of infection, right? So Brody's abscess, this is the image of Brody's abscess, and this is the image of your chondroblastomas, right? So epiphyseal region, chondroblastoma, metaphysis is your Brody's abscess. Is that clear? What were other options if we can recall from Brody's abscess? Okay, fine. Yes, okay, 2 other questions. So one is Brody's, one is chondroblastoma, okay, according to few of them. Right. Right. And then this, so again, a confusion. Okay, Brody's abscess only image was given. Okay, fine. So image, if you see, it is a localized and you can make it out, right? This is the epiphysis. It is extending into the physeal region. So this is the epiphysis region, right? So metaphysis, it is far below the physis like this, right? Okay, patient was afebrile. Okay, then that could be considered as Brody's abscess relating something related to the infection. Okay, then coming to the 4th question. Now again, whether it was an anterior draws test or a posterior draws test. So few of them are telling it was posterior and few of them are telling it was anterior. So if the image was given like this clearly stating the arrow mark towards the front, that is called the anterior draws test. Was anything added to this, like the patient had some football injury or some hyperextension injury? Yes, anything else was added to this? Only image was given. Second image was given. Okay, this is the image. Then this answer is your anterior draws test. Okay, no confusion. This also was being discussed in great detail. Posterior was there? In options, posterior was there? Anand, can you be a little more clear what posterior in the image or in the options or what? So either of thing. Okay, fine. So checking with the ligament, ACL, MCL, meniscus was the option. So if ACL, PCL, meniscus, no history, only picture. So there was nothing given. Okay, which is tested in this image. So if see, this is the only clue. The patient is pulling it in the forward direction. So forward direction is anterior draws test. No doubts asked. Okay. If it was in the backward, then it is PCL. If the image was like this something, then it was PCL. So pushing forward is nothing but your anterior draws test. So the answer would be anterior draws test. And the ligament which we use to test here is anterior cruciate ligament. So they asked about the ligament. So the ligament is anterior cruciate ligament and the test is anterior draws test. Yes, fine. In the option, it was given 2, ADT and PDT, anterior and posterior, both was given in the option. ACL and PCL was given. Okay, so the answer would be ACL, fine. And this is the 5th question. So this is regarding your fat embolism. Was this there in the exam? So this is the fat embolism. So usually, as we already know, that there would be a femur shaft fracture image, and then they will tell you that there is a young male and it is about 48 to 72 hours. And these are the symptoms. They will have a triad of symptoms like petechial rash, shortness of breath, and confusion. And this is the femur shaft fracture. Yes, femur shaft fracture, the most important complication which you have to remember is your fat embolism syndrome. Yes, 48 hours of long bone fracture. Very good. So everybody have marked this fat embolism syndrome. No confusion, right? Yes, humerus shaft will deal, Anand. Just a second. So this is the fat embolism syndrome. So what else they have asked? 48 hours long, yes. And then quick. Okay, then 48 hours long, then femur shaft. What is the most common? It is the fat embolism syndrome. Answered. Yes, correct. And then this was asked the carpal tunnel syndrome. There was a few of them were telling that there was a marking given towards the median nerve. Yes. So the answer is median nerve for this particular marking in the wrist image. And there was one more question with the, okay, patient was breathlessness was also mentioned in the above question. Okay, there was two clues for us. So one is after 48 hours and then was SOB. And then the third important clue is femur shaft. So all these three related to fat embolism. Perfect. Then this question, there was a wrist image with the arrow mark towards the median nerve. Yes, anything else was added in the question? So this is a carpal tunnel syndrome showing the median nerve, right? Okay, then there was one more question that they were telling that the dorsiflexion was absent. So that is related to your common peroneal nerve. These two were also discussed, right? In the various sessions, we have discussed that CPN and the carpal tunnel syndrome is the median nerve. Yes, can anybody help me with what was the question in the carpal tunnel? Only the image? Yes, yes. Okay. Okay, it was a cross-section image. It was easy to identify that it was a median nerve. Electrical job with laceration was there, and then patient had swelling. And did they mention that tingling and numbness was there, 3.5 fingers and all? Simple bone cyst was the option regarding this. Okay, if there was a loss of sensation in little and the ring finger, then that could be the ulnar nerve, right? Okay, middle and ring finger. Okay, not little finger, middle and ring finger. Okay, some 3.5 fingers, it is the median nerve. If it was little finger specifically mentioned, then it would be the ulnar nerve. Yes, yes. If it was an okay, now I understood. So the question was there was a history of some electrical job done with laceration, and then later patient had swelling and now complained of sensations in the middle and the ring finger, right? Middle and the ring finger. So the answer would be median nerve. Ashok Chowdhury is telling there is a loss in little finger. Little and the ring finger. So little and the ring finger, then it should be ulnar nerve. Okay, not to fight on this. We'll see. See, whenever the little finger is involved, it is ulnar nerve. But if it was middle and the ring finger, then it should be the median nerve. Okay? Okay, fine. Ragini has said yes. I don't know for what, but okay. And now comes, ma'am, the picture was cross-section of the hand. Okay, fine. Okay, if it was little finger, as Ashok you have marked, that should be ulnar nerve, but most of the people are here telling that ring and middle, so the answer would be the median nerve. Cross section of hand, what part was given? Is the wrist or it was near the Guyans canal or what? No little finger by Ragini. Okay, fine. Then we'll put that question aside. And this is our favorite question. I think everybody on par has returned this. Holstein-Lewis fracture, that is your radial nerve injury. Yes? Yes, very good. So this is perfect. Holstein-Lewis fracture, humerus shaft fracture or Holstein-Lewis fracture with the radial nerve injury. So this is the radial nerve injury. This was asked, only the radial nerve was asked in the option. Okay. So this is the shaft fracture with the radial nerve injury. Done. Then next question. Next question was there is a history of fall with the femur neck fracture. What is the most common complication or what is the most feared complication? This has been again discussed in great detail. One of the most important complication which you have to remember in the fracture neck of femur is avascular necrosis, isn't it? We have discussed there will be a loss of blood supply because of the peculiarity of the blood supply, which is from distal to proximal in case of the femoral head. As you remember, I've shown you the diagram also like this. And now in the fracture, what happens? This blood supply gets lost and this will result in avascular necrosis. So what is the treatment? Treatment for avascular necrosis. Total hip replacement, right? As they have mentioned, anything regarding the stage of avian or something? So avian now has 4 stages. The treatment is total hip replacement for avian. Avascular necrosis, you have to treat it with total hip replacement. Was that given in the option? THR? Okay. No staging was given. So the answer would be total hip replacement or hemiarthroplasty was given. Okay, you can even opt for hemiarthroplasty as well. But usually we go for THR. Usually we go for a THR. But if the option of THR is not there, then you can still opt for hemiarthroplasty. THR was not given in the option. Yes, no screw fixations can be done for this. Casing, okay, it was young patient also. Still, you have to treat it with the replacement. No, casing, heat compressions, external fixation, all that doesn't work. Only treatment is replacement. That would be your arthroplasty. That's it. That's it, even if the patient is young. Okay, so that is the answer for this avascular necrosis of femur. Arthroplasty is the answer for that. Okay, before that, if they would have asked you the investigation of choice for this particular thing, it is MRI and you have to stage it. Usually stage 1 and stage 2, if at all we have to do, we treat it with core decompression. That is one type of surgery. And the stage 3 and 4, we go for total hip replacement. Okay, if total hip replacement is not there, then you can go for hemiarthroplasty. Fine? Okay. But not all other options. No other option it is suitable, not the external fixation, nothing else. If they're given extent just to identify, it is avascular necrosis. Very easy. And then what about this? This also we have discussed. In Telegram group, somebody has asked me what was battered also. What do you mean by the word battered? So the answer is battered baby syndrome. Is this the question? 2 weeks old. So this is mainly the history. You have to see the history. Parents have given history of fall only once, but there were multiple fractures, right? Because of the multiple fractures and the history and the whatever we see, the signs does not correlate on this particular thing. And that is why it is considered as battered baby syndrome. But in case of osteogenesis imperfecta, there will be multiple fractures with multiple falls, right? So there will be multiple falls. And again, the patient will have history of anything like blue sclera or deafness. Right, so there is something related to the history, but here in the battered baby syndrome, it is only multiple fractures. And usually the parents try to hide the history and history doesn't correlate with your signs and symptoms. Okay, if it is 5 weeks, BB is fine. Multiple fractures X-ray was given. So what we are thinking as of now is the answer would be battered baby syndrome. Is that right? Okay, multiple fractures, battered baby syndrome. But they were mentioned it is only by single fall. That is important. Can you see any deformities in the X-ray? No deformities. Battered baby syndrome. If some deformity, like if the bending in the femur or something is seen in the tibia, then it is osteogenesis imperfecta. Okay. That's the one. And last one. This I think it is usually they have told that some crush injury or some blast injuries was asked, and finally we have come to conclusion that that is related to some triad. So it will be taken up by the birth fracture was also the option, but they said there are multiple fractures, no? If there was a fracture during birth also, then it could be again osteogenesis imperfecta. Okay, so this crush will be dealt by surgery, the Dr. Sandeep, and then there was a foot image with the navicular bone. So this is again to anatomy, okay? Yes, yes, yes. This triage and this will be dealt by respective faculties. Okay, this we'll just see, we'll just get back again. Which question shoulder was mentioned, Kaushika? Electrolyte imbalance in one question. Yes, what was that electrolyte imbalance? We have discussed this also in crush injury. So there will be increase in the potassium. It is hyperkalemia, right? Yes, if some electrolyte imbalance was asked, I think mostly they will ask you there would be an increased potassium level, that is hyperkalemia. Yes, Sophie, that then this is the answer. Perfect. So this also we have discussed hyperkalemia and crush injury. Kaushika, what is the question? The shoulder was mentioned something. Which question? Very good. Hyperkalemia is the answer in the crush injury. That is the crush syndrome. Because of the myoglobin and potassium both will increase, that will lead to hyperkalemia. Very good. If you have answered this, this is the right answer. Kaushika, not yet. I have not received your reply. Shoulder something you were asking me. Okay, then if that is not there, that's it from the orthopedic point of view. So we will get back with all fully formed questions. Okay, shoulder wala was orthopedics question regarding your potassium levels. Okay, there was swelling and then okay, anything, whatever, it could be crush anywhere, but there will be an increase in the potassium. Okay, okay, not to waste much of the time because all the faculties are waiting there. Okay, thank you so much. Anything is there, you can always get back to us in the Telegram group or our Instagram handles. All the best, guys. Waiting for your results. Okay, sleep well for tonight. Good night. Bye. Over to Dr. Rishabh.
Thank you, ma'am, for covering those questions in orthopedics. The image-based questions, also some of the radiology images were asked in orthopedics. So, ma'am has very well covered those questions, and hence I will not be covering those questions separately here. The aim is to tell you what topics were asked and what is the most likely answer based upon the uh, question that the students have shared with me. So I will tell you two things. Acha, audio not audible is. Am I audible right now? Can you give me a confirmation? Ragini, Javed, Shahid, Ashok. Hi, hello everyone. Am I audible now? Because let's first establish that yes, it's fine. Okay, thank you. Yeah. So I'll ask you two things. First, whether this question was asked, ठीक है, क्वेश्चन पूछा भी गया था कि नहीं पूछा गया था, and second, whether question was asked or not, and second, what were the options? What were the options? Right? And if the image was asked, what was the image? Was it the same image that I am drawing, or is it a different image, right? So tell me these three things and then we will go forward. So this is the first question. I think battered baby syndrome, ma'am has also covered. 2-week child, typically a history of a battered baby syndrome में बिल्कुल छोटा बच्चा होता है, ठीक है, क्योंकि it is sort of a psychological disorder, psychiatric disorder ki unfortunately the parents are inflicting injuries on the child, right? For whatever reason, right? So it's usually a very small child, 2 weeks old child, parents giving history of फॉल वंस कि एक बार अभी बेड से गिर गया. यूजली ऐसी हिस्ट्री आती है कि बच्चा बेड से गिर गया या सीढ़ियों से गिर गया, एंड दे हैव ब्रॉट द पेशेंट टू द hospital. Now, when you do an X-ray, you find multiple fractures. So first of all, tell me, what was the image? Was it image number A or was it image number B? First, tell me this thing. So option B में था fall from height. Around 3 to 4 close-up pics of fractures थी. Okay. 3 to 4 pics of fracture. कौन कौन से जगह के fractures थे? Can someone tell me? फीमर का था. Lot of students are saying femur fracture was there. फीमर फ्रैक्चर था कि नहीं, एक बार ये कंफर्म कर दो. ये वाली इमेज थी क्या? बी इमेज थी? बताओ बताओ, was B image there or not? Birth trauma was one option. Okay, thank you. Thank you, Sophie. Birth trauma. यस, 2 to 3 फ्रैक्चर्स थे. फीमर की ये वाली इमेज थी, ठीक है, तो ये वाली इमेज तो पक्का हो गई. इसके अलावा और भी इमेज थी. अब टेल मी, वाज रिब फ्रैक्चर आल्सो गिवन? रिब फ्रैक्चर्स थे क्या? क्योंकि टिपिकल नॉन एक्सीडेंटल इंजरीज में बैटर्ड बेबी का दूसरा नाम है, आगे के लिए हम याद रख लेते हैं, नॉन एक्सीडेंटल इंजरी. ठीक है, नॉन एक्सीडेंटल इंजरी बोलते हैं, या सस्पेक्टेड फिजिकल एब्यूज. सस्पेक्टेड फिजिकल एब्यूज ये नाम होता है इसका, आगे के लिए पढ़ लेते हैं. एंड इसमें टिपिकल फ्रैक्चर जो हमें मिलते हैं, दे आर मेटाफिजियल फ्रैक्चर, जिनको हम बोलते हैं बकेट हैंडल फ्रैक्चर्स ऑल्सो. बकेट हैंडल फ्रैक्चर्स, ठीक है. एंड सेकेंडली हमें मिलते हैं स्पेसिफिकली पोस्टीरियर रिब फ्रैक्चर्स. ठीक है, रिब नहीं था, टिबिया एंड फीमर दे रखा था एंड ह्यूमरस दे रखा था. तो ठीक है, लेट मी जस्ट करेक्ट इट. फीमर था, ह्यूमरस था एंड टिबिया भी था. टिबिया वाज आल्सो गिवन. एक लास्ट ऑप्शन बता दो भाई लोग कि डी कौन सा ऑप्शन था, फिर हमारा पूरा क्वेश्चन कंप्लीट हो जाएगा. डी ऑप्शन को, कैन समवन टेल मी व्हाट वाज द डी ऑप्शन? तो आंसर सबको पता ही है, वी हैव ऑलरेडी कवर्ड इट एज बैटर्ड बेबी सिंड्रोम. इंजरी ड्यू टू ब्लंट ऑब्जेक्ट एक ऑप्शन था. बकेट हैंडल वाज गिवन इन द क्वेश्चन. लॉन्ग बोन फ्रैक्चर, इंजरी ड्यू टू ब्लंट ऑब्जेक्ट. सब लोग अलग अलग बता रहे हैं, 4 ही ऑप्शन थे. इंजरी ड्यू टू blunt option object. So were these the 4 options? Quickly confirm me whether these were the 4 options or not. ठीक है सोफी, एक बार कंफर्म कर दो बस, then we'll move on to the next question. These were the 4 options: battered baby syndrome, fall from height, birth trauma, injury due to blunt objects. battered baby ही दे रखा था या फिर bucket handle fracture दे रखा था? Injury due to blunt object. चलो ठीक है. So this is the first question. This you already have covered. Now second, this will be covered now by Ophtha also, ENT also, और मैं भी cover करूंगा. I think there was an elderly patient. History of was given that the patient fell on the floor and radiology image was given, right? So water's view was given. ऊपर देख रहा होता है. This is how we remember. ऊपर देख रहे होते हैं, like they're praying. So W water's view में, and there was this fracture, this opacity in the maxillary sinus on the right hand side. So was this the image and this was the question? ये वाला था ही नहीं, ठीक है, ये क्वेश्चन ही नहीं था. नहीं था क्या? बताओ, फाइनली बताओ, was this the question? Blowout, orbital blowout fracture? Not this image. Okay, not this image. कोई दूसरी इमेज थी. Another question, aromagon head of fibula. I don't remember what of you. Cricket ball injury. Sorry baby. Yes sir था. No water view. No. Image was CT. CT image was given. CT, it's a CT skull. Okay, okay, तो ठीक है. Thank you so much. This was not the option. This was not the image. A CT was given. ठीक है, thank you, thank you. A CT was given, and उसमें there was fracture of the inferior wall of the orbit. ठीक है, KGMU gamer, thank you. Thank you, Krigler Najar, and for confirming this. The answer is blowout fracture. If inferior wall of the orbit is fractured, it's blowout fracture. Now tell me quickly, tell me what was the stem of the question. अब सब कुछ बता ही रहे हो तो पूरी चीज बताओ. What was the stem of the question, guys? CT cricket ball history. On CT, teardrop sign was seen. Teardrop sign was seen. Was teardrop an option, or teardrop sign was given in the question itself? Clinical case of, अच्छा, elderly की बात ही नहीं हो रही है. So no case of elderly. It was a cricket ball injury. It was a cricket ball injury, and I think आंख पे cricket ball लग गई, and then they did a CT. Teardrop sign on CT. The teardrop sign was given in the question also, or you had to identify the teardrop sign? What was it? Teardrop sign was seen in the image. ठीक है. So teardrop sign was seen in the image. ठीक. So answer was orbital blowout fracture. A patient with cricket ball injury on orbit. ठीक है. Okay. Next question is this: history of diabetes, and students were saying that MRI image was given and black turbinate sign was seen on MRI. So first of all, tell me, was there a question on black turbinate sign or not? And if there was a question, was this the image which was given? A lot of students have told me very recently now, I'm getting few messages on Telegram that this was not the image. So first of all, tell me whether this was the image or not, and whether this was the question or not. So this was the image. Okay, if this was the image, no. Sigma rules edit is saying no, this was not the image. No image, only history. Krigler Najar, where are you? We are missing you. Can you tell me which, whether there was an image or not? And if there was an image, was this the image? Image different, not this image different. Question, mucormycosis को निकालना था. Black necrosis on nasal sinus in the question. Okay, history of diabetes. And question में दे रखा था black necrosis on nasal sinus. Not this image. Okay. ठीक है, कोई दूसरी इमेज होगी. So black necrosis on nasal sinus, diabetes, ENT का क्वेश्चन. आंसर इज rhinocerebral mucormycosis. अच्छा, ऊपर वाले में बैटर्ड बेबी में मल्टीपल फ्रैक्चर्स और बकेट हैंडल इंजरी mentioned in the question. ठीक है, ठीक है. थैंक यू आलिया, थैंक यू. ओके, इसके बारे में आ जाओ एक बार. ठीक है, चलो ये वाली इमेज नहीं थी. विल गो forward. Boot shaped heart, I think directly students have said there was a question on boot shaped heart. Can you somebody tell me what was the stem of the question? Clinical question था, direct image पूछी थी. What was the question and what were the other options? और option भी बता दो यार, बाकी options क्या थे. एक बार question number 3 के भी बाकी options बताओ. What were the other options? सेम इमेज दे रखी थी इसमें. चलो, इमेज इज फाइन. सो इमेज इज करेक्ट हमारी. इमेज इज करेक्ट. केस दे रखा था. सो इट वाज अ केस. कैन समवन टेल मी व्हाट वाज द केस? साइनोसिस था. ओके, क्वेश्चन में देयर वाज साइनोसिस. एज दे रखी होगी चाइल्ड की. एज दे रखी होगी, साइनोसिस दे रखा होगा. एज बता दो, एज क्या थी याद है? 3 year old, 4 year old, ऐसा कुछ होगा यूजली, यंग चाइल्ड। टॉफ का 2 year old। ऑप्शंस बता दो, व्हाट वर द अदर ऑप्शन? वाज TAPVC, आई थिंक TAPVC वाज एन ऑप्शन। ओके, यंग चाइल्ड दे रखा था, एज में वाज डायरेक्टली यंग चाइल्ड। थैंक यू शाहिद, थैंक यू शाहिद बिन नूर। TAPVC was one of the option, TOF, AST एंड VST। ठीक है, तो चलो साइनोसिस है तो AST VST तो चले गए। TAPVC एंड टेट्रोलॉजी ऑफ फैलेट ही बचते हैं। TAPVC में क्या होगा? फिगर ऑफ 8 अपीयरेंस, ऑल्सो नोन एज स्नोमैन्स हार्ट। ठीक है, तो आंसर यहाँ पर बन जाता है टेट्रोलॉजी ऑफ फैलेट। ऑप्शंस में सारी बारात आ गई थी। ओके ठीक है, सिग्मा रूल्स एडिट नॉट 3 weeks। ओके 3 weeks दे रखा, 3 weeks नहीं दे रखा होगा। चलो ओके, इसके ऑप्शन बता दो। एनीबडी नोज व्हाट वर द ऑप्शंस इन दिस क्वेश्चन? हिस्ट्री ऑफ डायबिटीज, ब्लैक टर्बिनेट साइन, एब्स्टीन एनॉमली दे रखा था ऑप्शन में। AFD VFD नहीं था, एब्स्टीन एनॉमली भी दे रखा था। 3 month, 3 month भी नहीं होगा क्वेश्चन में, 3 months नहीं होगा। भूमि, if you are NEET UG aspirant, please exit this group, please exit this chat. This chat is not for you. AFD VFD ही था, अरे ऐसे मत करो यार, AFD VFD ही था। चलो ठीक है, नेक्स्ट क्वेश्चन पे आते हैं, नेक्स्ट क्वेश्चन पे आते हैं, टाइम नहीं वेस्ट करते। एक्सरे इमेज ऑफ द लीजन ऑफ द नी वाज गिवन, वाज दिस द इमेज? फर्स्ट ऑफ ऑल टेल मी, वाज दिस द इमेज? इसकी इमेज इज करेक्ट, इसकी इमेज इज रॉन्ग, इसकी भी इमेज इज रॉन्ग। ओके, क्वेश्चन टेल मी, सेम फोटो, पेनलेस लीजन। ओके, क्लिनिकल में दे रखा था पेनलेस लीजन, और फीवर था, वाज देयर एनी फीवर? व्हाट वाज द एज? ए फेब्राइल था, ए फेब्राइल पेशेंट। व्हाट वाज द एज गाइस? टेल मी व्हाट वाज द एज? सेम पिक, तो ठीक है। देखो इसमें कैसे डिफरेंशिएट करते हैं कि अगर ये मेटाफाइसिस में लीजन है, मेटाफाइसिस का लीजन है, फीवर दे रखा है, ए फेब्राइल है, नो नो हिस्ट्री ऑफ फीवर, तो दिस हैज एन इरेगुलर मार्जिन्स लाइक दिस। ठीक है, सो इरेगुलर मार्जिन्स इसके हैं, मेटाफाइसिस में है सर ब्रॉडीज एब्सिस व्हिच इज अ सब एक्यूट टाइप ऑफ ऑस्टियोमाइलिटिस, एज मैम हैज ऑलरेडी कवर्ड, एंड हेंस देयर इज नो फीवर। सर इसमें हिस्ट्री दिया था कि कोई ट्रॉमा नहीं है, पेनलेस, नो फीवर, इवन नो ESR इंक्रीज। ठीक है, थैंक यू, थैंक यू। नो हिस्ट्री ऑफ, नो हिस्ट्री ऑफ फीवर, पेनलेस एंड नो ESR इंक्रीज। अब ये टेंडर ऑन पैल्पेशन, मार्जिन्स इरेगुलर, तो देखो ये एनेरिज्मल बोन सिस्ट नहीं हो सकता, क्योंकि एनेरिज्मल बोन सिस्ट पहली बात तो ग्रोथ प्लेट फ्यूजन होने से पहले होता है, दूसरा उसमें मल्टीपल सेप्टेशंस होते हैं। इसमें देखो इट इज अ सिंगल यूनिलॉक्युलर लीजन। एनोरिज्मल बोन सिस्ट जो होता है इट इज अ मल्टी सेप्टेटेड लीजन, इट तभी उसको सोप बबल अपीयरेंस भी बोलते हैं हम, एंड इट हैपेंस इन द मेटाफाइसिस ऑफ अ चाइल्ड। ठीक है, सारी चीजें फुलफिल होनी चाहिए। बोन सिस्ट वाज एन ऑप्शन। ओके, सो एक ऑप्शन था ए, बोन सिस्ट, एज थी 12 year old। थैंक यू गाइस, थैंक यू, थैंक यू। एन्यूरिज्मल बोन सिस्ट, एक ऑप्शन था ऑस्टियोकॉन्ड्रोमा। ठीक है, थैंक यू पूजा, थैंक यू शाहिद, थैंक यू फॉर सिंपल बोन सिस्ट। तो सिंपल बोन सिस्ट था एक ऑप्शन। ओके, सिंपल बोन सिस्ट। और सिंपल बोन सिफ्ट क्यों नहीं है? बहुत सारे स्टूडेंट सोच रहे होंगे ना कि सिंपल बोन सिफ्ट क्यों नहीं है, यूनिलॉक्युलर ही है, बट इट इज इरेगुलर। ठीक है, इरेगुलर मार्जिन हैं इसके। थोड़ा टफ क्वेश्चन है, आई वुड से कि इट इज नॉट अ सिंपल क्वेश्चन। जब बोन ट्यूमर्स पढ़ाते हैं तो लोग ब्रॉडीज एब्सिस नहीं पढ़ाते हैं साथ में, वो ऑस्टियोमाइलिटिस के साथ पढ़ाते हैं, बट उसके डीडीज में आता है बोन ट्यूमर्स, बट इसके इरेगुलर मार्जिन हैं, इसीलिए आंसर इज ब्रॉडीज एब्सिस एंड नॉट अ well, bone cyst. Chondroblastoma एक और ऑप्शन था, ठीक है. Fourth option was chondroblastoma. Thank you guys, thank you. चलो नेक्स्ट क्वेश्चन पे आते हैं. चाइल्ड था, एक्सरे नहीं दे रखा था, लीजन इन एपिफाइसिस. तो इसमें दोनों सिंपल एंड एनेरिज्मल बोन सिस्ट दे रखा था, ऑस्टियोकॉन्ड्रोमा नहीं था. कुछ बच्चे सोचते होंगे कि हम कोई भी ऑप्शन बोल दें, सर को क्या पता है, हमें तो हम जो भी बोल दें सर लिख देंगे. बात तो सही है, मतलब मुझे तो नहीं पता है व्हाट आर द ऑप्शंस. आई एम टोटली डिपेंडेंट ऑन यू. सिंपल बोन सिस्ट में फॉलन फ्रैगमेंट साइन भी होता है, हर बार नहीं होता है. अगर फ्रैक्चर्ड होता है सिंपल बोन सिस्ट तभी मिलता है फॉलन फ्रैगमेंट साइन. बट यस, अगर वो मिल जाए तो काफी पैथोग्नोमोनिक हो जाता है. नाउ टेल मी दिस, was this the image, first tell me, was this the image which was given? एंड पहली बात, क्वेश्चन आया भी था कि नहीं आया था? ऐसा कोई क्वेश्चन आया भी था कि नहीं आया था? Was any no such question? No such question. First of all, tell me, is this a question which came in the exam or not? ओके, सो नो इट वाजंट. ठीक है, तो इस क्वेश्चन को हटा देते हैं. देयर इज नो सच क्वेश्चन. ओके, ठीक है, चलो आगे बढ़ते हैं. थैंक यू गाइस, थैंक यू. नाउ टेल मी वेदर दिस क्वेश्चन केम, आइडेंटिफाई द मोडालिटी एंड वेदर. तो पहली बात बताओ, वेदर दिस क्वेश्चन केम एंड इज द इमेज करेक्ट? थैंक यू रंजन, थैंक यू फॉर कंफर्मिंग. यस, सो दिस क्वेश्चन केम. ओके, तो क्वेश्चन तो आया है. एंड इमेज बताओ, वाज द सेम इमेज गिवन और डिफरेंट इमेज गिवन? इसके एंड में वाइट था, आईवीपी होगा, सेम इमेज विद सेम ऑप्शंस. एक ऑप्शन और बता दो यार, एक ऑप्शन और बता दो. आरजीयू, वाज आरजीयू एन ऑप्शन? तो सिंपल है ये, अगर इसमें हमें यूरेथ्रा नहीं दिख रही ना, अगर यूरेथ्रा इज नॉट ओपेसिफाइड, सो इट इज एन आईवीपी. तो आंसर हियर इज आईवीपी. आरजीयू था, ठीक है. सो रेट्रोग्रेड यूरेथ्रोग्राम वाज एन ऑप्शन. इन इमेज नो फिलिंग ऑफ ब्लैडर. ओके, ब्लैडर नहीं फिल था, ठीक है, डिफरेंट इमेज होगी. हाँ ठीक है, इमेज आया था बट अलग था. ओके, डिफरेंट इमेज. ओके, आई विल राइट डिफरेंट इमेज. डिफरेंट इमेज in which bladder not fill. Okay, bladder not filled. Okay, bladder नहीं था, ठीक है. अच्छा, फिर ये तो आईवीपी हो गया. अब ये बताओ, ये आया था क्या क्वेश्चन, आइडेंटिफाइंग द मोडालिटी? आइडेंटिफाइंग द मोडालिटी आया था क्या? वाज दिस एन ऑप्शन? फर्स्ट ऑफ ऑल टेल मी, क्वेश्चन आया था. यस, सो क्वेश्चन आया था, क्वेश्चन आया था हमारा. नाउ इमेज बताओ, वाज दिस द इमेज व्हिच वाज गिवन? अब पूजा बोल रही है कि सर ये क्वेश्चन ही नहीं था. अब ये कैसे बात करेंगे भाई? बताओ, क्वेश्चन आया था कि नहीं आया था? पूजा तो गेम खेल रही है, पूजा बोल रही है कि क्वेश्चन ही नहीं आया था. पूजा, छोड़ तो नहीं दिया आपने ये वाला क्वेश्चन? मैमोग्राफी, एक्सरे.
बैटरी कनेक्ट कर लो.
ओके, सेम क्वेश्चन आया था, थोड़ा जूम था. ओके, थोड़ा जूम क्वेश्चन था. इमेज सेम नहीं है, साइड बाय साइड. यस यस, आया था, मैमोग्राफी था. चलो ठीक है, ठीक है. दोनों शायद उन्होंने एमएलओ व्यू. आई थिंक व्हाट यू आर सेइंग इज दैट एमएलओ व्यू एंड सीसी व्यू वर साइड बाय साइड. यूएसजी. ठीक है, अगर ये इमेज थी तो आंसर मैमोग्राफी है. एक्सरे तो चेस्ट का होता है, मैमोग्राफी इज नथिंग बट एक्सरे ऑफ द ब्रेस्ट. ब्रेस्ट के एक्सरे को मैमोग्राफी बोलते हैं. सो मैमोग्राफी इज द आंसर. ओनली एमएलओ व्यू के मैच. ओके, Okay, only MLO view given. CT भी एक ऑप्शन था. Okay. ठीक है. थैंक यू गाइस, थैंक यू सो मच, थैंक यू चिंटू, थैंक यू. पेट स्कैन तो नहीं था, प्लीज पेट स्कैन तो नहीं दिया होगा. अरविंद, शारोन, रंजन. ओके. अच्छा, ये बताओ, कोबरा हेड अपीयरेंस ऑफ IVP was given. First of all, confirm whether such question came or not, or was it the same IVP question? ये अलग से क्वेश्चन था कि IVP का क्वेश्चन था? क्वेश्चन था यही कि अलग क्वेश्चन था, या फिर IVP वाला यही क्वेश्चन था? Was an IVP question separate and this separate? अलग क्वेश्चन था. ओके, अलग क्वेश्चन था. ठीक है. सो क्वेश्चन आया है, एंड क्वेश्चन में चाइल्ड दे रखा था. नो फीवर. डुप्लीकेशन एक ऑप्शन था. ओके, थैंक यू, थैंक यू, थैंक यू. सिंपल बोन सिर्फ नहीं होगा बालिया आप. ठीक है, इसमें सिंपल बोन सिर्फ नहीं पूछेंगे. इतना बुद्धू नहीं वो समझो मुझे. मुझे पता है कि आप लोग कुछ भी ऑप्शन बोल सकते हो, बट ऐसे मत बोलो. डायग्नोसिस विद IVP इमेजेस सेम यूरेट्रोसील PUV पोस्टीरियर यूरेथ्रल वॉल्व. ठीक है, चलो एक और बता दो. अगर किसी को एक और याद आ गया तो भाई सोने पे सुहागा है. चलो नेक्स्ट क्वेश्चन. इतने ही क्वेश्चंस हैं आई थिंक. इसका एक और ऑप्शन बता देगा कोई? व्हाट वाज द अदर ऑप्शन? और इसके भी एक बार ऑप्शन बता दो. व्हाट वर द ऑप्शंस इन दिस क्वेश्चन? म्यूकोर माइकोसिस वाला जिसकी इमेज गलत है. RG. अच्छा, RG मतलब लेट रिपीट. Okay, so I think some more questions were asked. There was a question on intertrochanteric fracture and another question on subarachnoid hemorrhage also. So just confirm me whether these two questions also came or not, and then we'll finish the radiology session. Okay, so ठीक है, that is all from no SH posterior urethral valve. That is all from radiology. I think I'll finish it here, and we'll hand over to the next faculty.
Hello everyone, very good evening to all of you, and I hope you guys have done well. ठीक है, अब टेंशन खत्म. We are going to recap in this particular segment all the questions that have come from ENT. ENT में काफी questions आए, but I am very happy and I hope you guys are also happy seeing the ENT questions क्योंकि ENT straightforward and easy था. So there may be some options that would be different. तो हम options पे concentrate नहीं करेंगे. We will concentrate upon क्या question आया था and उसका right option क्या था. Right? That is what we are going to concentrate upon. Chalo. So without wasting much of time, we are going to straight away start into certain questions which were straight away asked from ENT. Now there was some question about, I've put up the age of the patient here, who is a singer by occupation, underwent a procedure called as total thyroidectomy, and total thyroidectomy ke baad the patient was unable to raise the voice, right, during singing. So that is what they had given. Now what is the nerve which is likely to be injured during thyroidectomy, right? So thyroid may, whenever you get any particular injury, there is only one muscle which is also called as a singer's muscle. और जब मैंने पढ़ाया था, तो I have told you in my lectures also that there is a nerve called as superior laryngeal nerve. Superior laryngeal nerve is having two branches, internal branch, external branch. External branch of superior laryngeal nerve is the one which gives supply to cricothyroid muscle, and cricothyroid is also called as singer's muscle. So iska answer, whenever they ask you about raising the voice, it becomes the external branch of superior laryngeal nerve because it is supplying which muscle? It is supplying cricothyroid muscle. right? So somebody is saying no such question was there. I had been reviewed about a question where there was someone who was a singer and they are not able to raise the voice. That is what the people have told me. Okay. So if there is not able to raise the voice, the answer becomes external branch of superior laryngeal nerve. Okay, fine. Chalo. So now, so that is what, but difficulty in singing at high pitch. So high pitch se related hai superior laryngeal nerve. It is not recurrent. Okay, the answer is not recurrent. Okay, fine. Chalo. So now we move on to the next question. Next question, there are some people who are saying it was a CT scan. There are some people who are saying that it is an X-ray. But we will keep it simple. Be it an X-ray, be it a CT scan, nothing matters. आपके पास एक cricket ball injury आई है. There is a patient who has got blunt trauma over the face, and there you see there is some kind of a drop-like appearance coming down from underneath the orbit. Now, if there is any drop-like appearance coming underneath the orbit, this I have already taught you in your lecture also, कि अगर CT scan में या X-ray में you see a drop-like appearance, we call this as teardrop sign, and teardrop sign is a classical feature of orbital blowout fractures. So if they have asked about the sign, then the answer is teardrop sign. If they have asked you about the diagnosis, then the diagnosis becomes a blowout fracture of the orbit. Straightforward and simple. तो अगर CT है तो CT में ये होगा, and they would have given you some kind of an entrapment of tissue below the orbit. Okay, fine. This finishes our second important question. That is very, very easy and straightforward about blowout fracture. अब आते हैं तीसरे क्वेश्चन पे. Now this question, I think there was a lot of discussion with Rishabh sir also upon this, but this is about rhino-orbitocerebral mucormycosis. अगर आपसे उन्होंने diagnosis पूछी है and they have given you an MRI showing that there is something black over on the turbinate, then this is called as a black turbinate sign because the patient had diabetes. That was the clue. The patient has got a black turbinate sign. They would have given some nasal crust is there, black color ka, or there is some kind of a blackening of the nasal mucosa. So if there is blackening of nasal mucosa, if there is a black turbinate sign which is positive, if they are telling that it is a diabetic male, the answer becomes that this, they are talking about rhino-orbitocerebral mucormycosis. That is the answer. If they has asked you about that what is the sign of this, तब हम इस sign को कहते हैं black turbinate sign. We call it as black turbinate sign. Okay, we call it as black turbinate sign. Seen in rhino-orbitocerebral mucormycosis. तो ये मैंने बहुत बार पढ़ाया भी है. This is the same thing that I have told you, that this is the kind of an MRI image that you see, and this is called as black turbinate sign. काला काला turbinate हो जाता है. The sinuses also turn out to be black because of lack of blood supply. ठीक है, fine. So I think this is the same image. ठीक है. So even if the more or less आसपास ही चीजें होंगी, we'll try to keep it simple. We'll try to keep it very, very straightforward. Okay. Answer is ROCM. Answer is black turbinate sign. Next question पे चलते हैं. Question number 4. Now this is about a person who has got a history of fishbone ingestion which got stuck in the pyriform fossa, and they have asked you which is the likely nerve to be irritated in this area. Now this is a common thing, right? So Holman-Miller sign कहाँ दिखता है? Holman-Miller sign is seen in cases of juvenile angiofibroma. Okay, Holman-Miller sign यहाँ नहीं दिखता. Holman-Miller sign is a feature of juvenile angiofibroma. Juvenile angiofibroma also has Hondusa sign. It also has got erosion of the pterygoid plates, which is also called as chopstick sign. ठीक है? अब इसमें कौन सी नर्व इंजर है? दिस इज एग्जैक्टली द सेम क्वेश्चन व्हिच हैड कम इन INICT अभी हाल वाला, कि अगर पायरिफॉर्म फोसा में देयर वाज अ फिशबोन व्हिच वाज स्टक, सो व्हिच इज द लाइकली नर्व टू गेट इरिटेटेड? पायरिफॉर्म फोसा इज अ पार्ट ऑफ आवर हाइपोफैरिंक्स. हाइपोफैरिंक्स के 3 पार्ट होते हैं. आई टोल्ड यू निमोनिक आल्सो 3 P होते हैं, PPP इन योर TND. दैट इज पायरिफॉर्म फोसा, पोस्ट क्रिकोइड एरिया एंड पोस्टीरियर pharyngeal wall. And the pyriform fossa is supplied by the internal branch of superior laryngeal nerve. I've told you that pyriform fossa is supplied by internal branch of superior laryngeal nerve, nothing else. तो कोई भी irritation pyriform fossa की होगी, the answer will be internal branch of superior laryngeal nerve. Cricothyroid वाले question में it was external branch. This is internal branch. So this will be the nerve which will be irritated by the fishbone which was stuck over in that fossa. Right? Okay? चलो आगे बढ़ते हैं. Now let's come to question number 5. जिसमें उन्होंने पूछा समथिंग रिलेटेड टू HPV इन्फेक्शन, एंड दे टोल्ड वाज HPV इन्फेक्शन में विच इज द कॉमनेस्ट मेलिग्नेंसी दैट यू सी इन द ENT डोमेन. उन्होंने देखा ओरोफेरेंजियल मेलिग्नेंसी, मे बी देयर वाज हाइपोफेरेंजियल मेलिग्नेंसी, ग्लॉटिक मेलिग्नेंसी, ओरल कैविटी मेलिग्नेंसी. नाउ दिस इज अ ट्रिक क्वेश्चन. एक चीज हमेशा याद रखना, HPV कैन कॉज एनी मेलिग्नेंसी. ओके, so any malignancy HPV can be associated with of the head and neck domain. But अगर पूछ रहे हैं most common, so the answer becomes oropharyngeal malignancy. Because tonsillar malignancy is the most common malignancy which is encountered by HPV infections. So सब हो सकते हैं. That's what I told you, that the HPV has got two important strains, 16 and 18, which cause malignancy, and 6 and 11 are the ones which cause genital warts and papillomas. So the answer here would become oropharyngeal malignancy without a doubt. Okay, straightforward and simple. Now let's go forward. They must have given you this kind of an image. Okay, now this could be the image. There could have been some other image. Okay, so this could be the image, and they have raised a flap. So can you see this? They have raised a flap, and they have asked you, what is the surgery going on in this patient? ये कौन सी surgery चल रही है, right? So what exactly is the surgery going on? They have exposed this part of the face. If you remember my lecture, if you remember what I have told you in your workbook also, I told you that there is this kind of an incision that we give, and this is called as Weber-Ferguson incision. So Weber-Ferguson incision is given in cases of what? It is given in cases of total maxillectomy. Without a doubt. So if they have asked you what is the procedure going out there, the answer is total maxillectomy. Now, अगर उन्होंने ये पूरा ऐसे उठाया हुआ है, if the option was कि अगर उन्होंने image दी है पूरा उठा हुआ है, then that is mid facial degloving. But अगर उन्होंने maxilla के ऊपर से ये flap उठाया हुआ है, then it is total maxillectomy. तो क्या पूरा flap उठा था कि आधा flap उठा था? अगर पूरा उठा हुआ है, then that is mid facial degloving. अगर आधा है, like a flap, what I have shown you over here, then this is total maxillectomy. The incision that they have given here is Weber-Ferguson's incision. Okay, so the answer would become, so if it is the same, right? But this is not degloving. This is not mid-facial degloving. They have raised a flap by Weber-Ferguson incision. So here the answer would become total maxillectomy, plain and simple. Okay, this is not mid-facial degloving. Mid-facial degloving में दोनों तरफ we raise the flap. It's bilaterally and it is raised up. It is not raised laterally. Okay, fine. Chalo. So now this becomes our question number 6, straightforward about what is total maxillectomy. अब एक क्वेश्चन उन्होंने ये दिया था that there is a boy who presented to the OPD with bilateral conductive hearing loss, high arched palate, nasal obstruction, and the child was diagnosed to have adenoid hypertrophy. अब इसमें tympanometry में कौन सी curve होगी seen in this particular child? Now this I have told you multiple time I have told you, no, not AD curve. See, I have told you this when I was drawing. I have drawn this image for you in your lectures also. Always remember, adenoid के बच्चों में there is eustachian tube obstruction. Eustachian tube obstruction की वजह से होता है otitis media with effusion. Otitis media with effusion is basically forming B curve. And I told you, B का मतलब होता है flat curve. And I told you the mnemonic also, that B curve is flat curve. So flat, F for flat, is seen in cases of F for fluid and F for fata hua eardrum, or we can call it perforation. So F for fluid, F for flat. B curve is the right answer, and that is what is the fluid all about, right? So here the answer would be B curve, not AD. AD is seen in discontinuity of ossicles, D for discontinuity. AS, S for sclerosis, otosclerosis. B curve, fluid and perforation, and A curve is the normal curve. Okay, so AS का different question आया है, उसका different है, where they have told you where to find this A curve. But वो different है, इसका answer B है, adenoid से related, which is a flat curve. ठीक है, चलो अब next question पे चलते हैं. Next question हो गया. Now this was the other tympanometry question where they would have told you, उन्होंने एक A बनाई होगी, they would have marked an A curve, और A के नीचे उन्होंने एक dash बना दिया होगा और कहा होगा ये कौन सी curve है, right? This would have been the question. So in the tympanogram, which curve is shown by the marked arrow? This would have been your question, correct? अगर compliance reduce हो गई है but the pressure is normal, if the compliance is reduced, pressure is normal, what curve it is? It is called AS curve. S is seen in cases of sclerosis. ये mnemonic था, which is seen in otosclerosis and tympanosclerosis. Correct? So answer here would become AS curve because the compliance is reduced without a doubt. Straightforward and simple. Okay? This is what I have told you in your thing also, that see here, this is the AS curve, which is particularly seen in cases of otosclerosis and tympanosclerosis. These were all discussed in my lectures whenever we had those discussions with you. Okay, moving to the next question, the 9th question. Okay, The ninth question is a 35-year-old patient who underwent superficial parotidectomy, superficial lobe of the parotid was removed, right? And for a pleomorphic adenoma. Now the patient had developed a complication of Fraze syndrome post-surgery, which is true regarding Fraze syndrome. Okay, so क्या इनमें से true है? Right, that is what exactly would have been the question. So Fraze syndrome में होता क्या है? Fraze syndrome is also called as gustatory sweating. Fraze syndrome is also given the name as auriculotemporal syndrome. It occurs due to the fibers of auriculotemporal nerve which innervate the skin. Right? So that is why they will be sweating and there will be excessive flushing over on the side where the patient is chewing from. And this would be the right answer except anything else. अगर वो पेन पूछते, it would have been the first bite syndrome. But अगर उन्होंने sweating पूछी है, it is without a doubt about what is Fraze syndrome. Right? यही हमने अपने lectures में भी पढ़ा है that when we remove the superficial lobe of the parotid, the thing is that the auriculotemporal nerve innervates, and that is the point where we see gustatory sweating, also called as Fraze syndrome. ठीक है, अब ऑप्शन ऊपर नीचे हो सकते हैं, that doesn't matter. We are going to straightforward see about ki what is the right answer among them. That is our job. That is what exactly, because there may be many options which they have given. Can't recall most of them, but the main questions should be the right ones. Okay, fine. अब आते हैं 70-year-old man presented to the OPD, bilateral progressive hearing loss, complained of difficulty in hearing in noisy surrounding. किसी को भी noisy surrounding में अगर difficulty होती है, that is a chance that this man has sensorineural hearing loss. See the age of the patient, it is 70-year-old. Right? So 70-year-old with sensorineural hearing loss, bilateral progressive. Pure tone audiometry shows high frequency has dipped down. Right? So अब ये मैंने बार बार आपको लेक्चर में भी पढ़ाया है कि there is a person who has got difficulty in hearing in background noise and the patient has got high frequency dipping curve. 70-year-old male, as it is ये question आया है, the moment I told you, it is as it is and the answer becomes presbyacusis. Without a doubt, it is presbyacusis. Okay, fine, chalo, great. Okay, so I think Sophie is saying you are on track. Thank you. So I think this is all because of the recall of the children who have come back and who have given us the questions. And I'm very happy that ENT was straightforward and simple this time. Okay. Now comes the next question. 30-year-old boy patient came with choking episodes after ingestion of a fish bone while eating. The bone got obstructed at the level of T4. इन्होंने बोला कि foreign body esophagus है and foreign body esophagus में the bone has gotten obstructed at the level of T4. Is constriction of esophagus correspond किस segment को करता है? What is the constriction that is corresponding to? So I have told you in your lectures also many of the times there are 4 constrictions of esophagus: C6, C4, T5, T10. Okay, C6 corresponds to cricopharynx, T4 corresponds to arch of aorta, T5 corresponds to left main bronchus, T10 corresponds to the opening or the gastroesophageal junction. So agar T4 hai, the answer will become arch of aorta. This was the same thing that I have taught you in your lectures also, where I have given you these 4 and the arch of aorta becomes the important one, which is at 25 centimeters from the level of upper incisor. So this becomes your right answer at the level of T4. Okay, fine. Chalo. Now let's come to the next question. Upper part of uncinate process attaches commonly to which part in the nasal cavity? Uncinate process की ऊपर का part कहाँ attach होता है? Right? So in our lateral nasal wall there is uncinate process, correct? अब ये एक, this is not a very good question to frame because uncinate process का upper part attaches to many things. It attaches to many things, but among them, which is the most prominent answer is something that we need to figure out, right? Now, if I tell you what is the most common site, अगर आपको lamina papracia option में होगा, then lamina papracia would have been the best answer. If lamina papracia is not there, then you will have middle turbinate as the best option post that. अगर आपका ये different था, so if not lamina papracia, then your answer will become middle turbinate. Because if you remember, I told you that uncinate has got multiple attachments. ये अलग-अलग level पे करती है. Where the 6th type is that the uncinate attaches to the middle turbinate. But most commonly, the uncinate attaches to the lamina papracia or the medial wall of the orbit. तो दोनों में से इसमें आंसर क्या होगा? The answer will become middle turbinate automatically अगर lamina papracia नहीं है, which is also the medial wall of the orbit. Okay, so here it will be middle turbinate. Okay, not bulla ethmoidalis अगर नहीं है कोई बात नहीं, कोई फर्क नहीं पड़ता, that is not a problem. But ये दो important हैं which you need to rule out among your answer. Okay, so most prominently middle turbinate ही answer होगा. If you marked it, then you are right. ठीक है, चलो अब आगे बढ़ते हैं. Next question that came was something about this kind of a swelling. Now it might not be the same image. ये हो सकता है image दूसरी हो. But this was a question that I have framed it by hearing multiple people that this was about an ear discharge which was constant. काफी time से there was a history of ear discharge and then they had got a swelling in front of the preauricular area. Okay. Now, if there is a swelling that is in front of the preauricular area, then it is zygomatic abscess. Right? अगर ear के सामने swelling है, that means ear was discharging since a long time. That means this patient was of chronic otitis media. अब अगर chronic otitis media में, if you see one complication where abscess form in front of the ear, then that answer would become zygomatic abscess. अगर sternocleidomastoid होता तो it would have been Bezold abscess. Digastric triangle होता it would have been Citylis abscess. Post-oral swelling hoti, it would have been post-oral abscess. But agar if it is in front of the ear, it would have been a different image. Not a problem. But agar pre-auricular area mein swelling hai, chronic otitis media ka patient hai, the answer straight away becomes zygomatic abscess. Because if you remember in your lectures also I have told you that zygoma is in front of your ear and infection if it travels over here, it can cause a big abscess formation which is called as zygomatic abscess. That is why the zygomatic abscess here would be the most important kind of a diagnosis that would come out. Okay, not Citylis abscess. Citylis abscess hota digastric triangle. Bezold abscess hota sternocleidomastoid. ठीक है, तो और कोई swelling यहाँ पे नहीं हो सकती है in the preauricular area except for zygomatic abscess. Right? Okay. What is the likely function of the part of the tracheostomy tube that they have mentioned? तो उन्होंने ये उन्होंने mention किया होगा about the tracheostomy tube and they would have asked you इसका function क्या होता है. Now imagine this is the same thing. अभी आपका जो हाल में TND हुआ था, I told you exactly. Okay, lamina papracia was the option. Great. अगर lamina papracia was the option, then lamina papracia would be the right answer. Because among middle turbinate and lamina is the most commonly the one where the uncinate attaches. ठीक है? चलो. तो अब ये क्या करेगा? What is this? This is the cuff of tracheostomy tube, also called as balloon of tracheostomy tube. अगर किसी के कफ या बलून होता है, then all the secretions get collected over this cuff and that is the one which will prevent any particular thing to go down into the lungs. That is why the primary function is to prevent aspiration. Okay, this is the same thing as it is what it came. So I've told you that this is the cuff of the tube, right? And this is the one which prevents any kind of aspiration to go down into your lower tracheobronchial tree. Okay, so answer here would become prevention of aspiration. Straight and simple. ठीक है, this is what? This is the cuff or balloon. ठीक है, चलो अब next question पे आते हैं. Narrowest area in the adult airway is. ये straight forward and simple है, इसमें कोई भी logic नहीं है. This I have told you when I was discussing about the larynx. The smallest area in the adult is glottis. Smallest area that is there in the children is subglottis. Okay, so Bezold abscess था answer. If it is sternocleidomastoid, यहाँ पे abscess होती तो Bezold है. But if it is not here, then it is zygomatic. Okay, so remember that. So what is this? If it is the narrowest area in adults, what is that? It is glottis. If they have asked you narrowest area in children or in infants, the answer is subglottis. So I think the question asked was about the narrowest area in adults, right? अगर children पूछा था, then it is subglottis. वो सबसे छोटा होता है in subglottis, in cases of children. तो याद रखना, this is an adult and this is in children. So whatever they have asked you, the answer would correspond to that. If children पूछा है, the answer would be subglottis. ठीक है, चलो अब चलते हैं into the next. I think this is the final one. So that's it, right? So endotracheal tube will come. I think Dr. Vinish will come and take up the other parts of the airway. ठीक है? So again, thank you very much for attending today's session. I hope you guys got many right in ENT specifically because they were very straight and simple. ठीक है? So all the best to all of you. and keep reading. Now I would straight away further on proceed to give it to Manjunath sir, who will take up the forensic session. Thank you.
Yes, good evening, all of you. Yes, so we are going to discuss forensic medicine questions in 10 to 15 minutes. Okay, maximum 10 to 15 minutes. Yes, let's start with the questions and the answer. I think one question was about lead poisoning, basophilic stippling, right? It is repeatedly asked. Basophilic stippling is seen in which of the following poisoning? Straightforward question. The answer is lead poisoning. It is because of 5-nucleotidase inhibition. So answer is lead. Right? KGM gamer? Yes. Next question. I think there was a question about drowning. Can anyone help me? What was this time and the question? Was it about dry drowning or wet drowning? Nitin Bharti? There was a question for sure about drowning. Wet drowning. Okay. Okay. Was this the question? A man found in swimming pool with the fluid collected in the lung. All are seen in this case of drowning except. Options are asphyxia, ventricular arrhythmia, hypokalemia, hyponatremia. Then, okay, water in the stomach and lung. So it must be a case of wet drowning. Okay. So as you know, wet drowning, the water is found in the lungs. So options were different. Okay, fine. So in dry drowning, no water in the lungs. In wet drowning, definitely there will be water. It can be emphysema aquosum or else it is edema aquosum. So the answer is wet drowning. If water is found in the lungs, froth is there, then it is conscious drowning. The answer is emphysema aquosum or wet drowning it is, or conscious drowning. Okay, froth was there. Okay, fine. Froth, water in the lung. Yes, now it is, answer is wet drowning for sure. So wet drowning, fine, done. Then I think there was one question about ergotism. Ergotism, I think ergotism, right? A patient came with a history of convulsion, nausea, vomiting, following consumption of infected grain. So ergotism, so because of the ergot alkaloids, right? Okay, fine. Ergotism. Ergotism is also known as Saint Anthony fire. We discussed many times in our classes. Done it is. Okay, fine. Ergotism, okay. And one more question, that is about the intracranial hematoma. Thunderclap headache. Thunderclap headache, worst headache of the life. The answer is subarachnoid hemorrhage. Very simple. Thunderclap headache is seen in subarachnoid hemorrhage because of rupture of berry aneurysm. SAH. Very good. Dr. Rahul, very good. Answer is SAH. Done it. EDH, middle meningeal artery. SDH, that is because of bridging veins. Smoking stool syndrome, it is because of the yellow phosphorus. Done it is fine. Teardrop sign, already discussed by many faculties. Okay. So teardrop sign is seen in case of blowout fracture. Blowout fracture rolled out. Done it is easy. Was there any question about carbon monoxide poisoning? Can anyone help me? Carbon monoxide poisoning, CO poisoning, or cyanide poisoning, cherry red discoloration postmortem hypostasis. Okay, good, good. Only description, fine. Cherry red postmortem staining. So whenever question asked, very commonly discussed in our classes. Cherry red discoloration seen in case of carbon monoxide poisoning. In cyanide, it is bright red. In phosphorus, it is yellow or it is dark brown. OPH, it is black. So the answer is carbon monoxide because of presence of carboxyhemoglobin. Fine, it is done. Then there was a question about summons, I think. Right? Can anyone tell me what was the question asked about the summons? Right? Okay. Cherry red was mentioned. That is fine. Okay. Okay. Wet drowning, dry drowning. Answer is wet drowning. So in dry drowning, froth is absent. So it is wet drowning for sure. Okay. Methyl leakage in a room, cause of death. So, okay. I think summon, there was a question about summon. 2 summons at a time. Just remember 3 rules. Higher court have preference over lower court. That is rule number 1. Rule number 2, civil court have preference over criminal court have preference over civil court. And the last rule is first come first. I think this was the question asked, right? Okay, 2 expert witness for murder and rape. Okay. Fine. So just remember, when 2 summons, higher court, they have preference. Criminal court, they have preference. And the last point is first come first. So here the answer is higher court will be given preference over the lower court, irrespective of date of receiving summon and type of case. Okay. Same court. Same court means it is the first come first. That is the answer. The summons, the one which reaches the doctor first, that is the answer. Okay. Fine it is. Again, it is a simple concept. I think this question, was it there? Toxic principle in case of Letheriasis. Letheriasis. Dr. Ashok Chowdhury. Okay. So the answer is here, very simple. It is BOAA, beta-oxalyl aminoalanine. Okay. First option was fluorosis. Okay. Yes, fluorosis. So it can be crippling fluorosis, right? I think this was the question asked, right? Crippling fluorosis, what is the fluorine level? So anyway, it is going to be discussed by our Rajesh sir in the biochemistry. So the level more than 10. When level more than 10 milligram per liter, so it leads to crippling fluorosis. Okay, chalo. Next, I think there was a question about organized crime. Section 111 of Bharatiya Nyaya Samhita. So can anyone correct me? Section 111 of Bharatiya Nyaya Samhita corresponds to. Options are organized crime, medical negligence, grievous hurt, vitriolage. Vitriolage is 124 BNS. Grievous hurt, 116 BNS. We discussed many times in our classes. Medical negligence, 106 BNS. So I think by rule out method, answer is A. A, I think. Okay. Chalo. And one more question from BNS. That is, act done by a doctor in good faith without consent in emergency corresponds to. In emergency, the doctor can do surgery even without the consent. In good faith, the law will presume the consent. That is basically known as 30 BNS. 30 BNS. Okay. And I think this was the question asked about the consent. One more question. In a clinical scenario, doctor was supposed to do surgery for cyst resection. He accidentally finds some growth and he resected the growth, which consent is breached here. The options are doctrines of extension, informed consent, blanket consent, implied consent. Implied consent. Yes. I think this was the question asked, right? Can anyone correct me about the options? The options are doctrine of extension, informed consent, blanket consent, implied consent. Because it is something new that is asked in the exam. What about the option? Gamer, what are the options in the same question about the consent? It is not definitely blanket consent. Implied consent basically for the clinical examination, not for the surgery. So C and D ruled out. So we have A and B now. A and B. So the answer is doctrine of extension. So A is better than B. That is the correct answer. If that is not given, then it is informed consent. Okay, fine. Anyway, that is okay. Appendix is, that's fine. Yeah. Then antidote, very simple question. Antidote in opioid poisoning. The answer is naloxone. Done, it is easy. Then there is one more question, I think already discussed by Rishabh sir. Bucket handle fracture is seen in. Options are battered baby syndrome, blunt force trauma, non-accidental trauma, Marshall's triad. I think naltrexone was given. Anyway, that is naltrexone is the answer. Okay. Okay, crippling. Okay, that is fine. More than 10, that's fine. So what about this question? Can anyone answer? Bucket handle fracture. It is not Marshall triad. Marshall triad seen in blast injury. That is ruled out. It is not blunt force trauma. Basically, it is non-accidental trauma. Can be a case of child abuse. Can be a case of child abuse. Yes, so this completes the forensic medicine, and most of the question, around 12, 13 question directly from the YT classes as well as the in-app live classes. Yes, anyway, wish you all the best. Thank you.
हेलो फ्रेंड्स, गुड इवनिंग। एक तो सबसे पहले तो आपके पेशेंट्स को सलाम है। एग्ज़ाम उसके बाद इतना आप देर तक बैठे हो और टीचर्स को हेल्प कर रहे हो। मुझे भी थोड़ी हेल्प करनी पड़ेगी आपको, क्योंकि 4 बजे से मैं भी लगा हूँ, स्टूडेंट्स को क्वेश्चंस पूछ रहा हूँ, फिजियो के क्या क्या क्वेश्चंस आए। और मैंने ऐसा देखा कि बहुत सारे स्टूडेंट्स को रिकॉल नहीं हो रहे क्वेश्चंस, तो इसका मैं अच्छा ही मतलब निकालता हूँ कि इतने सिंपल क्वेश्चंस रहे होंगे कि आपको शायद वो क्वेश्चंस याद नहीं आ रहे हैं। सो लेट्स सी, लेट्स मुझे जितने भी क्वेश्चंस मिल सके हैं या टॉपिक्स, एक तो ऑब्जर्वेशन ये है कि ये टॉपिक्स हर साल इसी के ऊपर क्वेश्चंस आते हैं, तो इस बार भी आए हैं। लेट्स स्टार्ट विद द फर्स्ट वन। सो पहला क्वेश्चन देखते हैं जो मुझे मिला, और स्टूडेंट्स ने कहा कि एक्शन पोटेंशियल का कोई ग्राफ आया था। तो ये एक्शन पोटेंशियल का ग्राफ था, ऐसा 2-3 स्टूडेंट्स ने कहा। तो क्या ऐसा ग्राफ था एक्शन पोटेंशियल का? यू विल हैव टू हेल्प मी कंस्ट्रक्टिंग द क्वेश्चंस। टॉपिक्स तो मुझे पता है बाय एंड लार्ज क्या क्या टॉपिक्स पे क्वेश्चंस आए हैं, लेकिन उसका मतलब क्वेश्चन क्या था, ऑप्शंस क्या थे, इसके ऊपर थोड़ा सा आप मुझे बता सकते हो, सो दैट द क्वेश्चंस विल बी कंप्लीट। सो ये ग्राफ था और क्वेश्चन क्या था इसके ऊपर? सो बेसिकली फेजेस पूछी गई थी, ऐसा स्टूडेंट्स कह रहे थे काफी सारे, जैसे कि आरएमपी, फिर थ्रेशोल्ड, ए इज आरएमपी, बी इज थ्रेशोल्ड, उसके बाद डीपोलराइजेशन, स्पाइक, then the D is after depolarization and E is after hyperpolarization. Marking on the point D, मतलब क्या ये वाला point? Marking was on the point D. Okay, B to E phases were asked. ठीक है, तो basically आई एम श्योर, क्योंकि बहुत सिंपल सा क्वेश्चन है, आपने 100 बार किया होगा एक्शन पोटेंशियल का, कि A इज आरएमपी, B इज थ्रेशोल्ड, उसके बाद डीपोलराइजेशन, या अगर ये फेज दिखाई तो दिस इज स्पाइक। ये फेज जो है अगर आपको मालूम हो, दिस इज आफ्टर डीपोलराइजेशन। मैं तो इस ग्राफ में बता रहा हूं, आपको एक्चुअली एग्जाम में किस पॉइंट पे एग्जैक्टली पूछा गया था। अच्छा, थ्रेशोल्ड बी, ओके, एक्शन पोटेंशियल ऑफ द नर्व फाइबर, ये क्वेश्चन था, एग्जैक्टली हम वही डिस्कस कर रहे हैं। और थ्रेशोल्ड बी करेक्ट, ओके। ऑप्शंस वेयर सी इज हाईली एक्साइटेबल, डी इज रिफ्रैक्टरी पीरियड, ओके फाइन। तो मैं जस्ट क्वेश्चन नोट कर लेता हूं, और आप जो ऑप्शंस बता रहे हैं वो भी यहाँ पे मार्क कर लेता हूं, सो दैट आई विल गेट अ कंप्लीट क्वेश्चन ऑन दिस, एंड नेक्स्ट टाइम जब हम भी तुरंत एग्जाम के, मतलब कल से हम बना लेंगे पीपीटी एंड विल गिव इट टू यू। सो एक्शन पोटेंशियल ऑफ द नर्व फाइबर, आप लोगों को भी फिजियो के क्वेश्चंस इतने इजी लगे क्या कि किसी बहुत सारे लोगों को याद ही नहीं आ रहे? मतलब आसान, डिफिकल्ट क्वेश्चन याद रहता है ना कि अरे वो क्या क्वेश्चन था, इजी क्वेश्चन भूल जाते हैं, हाँ एकदम मार्क करके आगे चले जाते हैं। चलो नेक्स्ट देख लेते हैं। एक ये क्वेश्चन था, क्वेश्चन ऑन द क्लियरेंस फॉर्मूला, क्वेश्चन ऑन द क्लियरेंस फॉर्मूला, इतना ही मालूम पड़ा। क्वेश्चन क्या था एग्जैक्टली, फॉर्मूला देके पूछा गया था या और कुछ था? सो आपको पता होगा, क्लियरेंस फॉर्मूला इज यूवी अपॉन पी, ऑल राइट, पेन, यूवी अपॉन पी, ओके, VD given 8 hours T and half given, 8 hours half life was given, okay fine, बट क्वेश्चन क्या था एग्जैक्टली ये 1300 6300 क्या है? KGMU गेमर, ओके, बायो अवेलेबिलिटी गिवन, T half was given, ठीक है, T half was given, तो क्लियरेंस फॉर्मूला में T half कहां पे आता है? क्वेश्चन वाज ऑन क्लियरेंस फॉर्मूला, ओके, एंड टू मोर ऑप्शंस विथ 1000 to 2000, but the question was on what? Was it on clearance formula or on what? क्योंकि अगर हाफ लाइफ दिया है तो वो क्लियरेंस फॉर्मूला के लिए नहीं होगा। हाँ, दिस इज अ फार्मा क्वेश्चन, आई थॉट सो, दिस मस्ट बी अ फार्मा क्वेश्चन। जब टी हाफ दिया है तो ड्रग के उन्होंने ये भी दिए हुए हैं, कोई बात नहीं। अगला क्वेश्चन देखते हैं, फार्मा में कवर हो जाएगा ये। एब्सेंट ए वेव इन द जेवीपी, वाज दिस द क्वेश्चन? अगेन ये मेडिसिन का क्वेश्चन है, बट बहुत सारे स्टूडेंट्स ने फिजियो क्वेश्चन में जब पूछा था तो ये क्वेश्चन बताया, एब्सेंट ए वेव इन द जेवीपी इन द एट्रियल फिब्रिलेशन, क्या क्वेश्चन था ये? अच्छा, एब्सेंट नहीं था, कैनॉन ए वेव, ओके, एब्सेंट ए वेव था, इसमें भी थोड़ा सा कंफ्यूजन है, बट एनीवेज अगर एब्सेंट ए वेव है, एट्रियल फिब्रिलेशन है, बिकॉज ए वेव इज बिकॉज ऑफ द एट्रियल सिस्टोल, एट्रियल कॉन्ट्रैक्शन, एट्रिया का प्रेशर राइज होता है और उस वजह से वो अपस्ट्रोक ए वेव आती है। एट्रियल फिब्रिलेशन में वो इतना वीक होता है कॉन्ट्रैक्शन कि वो ए वेव एब्सेंट हो जाती है, ओके। इमेज आस्क्ड अबाउट बी एंड डी, ओके, एब्सेंट ए वेव, एट्रियल फिब्रिलेशन, इरेगुलरली इरेगुलर पल्स, तो मतलब ये केस दिया था, ओके। सो आई होप कि मेडिसिन में डिस्कस हो जाएगा। आप कुछ क्वेश्चंस रिकॉल करो, आपको अगर फिजियो के कुछ क्वेश्चंस रिकॉल हो रहे तो, क्योंकि मुझे 4-5 ही क्वेश्चंस मिले, स्टूडेंट्स को इतने ही याद आ रहे थे, और आप देख सकते हो उसमें भी फिजियो नहीं, मेडिसिन के क्वेश्चन बता रहे थे। हाँ, ये एक कॉमन वाला क्वेश्चन है, ये हर साल पूछा जाता है अबाउट दैट ईसी कपलिंग। तो व्हाट वाज द क्वेश्चन? राइनोडाइन रिसेप्टर एंड सार्कोप्लाज्मिक रेटिकुलम, जितने भी स्टूडेंट्स को पूछा उन्होंने ये दो ही वर्ड्स बताए। तो क्या ये क्वेश्चन याद आ रहा है आपको? ओके, केजीएमयू गेमर ने जी ने क्वेश्चन बताया, कंप्लीट क्वेश्चन, कि एट्रियल फिब्रिलेशन, इरेगुलरली इरेगुलर पल्स एंड बाकी सारी चीजें दी थी, ओके। चलो, ये क्वेश्चन anybody can recall, can anyone recall this question? Ryanodine receptor and sarcoplasmic reticulum, कैल्शियम इन द ऑप्शन। क्वेश्चन क्या था? बहुत मैं 4 बजे से पूछ के थक गया हूं, लेकिन क्वेश्चन ही रिकॉल नहीं कर पा रहे स्टूडेंट्स। तो एग्जैक्ट क्वेश्चन क्या था ये वाला? ये तो डेफिनेटली फिजियोलॉजी का क्वेश्चन है। कैल्शियम वाज इन द ऑप्शन, सेम क्वेश्चन, लेकिन क्वेश्चन ओके चलो ठीक है। आपको क्वेश्चन याद आया था जो है तो मुझे कल तक बता देना टेलीग्राम ग्रुप पे या किसी भी प्लेटफॉर्म पे अपने पीडब्ल्यू के, so that we will make a complete thing for physiology session, and then we can put it up on the YouTube. But if ryanodine receptor was asked, calcium will be released and makes hyperthermia. Options में hyperthermia था. डॉक्टर आनंद शर्मा इज सेइंग गिया बारे सिंड्रोम। नहीं 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 नहीं, पहले ये खत्म कर लेते हैं फिर वो देखते हैं। सो बेसिकली आपको याद होगा ईसी कपलिंग में देयर इज अ टी ट्यूब्यूल and there is this L tubule. That's the sarcoplasmic reticulum. यहाँ पे T tubule के membrane में है DHPR, which is a voltage sensor, and L tubule के membrane में है अपना RYR, ryanodine receptor. So there is release of calcium from the RYR, and when does that release occur? When DHPR mechanically interacts with RYR. There is release of calcium into the sarcoplasm and resulting in muscle contraction. And this इसका RYR का defect results in malignant hyperthermia. So malignant hyperthermia was asked, and okay, KGMU gamer कह रहे I put on calcium, hypercalcemia. Okay, fine. Just construct the question please, so that I can discuss it in a better way. और यही 4 बजे से चल रहा है, मैं हर स्टूडेंट को पूछ रहा हूं, तो किसी को कैल्शियम याद है, किसी को रैनोडाइन रिसेप्टर याद है, मैलिग्नेंट हाइपरथर्मिया याद है। कोई बात नहीं, होता है ऐसा, सिंपल क्वेश्चंस रहे होंगे और आपको इसलिए वो याद नहीं रहे, बट यू नो दिस ईसी कपलिंग। और एक बात क्लियर है कि ये बहुत ही फेवरेट टॉपिक है फिजियोलॉजी प्रोफेसर्स का, यानी हर साल एफएमजी एग्जाम्स में इस टॉपिक के ऊपर क्वेश्चन आता ही आता है। ऑल राइट, in the question mention about hyperthermia and ryanodine receptor involve, what is the mechanism? Oh okay, what is the mechanism? भीम सिंह जी कह रहे हैं, ठीक है। तो basically genetic defect of the RYR, the gene that codes for RYR, and therefore when such a person is administered halothane ether or inhalation or succinylcholine muscle relaxant, so there is excessive release of calcium from the RYR because of the defect, genetic defect, and that results in the condition called as malignant hyperthermia. तो ये क्वेश्चन था एक जो मिला मुझसे और मतलब स्टूडेंट से। और SIADH ऐसा क्वेश्चन था कोई SIADH के ऊपर, व्हाट वाज द क्वेश्चन? आई एम श्योर इट विल बी डिस्कस्ड इन मेडिसिन आल्सो, बट since students could not recall physiology questions at all, I am taking it as a good sign कि इतने सिंपल रहे होंगे कि बस आपने देखा, मार्क कर लिया, आगे चले गए, और इसलिए शायद आपको वो याद नहीं आ रहे होंगे, एंड दैट्स अ गुड साइन। किसी क्वेश्चन का आंसर रूल ऑफ हाल्स था क्या? अडी इज आस्किंग, लेकिन ये क्वेश्चन का आंसर आप पूछ रहे हो, क्वेश्चन क्या था, एंड वाज इट फिजियोलॉजी? ओके, हाँ, नाउ आई एम गेटिंग अ फुल क्वेश्चन फॉर द फर्स्ट टाइम सिंस 4 o'clock इन द इवनिंग। भीम सिंह जी कह रहे इन वन क्वेश्चन, long time one man goes to the trip from Delhi to Leh, what is the mechanism of high altitude? And in answer was hyperventilation and metabolic alkalosis. No, it is respiratory alkalosis. हाई altitude में जाने पर hypoxia होता है. Hypoxia stimulates the peripheral chemoreceptors. That stimulation of ventilation. Ventilation stimulated means CO2 is washed out of the body. CO2 matlab H plus. Acids are washed out, and this results in Respiratory alkalosis. Yes, hypoxia was given and symptoms of, okay. तो भीम सिंह जी, आपका क्वेश्चन जो था उसका आंसर हाइपरवेंटिलेशन रिजल्टिंग इन रेस्पिरेटरी अल्कलोसिस. बट गुड, एटलीस्ट एक नया क्वेश्चन तो आया सामने. SIADH was not there, but there is question about pituitary damage, and after that there is symptoms of polyuria, polydipsia. Okay. Same question asked release of calcium, and one option was inhibition of calcium. ठीक है. Respiratory alkalosis and high ventilation, yes. तो भीम सिंह जी कह रहे कि yes, that's the correct answer. And hyperventilation with respiratory alkalosis, histamine release in the cold may be this one, influx of sodium. ठीक है, ठीक है. हाइपोक्सिया आंसर हो सकता है अगर हाई अल्टीट्यूड में क्या प्राइमरी प्रॉब्लम है वो पूछा है तो आंसर इज हाइपोक्सिया. लेकिन अगर रेस्पिरेटरी प्रॉब्लम क्या पूछा है या एसिड बेस्ड प्रॉब्लम तो इट विल बी रेस्पिरेटरी अल्कलोसिस. SIADH से रिलेटेड कोई क्वेश्चन था क्या? 2-3 स्टूडेंट्स ने बताया SIADH से रिलेटेड कोई क्वेश्चन था. खैर, आप में से कुछ लोग कह रहे कि ऐसा कुछ नहीं था SIADH. तो अभी मेडिसिन का बाकी है, तो तब तक आपको याद आ जाए तो बता देना. और कोई क्वेश्चन याद आ रहा है फिजियो का? I had only this much matter on physio since 4 p.m. in the evening today, means after your exam. So, okay, only pituitary damage was given. Fine. And desmopressin drug was there. तो ये फार्माकोलॉजी में जरूर डिस्कस होगा. इतना ही कंटेंट था मेरे पास फॉर नाउ, but I'll come back to you in a day or two with a proper set of questions and their answers and explanations. Thank you. Over to you, Rajesh sir.
Thank you, Vivek sir. Now we'll discuss the biochemistry questions. थोड़ा फास्ट डिस्कस करते हैं क्योंकि scarcity of time है. So there were 11 to 12 questions from the biochemistry, and the level it is moderate level questions were there and integrated with other subject. जैसे अभी हमने just respiratory alkalosis वाला question देखा. So वैसे देखे जाए तो 13-14 questions थे, उसमें से pure biochemistry वाले 8-9 questions were there. So we'll discuss one by one. See, lactic acidosis is caused by deficiency of which vitamin? Here these all vitamin deficiency causes lactic acidosis, but the most probable and most correct answer here is thiamine, because this thiamine, it is required for the pyruvate dehydrogenase complex. So this catalyzes this reaction, pyruvate conversion of this pyruvate into acetyl coenzyme A. This step, acetyl coenzyme A, this is pyruvate dehydrogenase complex, and for this pyruvate dehydrogenase complex, the major coenzyme is thiamine pyrophosphate. This is major coenzyme. Rest of the other coenzymes, they are minor. So other coenzymes are lipomide, coenzyme A, FAD means B2, and NAD means B3. So B2 and B3 means riboflavin is there, niacin is also there. But this is major one. Deficiency causes this diversion of pyruvate for the lactate synthesis, and lactic acidosis is there. Also, this biotin deficiency causes lactic acidosis, but this is a secondary cause or less severe cause of lactic acidosis, because the pyruvate carboxylase, the carboxylation reaction of gluconeogenesis requires biotin. But here the most probable answer is thiamine. Remember, it is thiamine. थायमिन पे और एक क्वेश्चन था तो वो हम डिस्कस करेंगे. सो दिस वाज द क्वेश्चन. लैक्टिक एसिडोसिस इज कॉज्ड बाय डेफिशिएंसी ऑफ मेनली थायमिन डेफिशिएंसी. Which gene is mutated in Marfan syndrome? This question ये already cover किया है रंजीत सर ने, तो मैं इस पे ज़्यादा नहीं जाऊंगा. So there is fibrillin 1 gene mutation on chromosome 15. Fibrillin, it is a large glycoprotein, and it acts as a scaffold for elastin. And it is present in 3 important tissues. One is the periosteum. Second one is the media of the aorta, and third is the lens. So in the fibrillin 1 gene mutation, because of the decreased interaction with the transforming growth factor beta,
So there is mutation of this fibrillin 1 gene, and deficiency or defective fibrillin synthesis causes affect the periosteum, causes the symptoms, skeletal manifestations, aneurysm of aorta, which is a fatal manifestation, and in lens it causes the superotemporal subluxation of lens. So subluxated lens is there in the Marfan syndrome. So fibrillin 1 gene mutation is there in the Marfan syndrome. Now the third question, see, a child with breastfeeding present with lethargy, hepatomegaly and cataract, most likely enzyme deficient is. This is a case of classical galactosemia, and classical galactosemia is because of galactose 1 phosphate uridyl transferase defect. अगर इसका डिफेक्ट हो गया, so there is accumulation of galactose 1 phosphate which causes the symptoms, means hypoglycemia, mental retardation, hepatomegaly, decreased uptake of bilirubin, so it causes the jaundice, and the diversion of galactose for the dulcitol production by the aldose reductase causes the cataract. So here answer is galactose 1 phosphate uridyl transferase. So galactokinase deficiency is mostly asymptomatic, causes the cataract only. ग्लूकोज 6 फॉस्फेटेज डिफिशियंसी, दिस इज द वोन गर्ग डिसीज, और ऐसा ग्लूकोज 6 डिकार्बोक्सिलेज से रिलेटेड कोई डिसीज नहीं है. ओके, सो हियर आंसर इज गैलेक्टोज 1 फॉस्फेट यूरिडिल ट्रांसफरेज, गैलेक्टोसेमिया, क्लासिकल गैलेक्टोसेमिया. A patient have been diagnosed with carcinoma with positive family history of HNPCC, hereditary non-polyposis colorectal cancer. It is due to which of the following repair mechanism defect? हर साल हर एंट्रेंस एग्जाम में इस पे क्वेश्चन आता है. थायमिन पे भी हर बार क्वेश्चन रिपीट होता है, थायमिन नियासिन पे भी रिपीट होता है. सो दिस इज रिपीटेड क्वेश्चन हियर. द HNPCC, so there is family history, family tree is involved, and the relatives they are involved. One of the relatives should be less than 50 years of age. This is one of the criteria for diagnosis of HNPCC. It is due to mismatch repair defect, that is methyl directed mismatch repair defect. इसका अगर डिफेक्ट हो गया न्यूक्लियोटाइड एक्सीजन रिपेयर, इट कॉजेज जीरोडर्मा पिगमेंटोजम. मिसमैच रिपेयर डिफेक्ट कॉजेज लिंच सिंड्रोम और हेरिडेटरी नॉन पोलिपोसिस कोलोन कैंसर. Base excision repair is related with the mute YH related polyposis, and double strand break repair causes many diseases. So SCID is there, ataxia telangiectasia is there, Bloom syndrome, Fanconi's anemia, and breast cancer susceptibility. So here answer is methyl directed mismatch repair defect which causes HNPCC or Lynch syndrome. A man present with high LDL. So यहाँ पे थोड़ा सा complicated question है. हाई LDL, ये थोड़ा भी चेंज हो गया, यहाँ पे LDL के जगह पे अगर काइलोमाइक्रोन TG भी आ गया तो भी इसका आंसर चेंज हो जाएगा. विथ इरप्शंस ऑन द स्किन हैविंग इरप्टिव ज़ैंथोमा, सो इरप्टिव ज़ैंथोमा के जगह पे टेंडोन ज़ैंथोमा आ गया तो भी इसका आंसर चेंज हो जाएगा. मोस्ट लाइकली ही इज सफरिंग फ्रॉम फैमिलियल हाइपरलिपिडेमिया. अभी ये फैमिलियल हाइपरलिपिडेमिया अगर फ्रेडरिक्सन क्लासिफिकेशन में आप डालते हो तो इट कवर्स ऑल दिस थ्री. तो थोड़ा सा इसमें मुझे डाउट है कि इसमें ऑप्शंस क्या थे. सो फैमिलियल हाइपरलिपिडेमिया भी आंसर है, एंड द सेकंड इंपॉर्टेंट इज द फैमिलियल डिसबीटा लाइपोप्रोटीनेमिया. इसमें भी सेम सिम्टम्स होते हैं क्योंकि ओवरलैपिंग सिम्टम्स दिए, ऐसे स्पेसिफिक नहीं दिए है. इन फैमिलियल हाइपरकोलेस्टेरोलेमिया देयर इज इंक्रीज इन द कोलेस्ट्रॉल लेवल, यहाँ पे कोलेस्ट्रॉल इंक्रीज होता है. यहाँ पे टेंडोन ज़ैंथोमा रहता है, टेंडोन ज़ैंथोमा इज देयर, एंड देयर इज रिस्क ऑफ एथेरोस्क्लेरोसिस. So there is risk of coronary artery diseases in when there is increase in the cholesterol level because of LDL receptor defect or ApoB100 defect. Familial triglyceridemia, it is a type 4 and type 5 of the Fredrickson classification. इसमें क्या होता है, या तो VLDL का ओवर प्रोडक्शन होता है या काइलोमाइक्रोन का क्लियरेंस कम हो जाता है, तो उसकी वजह से VLDL और काइलोमाइक्रोन दोनों बढ़ते हैं. And there is because of increase TG carrying triacyl glycerol carrying lipoprotein, ये बढ़ने की वजह से, मतलब TG बढ़ने की वजह से there is risk of pancreatitis. There is risk of pancreatitis, and there is eruptive xanthomas. Eruptive xanthomas in this condition. Xanthomas in this condition. In familial dis-beta lipoproteinemia, this is a type 3 according to the Fredrickson classification type 3. Familial dis-beta lipoproteinemia. In this disorder, there is ApoE defect. So because of ApoE defect, there is decreased uptake of the VLDL remnant. VLDL remnant means IDL, and there is decreased uptake of the chylomicron remnant. Because of this, there is increase in the cholesterol level. Because of this, there is increase in the cholesterol level. Also, there is increase in the TG level, and it manifests as Palmer xanthomas or the tuberous xanthomas or tendon xanthoma, and sometime it can manifest as eruptive xanthomas also, which is given here, eruptive xanthomas and increase in the LDL cholesterol level. So here दोनों आंसर करेक्ट है, फैमिलियल हाइपरलिपिडेमिया भी करेक्ट है और फैमिलियल डिसबीटा लाइपोप्रोटीनेमिया भी करेक्ट है, क्योंकि ये पूरे सबको इन्वॉल्व करता है. एंड फैमिलियल डिसबीटा लाइपोप्रोटीनेमिया, देयर इज इंक्रीज इन द कोलेस्ट्रॉल लेवल, देयर इज आल्सो इंक्रीज इन द टीजी लेवल, सो देयर इज चांसेस ऑफ इरप्टिव xanthoma इज ऑल्सो देयर. ओके, सो थोड़ा बहुत वेरिएशन ऑप्शन में हो सकता है, ऐसा मुझे लगता है. इफ एनीवन इज हैविंग द ऑप्शंस, प्लीज लेट मी नो द ऑप्शंस हियर फॉर दिस क्वेश्चन ओनली. Not for this question only. Pancreatitis was there. High KGMU gamer. Yes, high TG अगर chylomicron है तो इसका आंसर चेंज हो जाएगा. अगर हाई TG एंड chylomicron इज देयर, इट इज familial ट्राइग्लिसराइडेमिया टाइप 4 एंड टाइप 5. मैंने पहले ही बोला आपको कि थोड़ा भी वेरिएशन हुआ इसके क्वेश्चन में तो आपका आंसर चेंज हो जाएगा. Yes, if it is with high TG and high chylomicron, see, we'll note this. It is increased triglyceride and increased chylomicron level with eruptive xanthoma. If it is not there, if it high LDL is not there, answer is familial triglyceridemia. Answer is familial triglyceridemia type 4 and type 5, specifically type 5 where there is VLDL increases and the chylomicron clearance is affected. So both VLDL and chylomicron level increases. So यहाँ पे आपके क्वेश्चन के आपको जो क्वेश्चन आया था उसके हिसाब से यहाँ पे आंसर चेंज होगा. So this is again a VIP question, star rated topic from the biochemistry, a trending topic है ये, और vacutainer, Gaucher's disease, ये सब, और thiamine and niacin, these are the trending topic. Options are right, sir. So answer here is familial triglyceridemia if there is increase in the TG and chylomicron level. Wilson's disease, the best investigation, the choice investigation of choice are the diagnostic test for Wilson's disease. ये हमने अभी जो FMGE का सेशन लिया उसमें भी लिया था कि Wilson's disease के लिए diagnostic test है the liver biopsy and quantification, quantitative assay of the copper in the liver biopsy sample. In this sample, you will get the copper level more than 200 microgram per gram of liver tissue. This is a gold standard test for the diagnosis of Wilson's disease. This can be used for the screening, that is 24-hour urinary copper, or ceruloplasmin can be used. Ceruloplasmin level also used for the screening purpose. So there is decrease in the ceruloplasmin level. 24-hour urinary copper it can be used for the screening, but this is the best test for the diagnosis of Wilson's disease. Remember this. KF ring is there in 99% of cases with neuropsychiatric manifestation, but it is not a diagnostic for this disease. If type 1 is there in the option and there is only increase in the chylomicron with eruptive xanthoma, answer is type 1, that is lipoprotein lipase deficiency. Yes, liver biopsy. Hi, Vaibhav. Liver biopsy is the answer. So इस पे IBQ just अभी सर ने मंजुनाथ सर ने कवर किया ये. So we'll discuss in short about this. There were IBQ on old man with stick due to crippling. So crippling were mentioned there. Whole village uses same water source. What will you do? You will check fluoride level, और यू विल सप्लीमेंट विटामिन डी, और यू विल चेक सेरुलोप्लाज्मिन लेवल. अगर ऐसे ऑप्शन थे सो फ्लूराइड से रिलेटेड है. फ्लूराइड इज ए डबल एजेड स्वॉर्ड. If it is less than 0.5 ppm, it is measured in particle per million ppm. It is less than 5 ppm. It causes dental caries. It causes dental caries. The 0.7 to 1.2 is the normal level of the fluoride in water. This is in the water. Normal level of the fluoride. More than 1.5 to 3, it causes the mottling of the enamel, means it causes the dental fluorosis. It causes dental fluorosis. And if it is more than 4, if it is more than 4 ppm, it causes the skeletal, early skeletal fluorosis. skeletal fluorosis. And if it is more than 10 ppm, it causes this is early skeletal fluorosis, and it causes crippling. It causes crippling. If when it is more than 10 ppm, this is water level. This is water level. So क्या पूछा था ऑप्शन में, क्या था? ये पूछा था या फ्लोराइड का लेवल पूछा था? होल विलेज हैज सेम सिम्टम्स. अच्छा, होल विलेज हैज सेम सिम्टम मतलब सभी के जो पैर है, मतलब स्केलेटल फीचर्स जो है वो एबनॉर्मल है. इट वाज देयर, नो वाटर वाज मेंशन. सो होल विलेज हैज same symptoms or clinical features. Okay, so we'll erase this. Same clinical features. So here answer is fluoride. It is skeletal fluorosis. Cause पूछा था, असम mention किया था. Hi Riaz. Image with vulgum. So it is here image with vulgum deformity. Gum means stick together. Knees एक जगह पे आ जाते हैं. इमेज थी यहाँ पे, और क्या था? Vulgus deformity, image was there, and cause पूछा था. Cause. So here cause is fluoride, excessive fluoride in the water, which affect the whole village. Which affect the whole village. एक individual affect होता है तो miss it can be because of vitamin D, but whole village जब affect हो रहा है तो it is fluorosis. That is known as crippling. Was no crippling was mentioned. If there is no crippling, crippling के लिए ज़्यादा ppm में फ्लोराइड होना चाहिए. crippling अगर मेंशन भी नहीं है और डिफॉर्मिटीज है and vulgum deformity is there and whole village is affected, answer is the fluoride. It is fluorosis. It is fluorosis, skeletal fluorosis. Whole village used to stick to walk. Whole village, पूरा का पूरा village. Okay. So now our question becomes, whole village uses stick for the walking, and the village, whole village people has same clinical features. What will be the cause of this skeletal deformity? This is due to skeletal fluorosis because of the common water source. Because it is present in the water, fluoride is present in the water. Because of the common water source, there is fluorosis, skeletal fluorosis. No crippling. Okay, noted. Hi DRS, hi Ragini Yadav, no crippling, noted. A person consume a diet predominantly rice and pulses. He present with fatigue and mild neuropathy. What vitamin supplementation should be given for prophylaxis? With fatigue and neuropathy, and the staple diet is rice and pulses. Staple diet as rice and pulses. If patient is present with this type of features like fatigue and neuropathy, what should be given for prophylaxis? Here, vitamin B1 given for the prophylaxis, because this is somewhat adulteration type question. Polishing of the polishing of the rice and eating rice and pulses or polished grains. While removing the outer alluron layer, it will remove 80% of the thiamine and it causes the thiamine deficiency. Thiamine deficiency can manifest as dry, wet, dry beriberi, wet beriberi, infantile beriberi, and the wernicke's in chronic alcoholic. So this is the vitamin B1 is answer here. Okay, vitamin B1 is answer here. You are an intern and want to study coagulation profile. Which vacutainer is used for the coagulation study? अभी जो FMGE का सेशन वर्कबुक सेशन हुआ उसमें पहला ही स्लाइड था बायोकेम का कि वैक्यूटेनर्स, और मैंने बोला भी था कि ये ट्रेंडिंग टॉपिक है. वैक्यूटेनर पे अभी जो भी लोग नीट पीजी के प्रिपरेशन मतलब एग्जाम देंगे वो देखना, ये बहुत ही ट्रेंडिंग टॉपिक है वैक्यूटेनर्स एंड देयर यूज. पिछले बार क्वेश्चन आया था HbA1c के लिए कौन से ट्यूब में लोगे. हियर द ब्लू ट्यूब, बनी रैबिट गेट प्रेग्नेंट फूड, ऐसा एक न्यूमोनिक है, वो ऑर्डर ऑफ ड्रॉ है. तो पहला ही है, पहला ब्लड कल्चर बॉटल फॉलोड बाय द ब्लू कैप ट्यूब फॉर द कोएगुलेशन स्टडीज. फॉर द कोएगुलेशन स्टडीज साइट्रेट ट्यूब. ओके, साइट्रेट ट्यूब. There were question on iron deficiency, anemia with history of pica and image of microcytic RBCs. There were question on basophilic stippling due to lead toxicity, जो already cover किया गया है. ये भी रंजित सर ने cover किया है. अभी जस्ट विवेक सर ने रेस्पिरेटरी अल्कोलोसिस पे एक हाई अल्टीट्यूड वाला क्वेश्चन कवर किया. And the Hashimoto's thyroiditis, the antibodies positive in Hashimoto's thyroiditis in hypothyroidism, the antibodies are anti-TPO antibodies, anti-thyroid peroxidase antibodies. In grave disease, anti-TSH receptor antibodies are positive. So ये सारे questions थे बायोकेमिस्ट्री से. 10 से 12 questions थे. जो अभी नीट के एग्जाम देने वाले हैं वो ये प्रिपेयर करके रखे अच्छे से. सो बेस्ट ऑफ लक गाइस, डोंट वरी, जस्ट रिलैक्स एंड टेक केयर. सो ओवर टू यू संतोष सर, प्लीज.
Hi, sir. So, like there is a small change in schedule, guys. Dr. Siraj Ahmed will take over now, and I'll come back with medicine questions after Dr. Siraj. Sir, over to you.
Hi guys. So I got a couple of pharma questions, and the pharma questions were quite doable. I hope I am clearly audible and visible. Let me just check over. The pharma questions were quite. All right. So the first question that we got here in the pharma was about a patient on chemotherapy, and he presented with slide कैसे आएगा? Slide. हाँ मैंने सेलेक्ट किया है. इसमें मेरा OBS वर्चुअल कैमरा सेलेक्टेड है. ऑडियो भी सिलेक्टेड है, बस वो स्क्रीन नहीं आ रहा है. स्क्रीन तो इसमें हाँ 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 OBS वर्चुअल कैमरा रनिंग है. स्टार्ट स्ट्रीमिंग, स्टार्ट रिकॉल कुछ करूँ? कहीं और जाएगा लग रहा है ये स्ट्रीमिंग. आ रहा है इसमें? नहीं आ रहा है. एक मिनट में एक बार आदित्य को करता हूँ. जी जी सर, ठीक है सर, ठीक है सर. हाँ आदित्य, ये मेरा Ready to go? ठीक है, thank you very much. All right, hi guys. So sorry for this short technical delay. Hi everyone. Okay. So the first question that we got in pharma is a patient is on chemotherapy having difficulty in breathing. Upon investigation, some pulmonary fibrosis noted or some respiratory symptom were there. So which anti-cancer drug is the possible cause? So remember, chemo man का favorite topic है, that is going to be bleomycin busulfan. और अगले इसके potential MCQ क्या हो सकता है? तो how will you prevent this one? That is going to be the next potential MCQ. So we are going to utilize something that is called your perfenidone, right? Next question was about a 5-year-old child presented with the increased body temperature, heart rate बढ़ा हुआ था, metabolic acidosis, जैसे pH उसमें 7.1. So according to the student, but they said कि हर चीज बढ़ा हुआ था and poisoning of which of the following. So see TCA toxicity, लेकिन इसमें student said कि सर atropine option में नहीं था and metabolic acidosis is mainly pointing towards tricyclic antidepressant because tricyclic antidepressant has mainly having more lot of other activities as well. What is the meaning of other activities? Like for example, they have anticholinergic activity, antihistaminic activity. So because of that, there will be increase in the heart rate and other metabolic acidosis, and also there may be arrhythmia as well. So TCA toxicity is a possible, answer to this question. Next potential MCQ would be what is the possible management. Now, why am I discussing every time and I'm telling you what is the next potential MCQ? The reason for that in the next, I mean, जो पूरे नए MCQ आते हैं वो मेनली कहाँ से आते हैं? पुराने वाले क्वेश्चन से ही बन के आते हैं. जो भी पुराने क्वेश्चन रहते हैं वहीं से नेक्स्ट MCQ बन के आते हैं. तो इसीलिए अब आपको इसी PYQ को लेकर के आने वाले समय में जो भी नए क्वेश्चन होंगे उनको लेके आप चलोगे. आई थिंक कुछ सिस्टम खुलने में थोड़ा टाइम लग रहा है. जस्ट अ मिनट. In between, if you guys are having any other feedback about the question, you can just let me know directly. चलो इस पे कर लेते हैं. I don't know what is wrong there. Okay. Possibly we got it. Okay, great. Thank God. So a patient brought with PDA. What is the most preferred management? See, PDA में सबसे पहले जो initial management करते हैं usually, that is going to be using ibuprofen or indomethacin. That is going to be medical management. तो medical management will be initially preferred in this case scenario. अगर इससे नहीं रेस्पॉन्ड करता है देन वी गो फॉर द सर्जिकल मैनेजमेंट. तो इस कंडीशन में अगर क्वेश्चन आया हुआ है सो द मोस्ट प्रिफर्ड मैनेजमेंट इज गोइंग टू बी द मेडिकल मैनेजमेंट. Prostaglandin E2 function in the stomach. So remember, prostaglandin have multiple function in the stomach. They inhibit the proton pump. They are also involved in increasing the bicarbonate secretion, right? And they are always going to be protective in nature. इसीलिए prostaglandin analog misoprostol is something that can be utilized. तो अगर option में ये था inhibiting the proton pump and you have chosen that, that is going to be the correct answer. First line treatment for पेप्टिक अल्सर डिजीज. सो पेप्टिक अल्सर डिजीज के लिए अमॉन्ग द गिवन चॉइसेस, सी पेप्टिक अल्सर यूजुअली जिसको हम बोलते हैं एच पाइलोरी थेरेपी. तो एच पाइलोरी थेरेपी यूजुअली जब हम लोगों ने रिव्यू किया था उसमें भी ऑलमोस्ट इन सारे इन ऑल डिस्कशन वी डिस्कस दैट वी आर गोइंग टू यूज CAM कैम एंड PPI. CAM में क्या होता है? क्लेरिथ्रो एमॉक्सी एंड मेट्रोइडाजोल. अब इन तीनों में से एनी टू वील बी टेकिंग. सो वी सी क्लेरिथ्रोमाइसिन, एजिथ्रोमाइसिन, क्लेरिथ्रो टेट्रा, क्लेरिथ्रो एमॉक्सी, PPI. So I think the correct answer is going to be D for this case. बाकी other options simply are wrong. Next question is preferred treatment for a patient with hypertension, high blood pressure है और proteinuria. तो most preferred is always and always going to be your ACE inhibitor. ACE inhibitor का alternative is going to be angiotensin receptor blocker. Other option देखिए propranolol, hydrochlorothiazide, spironolactone and telmisartan. So since telmisartan is there, this is going to be the preferred answer for this question. Which of the following is most likely mechanism of ACE inhibitor for controlling blood pressure in a hypertensive patient? So hypertensive patient में mainly क्या करता है? angiotensin 1 को angiotensin 2 में convert होने से कौन रोकता है? दैट इज गोइंग टू बी एस इनहिबिटर ऑल द प्रिल्स. प्रिल्स आर गोइंग टू बी, आई मीन कैप्टोप्रिल, लिसिनोप्रिल, दे आर गोइंग टू इनहिबिट द कन्वर्जन ऑफ 1 to 2, बिकॉज एंजियोटेंसिन 2 जो बन रहा था, इसके दो इंपॉर्टेंट रोल थे. एक तो ये 81 पे काम करके वैसोकॉन्स्ट्रिक्शन कर रहा था, तो अगर आपने इसको ब्लॉक कर दिया तो वैसोकॉन्स्ट्रिक्शन वाले पे थोड़ा कंट्रोल मिलेगा. प्लस एंजियोटेंसिन 2 वाज आल्सो कॉजिंग action at the zona glomerulosa, and they were causing release of the aldosterone that was causing sodium and water retention. So see, there is no option about sodium and water retention. Mainly they are talking about heart rate और cardiac output. तो force of contraction पे इसका कोई रोल नहीं होता है. Increasing preload, rather they would decrease. So decreasing the peripheral vascular resistance is the correct answer for a question like this, है ना? क्लेरिथ्रो, मेट्रो, पीपीआई वेर वन ऑफ द ऑप्शन. तो देखिए, या तो क्लेरिथ्रो होगा, अगर मान लीजिए क्लेरिथ्रो है, क्लेरिथ्रो प्लस मेट्रो प्लस पीपीआई, या तो ये होगा या एमॉक्सी होगा. दोनों नहीं होगा, बिकॉज दोनों फिर उस कंडीशन में करेक्ट हो जाएंगे. अगर ये था और तो फिर आपका ये वाला डी ऑप्शन नहीं होगा. इफ दिस वाज देयर देन ऑफ कोर्स दैट इज गोइंग टू बी द करेक्ट वन. क्लेरिथ्रो एमॉक्सी और क्लेरिथ्रो मेट्रो दोनों एक साथ नहीं होगा. अगर इन केस वो भी होता है तो उस कंडीशन में दिस विल बी द मोस्ट प्रिफर्ड वन. अगर मान लीजिए ये है, तो दिस द जिसके ऊपर मैं स्टार बना रहा हूं, दिस विल बी द मोर प्रिफर्ड एज कंपेयर टू ऑप्शन डी. आई होप इट इज क्लियर टू ऑल ऑफ यू गाइस. ठीक है, तो मैंने उसको क्लैरिफाई कर दिया. नेक्स्ट क्वेश्चन इज गोइंग टू बी अबाउट स्किज़ोफ्रेनिया पेशेंट अपॉन ट्रीटमेंट डेवलप डिस्टोनिया. तो देखिए, स्किज़ोफ्रेनिया के ट्रीटमेंट में मसल डिस्टोनिया टिपिकल एंटीसाइकोटिक से होता ही होता है. तो पहले पूछता था कौन ड्रग करेगा, तो टिपिकल. फिर पूछा मैनेजमेंट कैसे करेंगे, तो मैनेजमेंट के लिए वी यूज बेंजहेक्सोल बेंजस्टोपिन. तो वहां से नेक्स्ट क्वेश्चन उठाया कि बेंजहेक्सोल बेंजस्टोपिन दे दिया, वी हैव गिवन बेंजस्टोपिन बेंजहेक्सोल. नाउ द पेशेंट इज डेवलपिंग साइड इफेक्ट लाइक माइड्रियासिस, urine retention. So these are all anticholinergic side effect. No, so which anticholinergic drug will be causing this one? So that is going to be benztropine. Haloperidol itself causes extrapyramidal symptom. Clozapine has already been asked in 2023 NEET PG associated with the sialorrhea, that is salivation, wet pillow syndrome. Olanzapine is again typical antipsychotics. They will not be causing this kind of side effect. Mainly they will be associated with the metabolic syndrome. Correct answer for this one is going to be C. पेशेंट विद कावासाकी. देखिए, ये वाला जो क्वेश्चन था प्योर मेडिसिन केस है, बिकॉज मेनी स्टूडेंट सेड कि दैट देयर वाज अ लॉन्ग हिस्ट्री. तो अगर हिस्ट्री दिया हुआ है इनिशियली, ध्यान रखिएगा कावासाकी डिजीज में जो एस्पिरिन का मैनेजमेंट डेफिनेटली आपको पढ़ाया जाता है. ठीक है, कौन से क्वेश्चन की बात करें, समथिंग एल्स था. अगर ये ऑप्शन इसमें नहीं था तो आप यू कैन लेट मी नो एट एनी पॉइंट ऑफ टाइम कि किस क्वेश्चन के बारे में आप बोल रहे हो, बिकॉज वी हैव टू फिनिश इन 15-20 मिनट्स एंटायर रिकॉल, और कंप्लीट रिकॉल डेफिनेटली विल बी कमिंग लेटर ऑन. अभी एक ओवरव्यू हम ले रहे हैं. तो ये अगर लॉन्ग हिस्ट्री के साथ था तो देखिए, इनिशियली जब भी आपको एस्पिरिन देना है, इनिशियली वी गिव इट फॉर 2 मंथ, समटाइम इट इज एक्सटेंडेड फॉर 2 to 3 मंथ. उसके बाद से भी अगर रेस्पॉन्ड नहीं कर रहा होता है, देन वी कीप द पेशेंट ऑन द लाइफ लॉन्ग. बिकॉज अभी इनिशियल इसमें कंडीशन में पूछ रहा है, तो इनिशियली हम 2 to 3 मंथ वाले के साथ जाएंगे. बट अगर लॉन्ग हिस्ट्री था देन यू हैव टू एसेस इन दैट केस सिनेरियो. मान लीजिए हमने दिया भी फिर भी रेस्पॉन्ड नहीं किया, तो इन सम पेशेंट वी कैन ऑल्सो कीप द कावासाकी डिजीज वाले पेशेंट में लाइफ लॉन्ग एस्पिरिन पे भी हम रखते हैं. तो अभी मैं इस पे कोई कमेंट नहीं दे रहा हूँ. इनिशियली मैं सॉफ्टली इसको बोल रहा हूँ कि अगर यही क्वेश्चन था तो इनिशियली वी कैन गो फॉर एटलीस्ट 2 to 3 मंथ. तो पहले ऑप्शन के साथ जा रहा हूँ. बट आई एम जस्ट टेलिंग यू कि इफ देर इज लॉन्ग हिस्ट्री, द पेशेंट हैज बीन गिवन एस्पिरिन, अगर ऐसे करके था कि एस्पिरिन दे दिया, फिर एसेस किया और फिर भी अभी प्रॉब्लम दिख रहा है, देन उस कंडीशन क्या करेंगे, देन वी विल कीप द पेशेंट ऑन द एस्पिरिन लाइफ लॉन्ग. तो ये टोटली आपको बताना है कि सर क्वेश्चन कैसे आया हुआ था. पेशेंट बॉट विद अनकॉन्शियस स्टेट, पेरिफेरल ब्लड स्मीयर रिवील्स प्लाज्मोडियम फैल्सिपारम. अनकॉन्शियस या कोई भी लॉस ऑफ कॉन्शियसनेस का हिस्ट्री अगर था और मलेरिया के बारे में पूछ रहा है, तो दैट इज गोइंग टू बी सेरेब्रल और सेरेब्रल मलेरिया, या जिसको बोलते हैं कॉम्प्लिकेटेड मलेरिया. तो हु विल बी कॉजिंग कॉम्प्लिकेटेड मलेरिया? फैल्सिपारम. और आईवी आर्टिसनेट इज द ड्रग ऑफ चॉइस फॉर दैट के सिनारियो. पूरी के पूरे क्वेश्चन जितने मैं आपके सामने यहाँ रखा हूँ, ये सारे के सारे क्वेश्चन दे वर डिस्कस्ड, दे वर ऑल डिस्कस्ड. ठीक है. A patient with lung infection was on high dose steroid and antimicrobial agent but was non responsive. तो स्टेरॉइड ले रहा है, इम्यूनोसप्रेसेंट है और एंटीमाइक्रोबियल भी ले रहा है, फिर भी रिस्पॉन्ड नहीं कर रहा है. चेस्ट रेडियोग्राफी रिवील हैलो लाइक स्ट्रक्चर. तो ये टिपिकल लाइन था स्टूडेंट्स का कि सर उसमें हैलो लाइक स्ट्रक्चर दिखा रहा था, व्हाट इज द प्रिफर्ड एजेंट. तो देखिए, अगर इसमें मान लीजिए ब्लैक डिस्चार्ज फ्रॉम द नोज या ओरल में कहीं दिख रहा है, तो इन दैट के सिनारियो विल बी प्रोसीडिंग विथ योर लाइपोसोमल एम्फोटेरिसिन बी, है ना। लाइपो फंगल इन्फेक्शन ऑफ द लंग्स की वजह से इसको एंटीबायोटिक से रेस्पॉन्ड नहीं कर रहा, प्लस what is the other risk factor that we can say it's a fungal infection because it's on high dose steroids. Hypertensive patient presented with the uncontrolled blood pressure. History is revealing that he's on 3 antihypertensive drug including a diuretic. So 3 में क्या होगा, ACD, ACE inhibitor, ARB, कैल्शियम चैनल ब्लॉकर, डायरेटिक्स। तो दैट मींस फर्स्ट लाइन तो सारे यूटिलाइज कर लिए। वर्कअप रिवील्ड हाइपोकैलेमिया। अच्छा, तो अब ये बता रहा है कि भाई 3 से रेस्पॉन्ड नहीं कर रहा है, तो दिस इज केस ऑफ रेजिस्टेंट प्लस हाइपोकैलेमिया है, तो वी आर गोइंग टू यूज potassium sparing, and drug of choice for resistant hypertension is also spironolactone. So correct answer for this one is going to be C. Asthmatic patient on inhaled corticosteroid for LABA plus LABA, condition doesn't improve, next best bronchodilator. देखिए ये स्टेटस एस्मेटिकस का क्वेश्चन है, और स्टेटस एस्मेटिकस अभी 2 दिन क्या, कल ही अभी मैंने डिस्कस किया था यूट्यूब वाले सेशन में, उसमें बताया था कि अगर लाबा से काम नहीं चलता है देन वी ऐड अदर ब्रोंकोडाइलेटर। तो नेक्स्ट बेस्ट ब्रोंकोडाइलेटर दैट वी ऐड इज गोइंग टू बी सामा। सामा कौन से ग्रुप का है, आई मीन इप्राट्रोपियम सामा ग्रुप का है। इप्राट्रोपियम शॉर्ट एक्टिंग मस्करिनिक एंटागनिस्ट। बिकॉज ही इज ऑलरेडी ऑन द लाबा, देयर इज नो पॉइंट ऑफ एडिंग इनहेल्ड, आइदर यू गिव बाय अदर रूट हम दे सकते हैं। Omalizumab is something that is utilized for the prophylaxis, not for a condition like this, which is a case of status asthmaticus. Status asthmaticus का एक और नया नाम है जिसको बोलते हैं acute severe asthma। तो this was a case of acute severe asthma। ठीक है। A patient who is on cetirizine feeling drowsy while working during the daytime, what should be given to avoid drowsiness? So see, cetirizine is an antihistaminic drug. It is a derivative of the first generation only. So they are also associated with, although they are second generation that are supposed to be causing less sedation, but these are also causing sedation. So in that case scenario, we'll be going ahead with the fexofenadine. This is going to be overall least sedative antihistaminic. Overall least sedative antihistaminic drug. ठीक है। Okay, there was a history. IV methylprednisolone was in the option in this LABA question. IV methylprednisolone. तो स्टेरॉइड जैसे है ना, तो इसकी जगह पे मान लीजिए IV methylprednisolone. IV methylprednisolone. So since he is already, अभी तो initially already he is taking on inhaled corticosteroid, और अगर ये वर्ड है ब्रोंकोडाइलेटर, ध्यान रखिएगा क्वेश्चन क्या बोला है, अगर ये लैंग्वेज है तो इप्राट्रोपियम विल बी द ब्रोंकोडाइलेटर। ठीक है। नेक्स्ट बेस्ट अगर एजेंट पूछता तो भी हम पहले इप्राट्रोपियम देते बिफोर वी टेक एनी अदर रूट ऑफ स्टेरॉइड्स। OCPs reduce all of the following cancer risk except, टू द पॉइंट नीट पीजी का प्रीवियस ईयर क्वेश्चन है, सर्वाइकल कैंसर के रिस्क को बढ़ाता है। ठीक है। पानीपुरी सेलर विद ब्लैक स्कार डायग्नोस विद स्क्रब टाइफस। देखिए पानीपुरी सेलर स्क्रब टाइफस डायग्नोस हो गया, तो इन दैट के सिनेरियो दिस इज आल्सो वन ऑफ द PYQ। तो इसमें यूजुअली स्क्रब टाइफस में बताया जाता है कि ड्रग ऑफ चॉइस इज गोइंग टू बी डॉक्सीसाइक्लिन, लेकिन रिसेंट स्टडीज आर सेइंग कि इन द रेजिस्टेंट केसेस इन द मेनी एरिया दिस स्क्रब टाइफस इज एक्चुअली रेजिस्टेंट। So in that case scenario, the most preferred treatment option that we should proceed will be doxy and macrolide, that is azithromycin। ये इंफॉर्मेशन मैं आपको पहले से रिसर्च करके बता रहा हूँ, बिकॉज ये क्वेश्चन पहले भी आ चुका है आपके नीट पीजी या INI-CT में, तो ये डायरेक्टली उसका क्वेश्चन है, ये एज टू द पॉइंट ही आ गया है। Patient brought in unconscious state, examination revealed there is increased blood pressure, heart rate and body temperature. What is the preferred antidote? तो I think देखिए everything in the top, तो mainly they are talking about the atropine. Atropine का antidote is going to be physostigmine. You cannot use atropine के antidote में atropine, है ना। एंटीडोट फॉर ओपियोइड्स, तो ये दिस वाज आल्सो गोइंग टू बी अ केस। तो बेसिकली केस में आया था कि पेशेंट है, ड्रग एडिक्ट है, ओपियोइड ओवरडोज के साथ आ रहा है, तो बेसिकली केस है, लेकिन उसका जिस्ट यही है कि ओपियोइड ओवरडोज के साथ आ रहा है, क्या यूज करोगे, तो विल बी प्रोसीडिंग अहेड विद द नैलोक्सोन। अगर आपको याद होगा तो यूट्यूब पे आप अभी भी जाके देखिएगा, पहला टॉपिक जो इस बार मैंने डिस्कस किया था दैट वाज इंपॉर्टेंट एंटीडोट। 3 क्वेश्चन उस पहले टेबल से आए हुए हैं, 3 क्वेश्चन फ्रॉम द फर्स्ट टेबल दैट हैज बीन डिस्कस्ड ऑन द यूट्यूब फॉर द क्विक रिव्यू ऑफ फार्माकोलॉजी। हेपेटाइटिस ट्रीटमेंट, नाउ इनमें से जितने भी ड्रग हैं इनमें से कोई भी हेपेटाइटिस ट्रीटमेंट वाले नहीं है। अगर आपको कोई ड्रग याद आ रहा है तो आप वो मुझे बता दीजिए कि कौन सा ड्रग अदर ड्रग था। इफ यू गाइस कैन रिमेंबर लाइक डोलूटिग्रावीर, टिग्रावीर इट्स वन ऑफ द इंटीग्रेज इनहिबिटर। lamivudine. Lamivudine is something that is one of the drug that can be utilized. अगर lamivudine था, so this is the something that can be utilized. Lamivudine is one of the NRTI, और NRTI for hepatitis B virus, तो मैं बोलता हूँ let us use them in hepatitis. So that is going to be lamivudine, emtricitabine, and tenofovir. तो अगर लेमिवुडिन ऑप्शन में था तो वी कैन यूज सेक्विनाविर विल नॉट बी यूटिलाइज्ड, इट्स वन ऑफ द प्रोटीज इनहिबिटर, इट इज नॉट यूटिलाइज्ड इन hepatitis. So lamivudine option में था तो this will be proceeding, right? There was one more navir, if I'm not wrong, student said sir एक और navir था, ठीक है? So the preferred is going to be lamivudine. For brucellosis that is going to be doxy. Brucellosis के लिए अगर ऑप्शन में doxy था तो that will be the preferred answer. Cluster headache के लिए एग्जाम ने पूछा तो लिथियम के डिफरेंट यूजेस मैं बताता हूँ, ए बी सी डी, राइट? ए बी सी डी, ए से एक्यूट मैनिया, बी से बाइपोलर, सी से क्लस्टर हेडेक. सो द प्रिफर्ड मैनेजमेंट इज गोइंग टू बी लिथियम. लिथियम के यूजेस में देखिएगा, डेफिनेटली मैंने इसको पढ़ाया हुआ है. क्लस्टर हेडेक में क्या यूज करेंगे, दैट इज गोइंग टू बी लिथियम. Player with a history of tendon rupture and he is on antibiotic, which of the following is the mechanism of action of antibiotic? So देखिए ये पहले क्वेश्चन क्या था, a mother who is pregnant, she consumed an antibiotic and the baby has some tendinitis, है ना? तो अब उसने कौन सा एंटीबायोटिक लिया, तो दैट वाज फ्लोरोक्विनोलोन विच इज अ डीएनए गायरेज इनहिबिटर. बिना देखे भी आप इत्मीनान से इसको कर, है ना, आराम से कर सकते हो इसको, डीएनए गायरेज इनहिबिटर. सेंट्रल डायबिटीज इंसिपिटस, सो दिस वाज आल्सो अ केस बेस्ड सिनेरियो. You guys, it will be very kind of you if you could send this a case as well, if you could recall. अगर central diabetes insipidus का case है, where there is patient is presenting with this one, then you can go ahead with the desmopressin. However, अगर nephrogenic का history था, नेफ्रोजेनिक, बिकॉज कई सारे बच्चे ये भी बोले कि सर ट्रॉमा की हिस्ट्री थी, ट्रॉमा के बाद आया और उसको ये प्रॉब्लम हो रहा था, तो मोस्ट लाइकली दिस कुड बी नेफ्रोजेनिक. अगर नेफ्रोजेनिक का हिस्ट्री है, देन दिस विल बी hydrochlorothiazide or any of the thiazide diuretic. This is going to be V2 antagonist. It's the drug of choice for SIADH. ठीक है. Agent preferred agent for galactoria. So galactoria के लिए we will be giving D2 agonist because dopamine is always going to be having inhibitory effect on the prolactin. So we are going to use bromocriptine, which is a D2 agonist. Bromocriptine is a D2 agonist, preferred drug for galactoria. Bromocriptine, cabergoline, these are the agents. In a patient with history of clot in the coronary artery, preferred anticoagulant, right? Clot, right? अगर वो emergency में मान लीजिए, यार this is going to be case of emergency case, anticoagulant immediately. देखिए वारफरिन का complete action आने में थोड़ा टाइम लगता है, तो in that case scenario we can utilize heparin. We can utilize heparin in this case scenario. Polyuria, polydipsia, kid, bedwetting 2 times per week. चलिए इसको मैं करेक्ट कर ले रहा हूँ. This was, अगर ये केस था polyuria, polydipsia, then this is certainly going to be a case of central diabetes insipidus. Then तो उसमें कोई देखना ही नहीं है. Polyuria, polydipsia in pediatric population, bedwetting की history है 2 times per week. So definitely the answer is going to be desmopressin. उसमें कोई डाउट नहीं है. फिर क्लियरेंस का फॉर्मूला, नाउ दिस इज समथिंग जो कि अभी भी इनकम्प्लीट है. इनकम्प्लीट इसलिए बिकॉज अलग अलग स्टूडेंट्स ने अलग अलग वैल्यू दिया. तो देखिए क्लियरेंस का सिंपल मैं बताता हूं कि आपको याद रखना CRPC. CRPC स्टैंड फॉर क्लियरेंस इज इक्वल टू rate of elimination divided by the plasma concentration. Clearance is equal to rate of elimination divided by the plasma concentration. तो अगर आपके पास वैल्यू था, अगर आपके पास वैल्यू जो भी था, वैल्यू अगर दिया हुआ था, तो यू जस्ट नीड टू पुट द वैल्यू एंड यू वुड गेट इट. जैसे बहुत सारे बच्चे बोले थे सर वॉल्यूम ऑफ डिस्ट्रीब्यूशन दिया हुआ था, वॉल्यूम ऑफ डिस्ट्रीब्यूशन. तो वॉल्यूम ऑफ डिस्ट्रीब्यूशन मान लीजिए बच्चे बोले थे 7 लीटर वॉल्यूम ऑफ डिस्ट्रीब्यूशन दिया था, हाफ लाइफ दिया हुआ था. सो द हाफ लाइफ दैट वाज given in this case scenario, that was somewhere around 3 hours. So even you can get this done if you put this in the formula of T half life also, उसमें से भी आपको निकल जाएगा. ठीक है. बेस्ट एजेंट फॉर सिकल सेल एनीमिया, तो वॉज हाइड्रोक्सीयूरिया इज द ओनली ड्रग. मुझे एक ही ऑप्शन मिला हाइड्रोक्सीयूरिया, लेकिन मैं आपको बार बार बताता हूँ कि सिकनेस में वो ले गई, ही क्राइड, है ना, ही क्राइड, वो ले गई, यही मैं बोलता हूँ, वो ले गई. दैट इज गोइंग टू बी हाइड्रोक्सीयूरिया, दैट इज द मोस्ट प्रिफर्ड एजेंट. Crizanlizumab is one of the monoclonal antibody. Crizanlizumab is one of the monoclonal antibody. Voxelotor and L-glutamine. तो अब आप देख लीजिए कि ये चारों दवाइयां थी, इनमें से अगर हाइड्रोक्सीयूरिया था तो हाइड्रोक्सीयूरिया इज गोइंग टू बी द प्रिफर्ड एजेंट इन अ पेशेंट. ठीक है। Myasthenia gravis. So myasthenia gravis is going to be an autoimmune condition where there is going to be autoantibody against the postsynaptic acetylcholine receptor. Autoantibody against postsynaptic acetylcholine receptor. Patient on chemotherapy developed thrombocytopenia. The preferred agent is going to be oprelvecin, which is going to be interleukin 11 agonist. ठीक है। तो अगर आप ध्यान से देखोगे तो रफली आई गॉट अराउंड 28 to 29 क्वेश्चन। एक बार क्विकली मैं आपको नेक्स्ट 60 सेकंड में रिकैप करा रहा हूँ। आप देखिएगा, जहां पे भी आपको लगे गड़बड़ है, प्लीज टेक अ स्क्रीनशॉट एंड इमीडिएटली राइट मी बैक। यू कैन रीच आउट टू मी इन एनी ऑफ द सोशल मीडिया प्लेटफॉर्म, टेलीग्राम, इंस्टा, कहीं पे भी। प्लीज लेट मी नो, आई विल बी मोर देन हैप्पी टू करेक्ट इट। कीमोथेरापी, थ्रोम्बोसाइटोपिनिया, ओप्रेलवेकिन, दैट इज डन। मैथ्सिनिया ग्रेविस में ऑटो एंटीबॉडी अगेंस्ट द पोस्ट-सिनेप्टिक एसिटाइलकोलिन रिसेप्टर। Best for sickle cell anemia is going to be hydroxyurea if this was the option. Other option के लिए I would definitely wait for all of you guys. क्लियरेंस का फॉर्मूला जैसे कि मैंने बताया कि जो भी वैल्यू था उसमें आपको फॉर्मूला पुट करना था, बिकॉज आई कुड नॉट गेट द एग्जैक्ट नंबर क्या क्या आया था। आई एम जस्ट टेलिंग यू हाउ टू अप्रोच दिस क्वेश्चन। क्लॉट इन द कोरोनरी आर्टरी प्रिफर्ड एंटीकोआगुलेंट इमरजेंसी में अगर आ रहा है पेशेंट, तो यू विल बी यूजिंग हेपेरिन। हेपेरिन इज द इमरजेंसी एजेंट दैट कैन बी यूटिलाइज। पेशेंट विद गैलेक्टोरिया प्रिफर्ड एजेंट दैट इज ब्रोमोक्रिप्टिन विच इज D2 एगोनिस्ट। सेंट्रल डायबिटीज इंसिपिडस, कुछ बच्चे बोलते हैं बिहेवियर थेरापी इन बेड वेटिंग। किड का एज दिया हुआ था क्या, कुछ वाज एनी एज गिवन या सारे ड्रग्स थे? सेंट्रल डायबिटीज इंसिपिडस अगर दे रहा है तो ड्रग ऑफ चॉइस इज ऑलवेज गोइंग टू बी डेस्मोप्रोसिन। बिहेवियर थेरापी इज नॉट द ड्रग ऑफ चॉइस। बच्चे से क्या बिहेवियर थेरापी आप कराओगे, कितना भी कराओगे उतना ज्यादा इफेक्टिव नहीं होता है। प्लेयर विथ हिस्ट्री ऑफ टेंडोन रप्चर वाज ऑन एंटीबायोटिक, विच ऑफ द फॉलोइंग द मैकेनिज्म ऑफ एक्शन ऑफ एंटीबायोटिक? डीएनए गाइरेज इनहिबिटर, दैट इज गोइंग टू बी द फ्लोरोक्विनोलोन। तो मैं बताता हूँ फ्लोरोक्विनोलोन फुटबॉलर फुट में प्रॉब्लम करता है, बार बार बताता हूँ, फ्लोरोक्विनोलोन फुटबॉलर फुट में प्रॉब्लम करता है और फ्लोक्सासिन नाम में भी आता है। तो एफ एफ एफ, लॉट ऑफ एफ वर्ड इज कमिंग देयर। क्लस्टर हेडेक के लिए लिथियम हमने प्रीफर किया, ब्रुसेलोसिस के लिए डॉक्सी यूज किया, हेपेटाइटिस में लेमिबुडिन हमने प्रीफर किया, ओपियोइड एंटीडोट में नालोक्सोन, and physostigmine is the antidote for atropine poisoning if it was asked. Scrub trifos में the most preferred is doxy plus azithro, PYQ है, नीट पीजी का एज इट इज, सर्वाइकल कार्सिनोमा का रिस्क बढ़ता है। Patient on cetirizine, तो fexofenadine will be least sedative overall. Ipratropium will be added if the person next best bronchodilator if the person is non-responsive to inhaled corticosteroid plus LABA. And here in this case scenario, hypertension में hypokalemia patient है, 3 ड्रग से respond नहीं कर रहा है, तो in resistant cases we are actually going to give spironolactone. Liposomal amphotericin B for a patient who is having halo or the fungal infection of the lung. A patient with brought with unconscious state, Plasmodium falciparum IV artesunate is the drug of choice. Kawasaki disease में preferred management is again जैसे मैंने बोला कि लॉन्ग हिस्ट्री था, तो इसका अभी मैं आई विल नॉट बी गिविंग एनी कमेंट ऑन दिस, बिकॉज अगर उसमें पहले से ऑलरेडी चरा रखे हैं, रेस्पॉन्ड नहीं कर रहा है, देन लो डोज लाइफ लॉन्ग भी हम उसमें देंगे। स्किज़ोफ्रेनिया में उसको डिस्टोनिया के ट्रीटमेंट के लिए कोई दवा दिया गया जिसकी वजह से साइड इफेक्ट आ रहा है, तो एंटीकोलिनर्जिक साइड इफेक्ट विल बी विद द बेंजट्रोपिन विच इज अ सेंट्रली एक्टिंग एंटीकोलिनर्जिक ड्रग, दैट इज गोइंग टू बी द बेंजट्रोपिन। पेरिफेरल वास्कुलर रेजिस्टेंस का एक मैकेनिज्म होगा एस इनहिबिटर का, ऑल्दो इट आल्सो कॉजेज डिक्रीज इन द सोडियम इन वाटर, बिकॉज अल्टीमेटली वो पूरे रास सिस्टम को इनहिबिट कर रहा है। ठीक है। Preferred treatment for patient with hypertension and proteinuria, तो either ACE inhibitor or ARB, तो in this case scenario we are preferring ARB. H pylori therapy क्लेरिथ्रो मेट्रो PPI, because student said this one, तो we will go ahead with this one, स्टार वाला जो है ये करेक्ट है। PGE2 function, it inhibits the proton pump, prostaglandin proton pump को inhibit करता है। PDA वाले पेशेंट में मेडिकल थेरेपी लाइक आइबुप्रोफेन विल बी यूजिंग इनिशियली। TCA टॉक्सिटी यहाँ पे था ना बच्चे, वो सोफी, ये देखिए ये वाला क्वेश्चन अलग है, वो जो बॉडी टेम्परेचर के साथ आ रहा है और मेटाबॉलिक एसिडोसिस PS 7.1, so this is actually a feature of TCA toxicity because atropine was not in option, it was not in option, then we are moving ahead with the TCA toxicity. Bleomycin will be causing pulmonary fibrosis, and this was the 28 to 29 question from pharmacology. So I always say that pharma definitely has a very big chunk in your examination. Please do drop me if at any question you feel like that the question should be improvised. So I'll hand over to Santhosh sir. Santhosh sir, are you there? Thank you for giving me your slot, sir.
Hi, sir. Okay,
Yeah,
so I'll take
please
it
proceed, sir.
all
Thank you
from
very
you,
much,
sir.
sir. Thank you.
So guys, I hope the medicine this time was quite doable and not very difficult. Most
सर
of the
आपकी आवाज थोड़ी सी कम आ रही है, आवाज थोड़ी कम आ रही है सर।
Okay, I will increase the volume. Okay, so guys, I hope I'm audible. The medicine this time was quite on the predicted lines. There were clinical stems, but not too complicated and direct clues there. So let me go through the questions quickly. So the first question that we're dealing with is the drug of choice for the abortive treatment of cluster headache. So please just confirm whether you have this word abortive in the option. If abortive word was not there in the option, then probably the answer would may be changing. But if they're using the word abortive, that means we're talking about abortive is equal to acute treatment. And if we're talking about acute treatment of cluster headache, then the drug of choice is oxygen. As we already know, this has been discussed multiple times in all the sessions that we have done for the FMGE. Headache is almost always an assured topic, and one question always comes. This time it was about cluster headache, and if they're asking about the acute treatment, the drug of choice is going to be oxygen. And what type of oxygen? We are giving 100% oxygen. We are giving 15 liter per minute for 15 minutes. That's the drug of choice. Now, verapamil can be used for, or it's a drug of choice for the long-term preventive treatment. Lithium can be used for preventive treatment, but is not the abortive treatment. These are all for preventive treatment. They can be considered. So if the question was very clear about abortive treatment, the answer is going to be oxygen. This is going to be our answer. Okay. Now, I'm not very sure if there was another question on the similar lines on the cluster headache. Which of the following is used for the prevention of future attacks of cluster headache? In other words, when they're asking about future attacks of cluster headache, they're asking about short-term and long-term prevention. If it is about short-term prevention, then we know oral corticosteroids are the drug of choice. And if it is about long-term prevention, then verapamil is now considered as the drug of choice. So if there is long-term prevention, then drug of choice is verapamil. We can also use galcanezumab. And if it is short-term prevention, the drug of choice is going to be corticosteroids. I don't know if students have confused between the previous question on this, or there were two questions on cluster headache. Nonetheless, if there was a question framed this way, asking how do we prevent future attacks, then either the answer should be steroids or verapamil. And among the given options, I don't find steroids. I only find verapamil. So that becomes my answer for such a question. Aspirin, being an NSAID, may be used in the acute treatment, not very effective. Lignocaine is the drug of choice for acute treatment of. Lignocaine is the drug of choice for acute treatment of what we call as Sanct or Suna. Sanct or Suna. And sumatriptan, I don't need to talk about it. You're already familiar with, right? Okay. So now let's move to the next question. I heard that there was an ECG based question where a patient had chest pain and an ECG was given and there were ST elevation in V3, V4. Correct me if the image was not showing the ST elevation in V3, V4, or it was showing ST elevation in more than V3, V4, or it was not showing ST elevation at all. If it was showing ST elevation in V3, V4, then the question is talking about anterior wall MI. If it was also showing ST elevation in V1, V2, then question is talking about anteroseptal MI. If there was also ST elevation in one AVL, V5, V6, the question is talking about anterolateral MI. Presuming that the question was showing ST elevation only in V3, V4, V1, V2, V3. And what were the options? Sophie, can you list the options? See, V1, we are talking about the septal leads. V3, we're talking about the anterior leads. So if the option was anteroseptal MI, that would be our answer. If there was no anteroseptal but only anterior wall MI, then we have to go ahead with anterior wall MI as the answer. Okay, if there was other option, if anterolateral, anteroseptal, inferolateral, okay, if there was no anteroseptal, this is definitely not inferolateral. If V1, V2, okay, so let us name it as V1 through V3, there was ST elevation. And if there was anterolateral option available, then that would be the answer. Anterolateral MI will be the answer. If that option is not there, sorry, anteroseptal will be the answer. If that option was not there, then the next best answer you can go with is anterior wall MI. Posterolateral was an option. I'll get it corrected. You're saying there was also anterolateral as an answer. Okay. So V1 through V3 is definitely not anterolateral. It is not inferolateral. So among the options that you're listing me, I will definitely go ahead with anterior wall MI. If there was more precise option anteroseptal, you could have gone ahead with anteroseptal. Okay, good. Now this was a straightforward question. Other faculty have also taken, so I will not elaborate. Hashimoto's thyroiditis, you can have different types of antibodies, but the most common antibody you get is anti-TPO antibodies. Anti-thyroglobulin antibodies can be seen, but the most common antibody that we're getting is anti-TPO antibodies. And thyroid receptor antibodies are typically seen in, the TSH receptor antibodies are typically seen in Graves' disease. TRAbs or thyroid stimulating immunoglobulins are typically seen in Graves' disease. Okay. The next question was, which electrolyte abnormality may be encountered after packed RBC transfusion? After packed RBC transfusion. So the point to note here is that when we are having packed RBCs, generally citrate is used as an anticoagulant. Citrate is used as anticoagulant. Okay. Now packed RBC, especially massive transfusions, can lead to two important electrolyte abnormalities. The most common electrolyte abnormality that we are going to encounter is going to be hyperkalemia, because you are having stored RBCs. Some RBCs may get lysed, releasing the potassium, and that potassium is now part of the blood pack. It will be transfused to the patient, and patient receives that potassium, and hyperkalemia can happen. So most common electrolyte abnormality is going to be hyperkalemia. Was that in the option? Hyperkalemia. Most common electrolyte abnormality is going to be hyperkalemia. But I heard from the students that hyper was not in the option, sir. We had hypokalemia. Hypokalemia is not known to occur after the PRBC transfusion. What else can happen? What else can happen? We can have hypokalemia, because citrate binds with the calcium, making it as calcium citrate. And now this calcium citrate is not in the active form. So you can end up with the hypokalemia. So here the answer should be, sorry, hypocalcemia. Citrate can bind with the calcium and eliminate the calcium, and thus we can end up with hypocalcemia. Sodium level abnormalities are not directly linked to the packed RBC transfusion. So even in that case, that shouldn't have been the answer. We will still stick to hypocalcemia. If hyperkalemia was there, you would have gone ahead with that as the preferred answer. If that is not there, then you should stick to hypocalcemia because of citrate toxicity. Simple. Okay. Next, I heard there was a question on SIDH, but I think I also saw Vivek sir debating with the students that there was no question on SIDH. So one of the students said me that there was a question asking you SIDH was associated with. Now, whenever you think of SIDH, okay, so there may be a clinical story, even if there was administration of crystalloids followed by packed RBCs. What electrolyte abnormality we're expecting? Okay, so if patient was given hypotonic fluids before giving the packed RBCs, patient might develop hyponatremia. But when we give fluids in an emergency situation, we always give isotonic fluids. That wouldn't have caused hyponatremia. So I'm not thinking about the sodium abnormalities. We are only thinking about the potassium and calcium. And in that case, we can stick to the calcium. Kaushika, can you help me to frame the question? Was it directly asking you, is it SIDH or SIDH is associated with? So if they're asking SIDH is associated with, it is a pretty straightforward question. The most common cause for the SIDH is the respiratory system disorders, followed by the second most common cause for the SIDH is central nervous system disorders. And when I say respiratory disorders, it can be pneumonia, lung cancers. And if I'm thinking about the lung cancers, we would preferably think of small cell lung cancer. So if that was an option, that would be the answer. Okay, so if the question is which is seen related to blood transfusion, it is straightforward. Hyperkalemia, hypocalcemia can happen because of packed RBC transfusion. For that matter, hyperkalemia, any massive transfusion, we can get it, not just the packed RBCs. Hyperkalemia is not in the option. So the next best you can pick here is going to be hypocalcemia. Okay, so even in that case, well, Kaushika, our answer will remain same. That is small cell lung cancer. Good, good. Okay, next, this is again a very straightforward question. Nothing much to debate about. Patient working in cement industry is probably cement factory is exposed to asbestos and silica. So he is prone to develop asbestosis and silicosis. And here they're mentioning that he has developed mesothelioma. So that becomes a very straightforward question. The answer is going to be asbestosis. Silicosis is not strongly associated with mesothelioma. Asbestosis has a well-established connection with mesothelioma, which all of you know. Okay. Then there was a question on myasthenia gravis, primarily trying to confuse you between presynaptic and postsynaptic. So you have to remember that there are two disorders, like NMJ disorders can be classified as presynaptic and postsynaptic, where the disease process is affecting the presynaptic membrane, that is the nerve side of it or the muscle side of it. So when it is affecting the muscle side of it, we will call it as postsynaptic NMJ disorder. And when it is affecting the nerve side of it, we will call it as presynaptic NMJ disorder. For presynaptic, I want you to remember two conditions. The first one is Lambert-Eaton syndrome, and the second one is botulinum toxin or botulism. Postsynaptic, the main thing you have to remember is myasthenia gravis, because acetylcholine receptors are present on the muscle side of the neuromuscular junction, not on the nerve side. Voltage gated calcium channels are present on the nerve side. That's why Lambert-Eaton is presynaptic. So answer is very simple. In myasthenia gravis, the antibodies are directed at the postsynaptic acetylcholine receptors. I think Siraj sir had also discussed this point. Okay, now coming to the next question. A patient with irregular pulse, opening snap and mid-diastolic murmur. The moment you hear opening snap and mid-diastolic murmur, what diseases you can think of? You are mostly thinking of mitral stenosis or tricuspid stenosis, right? Among them, mitral stenosis is the most common. And we know that mitral stenosis is associated with increased risk of atrial fibrillation. In this question, as I hear from the students, there was also mention of irregular pulse. If that is given, I think you all know, straightforward examiners asking you to think about atrial fibrillation. So from the clinical stem, my diagnosis is it is a case of rheumatic heart disease, because the most common cause for mitral stenosis is rheumatic heart disease. So we're dealing with an RHD with mitral stenosis with AFib. And then the examiner is asking you what finding they are expected on the JVP. In simple words, this is a one-liner question. What is the JVP finding in atrial fibrillation? Instead of directly coming to that, he's just twisting it around. And what is the finding we get on the JVP of atrial fibrillation? Atrial fibrillation, we have classical absent A waves. So that will be our answer. Absent A waves is the classical finding of atrial fibrillation. So that's the answer we are going to stick to. Okay. Next one, the gold standard for diagnosis of Wilson disease. I think Rajesh sir has already covered it. But simple. As a screening test, we generally prefer a 24-hour urine copper, or along with, we can also do the serum ceruloplasmin levels. But if they're asking gold standard, it is always the quantitative assay of how much copper is present in the liver. And for that, we need to do a liver biopsy. So liver biopsy, specimen taken for the liver copper assay or quantitative estimation will be our answer when they're asking what is the gold standard. Chinu, you mean to say the ECG was showing only ST elevation in V1, V2? Then it is septal MI. If septal alone option was that, you can go ahead with that. If not that, you can still come to the closest answer, which is going to be anterior wall MI. Okay. Now, the drug used in the preoperative management of pheochromocytoma. As you know, whenever you have a patient with pheochromocytoma, the definitive treatment is surgery. But to control the blood pressure and other symptoms that patients are experiencing, like palpitations, diaphoresis, or sweating, we need to initiate an antihypertensive, and that has to be phenoxybenzamine. Phenoxybenzamine is given for at least 7 to 14 days before the patient is taken for surgery. We also start beta blockers. but beta blockers are started 3 to 4 days after starting the alpha blockers. So the drug of choice for the initial management of the pheochromocytoma is always going to be alpha blockers like phenoxybenzamide. Okay. The next question, I'm not very sure if this was there because many students, I felt they're confused between the mid-diastolic murmur that was described in the AFib question and this early diastolic murmur question. If there was a direct question asking you, where do you get early diastolic murmur? Then the answer is simple. There are two conditions where you get early diastolic murmurs. One of them is going to be aortic regurgitation. The other one is going to be pulmonic regurgitation. These are the two conditions where you get early diastolic murmur. It was a mid-systolic, is it? Okay. So if it was framed the way I have framed it, early diastolic, the answer is going to be AR. But if the question was, where do you get mid-diastolic murmur? Mid-diastolic, sorry, you meant to say mid-systolic, right? If they're asking mid-systolic, so what are the murmurs what are the conditions where we are getting mid-systolic murmurs? We get mid-systolic in aortic stenosis, pulmonic stenosis, and hypertrophic cardiomyopathy. These are the three conditions. So if any of these options were there, that would have been our answer. So I will mark this question for review. We will get it recorrected after consulting with other students as well. And then we will, I'll share that question with you guys. So if they were asking early diastolic and if you marked AR or PR, you're right. If they were asking mid systolic, if you marked any of these, you're right. Fair enough. Okay, so then there was this question on mutation in superoxide dismutase is associated with. This is something that I have told multiple times in previous YouTube sessions for FMGE, the YouTube quick revisions that we did, where I was expecting a question asked on the drug which is modulating the superoxide dismutase. I was strongly expecting that, but instead of going to the drug, they have hit the base, that is the mutation. So mutation in superoxide dismutase 1 is associated with amyotrophic lateral sclerosis. And then now we have a drug also which modulates this gene expression. That is an antisense oligonucleotide for superoxide dismutase 1 mutation. And that drug is called as tofersen. I was strongly expecting the question directly asking you which drug modulating the superoxide dismutase 1 expression has been approved for the treatment of amyotrophic lateral sclerosis. But instead of going there, they have simply kept it simple, asking you which mutation or which this mutation is leading to which disease. But in the next exam, I'm strongly expecting that from here, they will migrate to the drug. So if you're still preparing, please make a note of it. They are likely to reach the drug soon. So answer for this question is simple, straightforward, amyotrophic lateral sclerosis. Okay. Next, a patient evaluated for recurrent seizures and EEG showed hips arrhythmia. Correct me if it was not like this. EEG showed hips arrhythmia and recurrent seizures. This is what I got from the student. Hips arrhythmia refers to chaotic spikes, slow waves on the EEG. Chaotic spikes and slow waves on the EEG. Then it is classical description of what we call as, this is suggestive of what we call as infantile spasms. And for that, the drug of choice we all know is going to be ACTH, and ACTH should have been the answer for the question. Okay, so that's it we have collected so far from medicine. I'm creator, if you can ping me the question, I will definitely try to get the question reframed and come out with answer. And if there was also an EEG image, let me know so that I can include it in the final recall that we are sharing with you soon. So from medicine, we have around 16, 17 questions so far. I heard that there were also questions related to the management of ventricular tachycardia, but I haven't got the exact stem. I will continue to be active on the Telegram and other groups and collect the questions from you. That's it from me now. I will pass on the baton to the next faculty. So, sir, over to you, Jazeer, sir.
Thank you so much, Santhosh, sir. I hope I'm audible and
You're
visible.
audible, sir.
Thank you so much. Regarding dermatology, I got a few questions already collected. So here, I hope my screen is also visible, right? Yeah. So here, what I could collect is that contrary to the expectations, psoriasis, vitiligo, STIs, all those things were not asked. But whichever questions I got to know, I guess the difficulty level was not that high. So we'll see what are the main questions that were asked today. And just let me know in the chat box if, yes, questions were different. So let's see the first one. The first one which I got to know was regarding a child who is having vesicular lesions. I don't know if it was image was given or not, but if it was not an image, if it was mentioned that there are vesicular lesions over the palms, soles, and the oral mucosa, then obviously the diagnosis should be, yes, the diagnosis should be hand, foot, mouth disease, right? So in hand, foot, mouth disease, we know that the most common causative organism in this case should be a Coxsackie virus. So just let me know if it was a similar question, or at least let me know in the chat box ki image was given or not, or they just mentioned you a clinical scenario and you were expected to reach out to a diagnosis. Okay, ditto images. Okay, fine. Thank you so much, League Doc, for answering. So I guess all of you should have got this right, because vesicles, again, hand, foot, mouth, that itself will show you that the diagnosis is going to be hand, foot, mouth disease, and the most common organism which causes this infection is going to be Coxsackie virus, right? So the next question was, again, I guess it was a clinical scenario. So in this clinical scenario, the primary mention was that patient with umbilicated lesions. And I guess in the question itself, they mentioned about Henderson-Peterson bodies. I just added the image by myself. I don't know if it was an image-based question or not. So kindly confirm once again in the chat box what exactly was asked. So if it was mentioned that there are multiple papules and all these papules had umbilicated lesions. So this one, the central umbilication, this what you can see in this image. So all those central depressions, these central umbilications, these are going to be very typical for which one? Is it molluscum? Is it basal cell carcinoma, keratoacanthoma, or impetigo contagiosa? Thank you so much, Shivam, for the remarks. Yeah, so this is going to be molluscum contagiosum, right? So that is how we'll be able to make a diagnosis. So in case it was mentioned in the question about Henderson-Peterson bodies, so these inclusion bodies and all is going to be confirmatory. So thank you, Shivam, Rare Streamer, and Indrashish Chandravamshi for letting me know. Thank you. So now let's see one more. In this question that you can see in the screen right now, many of you have given me a different type of question, but this is how I have framed it. Just let me know if there was any other corrections. A patient presented with redness, swelling, and characteristic skin nodules. So skin nodules, which is tender and painful, and he's undergoing a treatment for leprosy. So in this case, what is the next best management? So are you sure that this is how the question was asked? Because in this case, we know that the patient is already undergoing a treatment for leprosy. And any patient who undergoes a treatment for leprosy, if they develop some nodules, which is going to be tender and painful, so what is the likely diagnosis? Yes, very good, Kausika. So here, should you stop the treatment? So what are we talking about? These nodules here that we talk about is going to be a lepra reaction, isn't it? And which type of a lepra reaction it could be? So the examiner is most probably telling you about a type 2 lepra reaction, right? So in a type 2 lepra reaction, the patient may come to you with fever, other systemic symptoms. Along with that, the patient would also will be having some nodules, tender nodules underneath the skin. Question, it was mentioned that he stopped taking medications. Acha, okay. So stopped taking medications. See, in any case, please understand that a patient of leprosy, when he develops these nodules, it should be a lepra reaction. So in those cases, you are not expected to stop the treatment. But if the patient has stopped treatment, then we will have to again continue the treatment as well as start on steroids. Was steroids given? Heaven Girl is saying he stopped leprosy medication and now he developed. Acha, theek hai. So what I understand from all your things is that the patient took treatment for 4 months and he stopped the treatment. After stopping the treatment, the patient developed these nodules. Again, what are you supposed to do? You have to continue with the treatment, right? You're not supposed to stop the multi-drug therapy for leprosy, isn't it? So, okay, if steroids was not given in the MCQ, okay, if it was going to the next level, then it should be like you should continue on the multi-drug therapy, as well as you should have started on a steroid like prednisolone. So, okay, like this was the options. So in that case, please remember, you should not discontinue the treatment. You have to continue with the treatment. I hope that all of you have got this right, isn't it? Okay, fine. Thank you so much. So now let's see the next one. Another question where there is a mention about a patient with a hyperpigmentation over the lips and with frequent complaints of stomach ache and melena. So what is a possible? What is a possible thing? See, Heaven Girl, continue or restart, because I don't know if both of them were there in the MCQ for the previous question. So if it is like multi-drug therapy was mentioned, you are actually supposed not to stop the treatment. You should, if it is stopped, then you have to restart. So whatever is the option that was given, the most appropriate one. Okay, restart was in the option. Okay, then it is not continue, then restart with multi-drug therapy should be the right one. Okay. So the next one is child. What about this question? Did you get this question where there is a mention that there is some hyperpigmentation over the lips or in the skin, and along with that the patient is also having some GI symptoms like stomach ache. So in those cases, what is this? The hyperpigmentation, this hyperpigmentation of the lips. Yes, this one should have been lentigenes, right? So the dark brown or black colored discoloration or a hyperpigmentation, which you can see over the lips as well as the skin, over the mucosa as well as the skin. So this is called as lentigenes. And what is it associated with? Is it McCune-Albright syndrome? Is it intussusception, Peutz-Jeghers syndrome? So any comments on this question? So here, most likely, if this is how the MCQ was, then it should be most likely to be Peutz-Jeghers syndrome. Thank you, Jawad, for confirming. So in this case, I guess it's more or less easily guessable thing. So that is going to be a Peutz-Jeghers syndrome. Chandravamshi, Heaven Girl, all of you are saying. And then I think this may be covered in either patho or micro as well. Zangsmere finding. So Zangsmere finding in herpes simplex. Some of you said, where do you find multinucleated giant cells? Some of you mentioned that they asked you like, what is a Zangsmere finding? So if anybody could, okay, pigmentation on the lips, blue, black was given in the question. Thank you, Heaven Girl, for confirming that. So coming back to the same, this question, Zangsmere, herpes simplex. Remember, if you have gone through the last FMGE exam questions, so the same topic was asked, isn't it? The same kind of a question was asked. So yahan pe what should be the answer? Multinucleated giant cells, because be it in HSV, be it in varicella. So HSV infections, varicella infections. So in all those things, you'll be able to see this multinucleated giant cells. Jawad says reverse. Reverse matlab multinucleated giant cells in Zangsmere can be seen in, isn't it? Then the option should be like herpes, herpes zoster, all those things. Acha, theek hai. Fine, fine. So anyways, HSV and multinucleated giant cells, they all both come together. That is what is the takeaway message. The next one, there was a question on, got it, Dr. S. Thank you so much. So here the next one is a dentist presents with painful lesions over the hands that looks like blisters. So in which condition do you get a painful blister? So painful blister, and here it is mentioned that it is a dentist and he's having a history of fever, isn't it? So no, not parvovirus. Anything else? What do you think this should be? Dentist working in the oral mucosa and probably he's getting a painful lesions, blisters over the hands. Acha. So here pe we would be thinking that this is going to be a herpes simplex virus infection. So remember, whenever you get a painful vesicles, okay, painful vesicles, or especially over the fingertips and all. So in this cases, painful vesicles can be due to herpetic whitlow. Herpetic Whitlow. No, I don't think this can be paronychia, because paronychia you will not get a vesicle. Instead, in the cases of paronychia, you would be getting pus underneath the skin. Pus underneath the skin. And this is mostly because of the infection of the lateral nail fold. And there should be some history of an injury as well, which is not mentioned, right? So Dr. S is confirmed ki, but this question was there. Can anybody let me know? Because many of you said that dentist, vesicles. Yes, something like this was there. Okay, that is what I am getting the response now. Okay. So painful vesicles, remember the diagnosis should be herpetic Whitlow. It's caused by herpes simplex virus. And again, type of lepra reaction. Did you get two questions on lepra reaction? Because there was a question that most of you recollect that was regarding borderline tuberculoid type of leprosy. So did you get a question like this? Like, did you get a question like which type of lepra reaction do you see in a borderline tuberculoid? So remember all the borderline type, be it BT, BB, and BL. So heaven says yes, yes, no. Okay, so in all these types, you get a type 1 lepra reaction, isn't it? Lepra reaction. Because in all the lepromatous type, be it borderline lepromatous or lepromatous leprosy, you get a type 3 hypersensitivity. It's a type 3 hypersensitivity, isn't it? Or let us say, if it is regarding the lepra reaction, this is going to be type 2 lepra reaction. Yes. So here, what should be the type? If it is borderline tuberculoid, then the correct answer should be type 1. There was a question, they're having a thickened nerve near the neck and redness near the ear. Okay. So any case, if there is a mention about nerve thickening and some redness near the ear and all, are they trying to classify between a paucibacillary and a multibacillary type? Because remember that as per the classification, if there is any nerve thickening, even if there is an involvement of a single nerve, it should be a multibacillary type of leprosy. So, okay. So I guess that is it, all that I could collect from all doctors like you. So, okay, greater auricular nerve. Okay, if it was a mention that somebody is having a hypoanesthesia and along with a nerve thickening, especially behind the ears, then yes, greater auricular nerve can be the right answer. Okay, Warrior, Kaushika, all of you are answering. Then greater auricular nerve should be the right answer. So these are all the questions that I could gather from dermatology. And I hope that all these questions were doable. And rather than getting purely derma questions, I felt most of it was integrated with microbiology. But yes, that's it. I will not take more time. And wishing you all the very best for your great results. And over to Dr. Eradata ma'am for your psychiatry recall. Thank you so much.
Thank you. Thank you so much. I hope I'm audible and visible. Just give me a quick thumbs up, guys. कैसा रहा आपका psychiatry? From what I heard from most of the students, ठीक था, ज़्यादा नहीं, difficult था, और ज़्यादा सवाल भी नहीं थे. Give me a thumbs up, guys. Can you hear me, see me? All right, awesome. So how was psychiatry for you? Okay, medium, not too hard. जल्दी से करेंगे. We'll give chance to the other teachers. We want everybody to have a great recall, and we promise always, as always, that जो रह गया है, we will update the recall very soon, guys. So just keep looking out. It's not that we may get everything right away, but we will surely update it. So let's go. The first question that I stumbled upon through most of the people who could recall was that a 30-year-old software engineer comes to the psychiatrist's clinic with complaints of not being able to work properly and difficulty in balancing family and work. So the work-life balance is not great. क्या ये सवाल था? Can you please confirm this question was there? What is the most likely disorder the patient is suffering from? Right? Is it acute stress syndrome? Is it PTSD or post-traumatic stress disorder? Schizoaffective disorder or adjustment disorder? Now, clearly, there is no psychotic element mentioned here, so we have completely taken away schizoaffective from the table. And the duration here, somebody said, was 3 months. Okay. Now, so PTSD is also not there because there's nothing catastrophic. So you need a very big event and a stressor for PTSD to be there. Now, between acute stress syndrome and adjustment disorder, remember that in adjustment disorder also, a clear-cut stressor needs to be there and the timeline needs to be less than a month. So automatically answer is acute stress syndrome. Did you get this right, guys? Acute stress syndrome. Was this the answer you all also marked? Give me a thumbs up अगर ये answer आप लोगों ने भी किया है. Acute stress syndrome for this question. Acute stress syndrome. Okay. Plus mania, वो अलग सवाल था from what I understand. वैसे भी एक ही सवाल में you can't mix the two of them up. I don't think इस level पे we are asked complicated questions like that. Let's look at the next question. Thank you for confirming, Dr. Jawad. A 26-year-old male believes that he is very rich, not that he is really very rich, believes that he is very rich, and that someone is trying to kill him and take his wealth away. Also, he appears depressed and physically unwell. What is the most likely clinical presentation? ऐसा कुछ question था? Was this there? Waiting for you all to confirm. ऐसा ही था exactly word for word, or was there something tweaked? The depressed part was not there, or the physically unwell part was not there? Okay, Heaven Girl says yes, exactly. Awesome. Now, automatically grandiosity is very, very visible. That there is grandiosity, but the person also feels that somebody is going to kill him. How many of you marked persecutory delusions with depression, and how many of you marked delusion of grandiosity with persecutory delusions? A. All right. Most of you marked A, and A is correct. See, the depressed and physically unwell is given to little bit throw you off what he appears, but what the presentation is. Sometimes there could be incongruency. So delusion of grandiosity with persecutory delusion, sahi answer hai. Great guys, correct. All right, option was delusion with persecution and nihilism was there. See again, what I have got from recall is कि nihilistic वाला एक अलग था and grandiosity was there as a common in both and delusion and depression was there. From the recall that we have understood, these are the three most common recalled options. If there is more, please, like I said, we will keep improving. अगर आपको बाद में feedback देना होगा, we will come back with a more precise updated version and we will put out a video for that recall as well. But this is what we have gathered from most of the students. All right. Moving on to the next one. Please tell me if this question was there. A 36-year-old woman presented with hyperactivity, too much activity, reduced need for sleep, and excessive spending. For how long? 2 weeks. When questioned, she also became irritable and angry. What is the most likely diagnosis? Is it schizophrenia, bipolar 1 disorder with manic episode, bipolar 1 disorder with hypomanic episode, or cyclothymia? Heaven Girl says yes, exact question tha. The Dr. S also says exact question. Ardra also says same question. Now, automatically, we know that there are mood symptoms. So, let's cancel schizophrenia because the mood symptom is not there here. Between bipolar and cyclothymia, it is very clear that the gravity of the situation is large. Cyclothymia cancel kar diya because cyclothymia is, again, low for 2 years. Now, based on the time duration itself of 2 weeks, we can safely say that manic episode is there, but also the gravity of the problem is very big, which is why this is a manic episode in bipolar disorder and not a hypomanic. So bipolar disorder 1 with manic episode is the right answer. Great. So most of you have gotten this correct. Please help me complete this question. मुझे ये question पूरा नहीं मिला. Please help me. There was a question around schizophrenia, which said that the patient, again, fill in the blanks for me, please. Patient presented with complaints of dry mouth, dizziness, and hypotension. What is the most likely drug causing side effects? Was it like this, word for word, or what was it? There's another version of the question that I have gotten, which says that a patient with schizophrenia currently on benzotropine and then presented with these symptoms. Although I believe benzotropine may have been the answer to the question as well, because benzotropine is given to prevent the extrapyramidal side effects. and that does cause these side effects. So can you help me with this question? ये question incomplete है अभी मेरे लिए. So again, if the question did mention benzotropin, the point is which one is treating these? Then yes. Heaven Girl, can you please write the full question for me once? So which medication is treating these side effects? Which medication is treating these side effects is less likely the question. And what were the options given to you? Because from what I have understood, ma'am, please explain difference between mania and hypomania. Okay. So very simply put, mania बड़ा है, hypomania छोटा है. Mania में सारे symptoms exaggerated होंगे, causing difficulty in day to day. Hypomania will not affect that much. There may also be insight in hypomania. Another very important difference is 7 days or more for mania, but 4 days for hypomania. So the major differences in the previous question showed the gravity of the situation being bigger, which is why that was very clearly a manic episode, not a hypomanic episode. Okay? Patient was on some psych medication. Okay, guys, give me time to come back to you with this. I am trying best to gather. Patient with schizophrenia was on medication showing these side effects. Which of the following will be treating these side effects? And Heaven Girl, what were the options? Ye side effects the. But was there an option like stop a drug, continue a drug? Did it say benzotropin ko kya karna hai? Reduce, taper, add? Did it say something like that? Meanwhile, I'm sharing one more possible question. Tell me if this question was there. Benzotropin and physostigmine, okay. Again, those can be the side effects. I'll also come back to you. I'll also discuss with pharma about what exactness was there in it. Bunch of drugs. I'll discuss with Siraj sir also and come back to you on that. Was this question there? Nocturnal enuresis related question. Yes, Heaven Girl, thank you so much for contributing. Can somebody tell me if there was a nocturnal enuresis question? Dose increase of benzotropin, but the option was CBT. So that's what, guys, that question is becoming more complicated if you add CBT to it, a drug and a therapy. So I will come back to it. Nocturnal enuresis, if this was the question, if the child is having nocturnal enuresis, and then the treatment of choice was the question, option was increase of risperidone. Okay. So option was increase of risperidone, then the treatment has to be benzotropin. If anything like risperidone was mentioned, so to counteract risperidone, we do give an anticholinergic cover like benzotropin to reduce the side effects. So, okay. Now, in this one, nocturnal enuresis question, okay, just let me clarify. Let's stick to this first. Nocturnal enuresis, behavioral therapy was there. Bed alarm tha, bed alarm option mein tha. Behavioral therapy में specific bed alarm था. Then अगर bed alarm related mechanism था, then that is the correct treatment of choice. Behavioral therapy में that bed alarm system comes, where the urine touches the bedpan, the bed, and immediately the alarm goes off. Okay, no. CBT tha option mein. CBT will not be the treatment of choice. There will be a behavioral therapy, and then in behavioral therapy also specifically the bed alarm type treatment. Again, guys, give me some time. Now, in just to clarify one last time, it is likely that he is currently on benzotropin, but what caused dry mouth, dizziness, and hypotension? Well, the benzotropin is very likely, or even the risperidone is likely if there is a question. Bed alarm wasn't there. Okay, so behavioral therapy is also an acceptable answer. Between cognitive behavioral therapy and behavioral therapy, was there separately cognitive behavioral therapy and behavioral therapy as two options, or was there only CBT? Initial treatment पूछा था और option क्या था? Behavioral therapy था तो BT is the right answer. अगर drug था, single option. Okay, if behavioral therapy was there, then behavioral therapy, because again, waking up the child, making them pee and come back, change of behavior. Okay, great. I think we are done. I will request you all to please check physics wala page, and then we will come back with a more updated one. Over to the next teacher. Thank you for your time, guys, and thank you for your help.
Hi, almost it is 11:30 right now. Thank you, madam. Okay, as far as pediatrics is concerned, I am finding it difficult to find the options as well as the question framework. I have only some themes that were asked in your entrance examination. The first question is this: what is this one with respect to the question? So you all know that it is pulmonary oligemia. So you don't have any pulmonary vascular markings and you have a boot-shaped heart. What is the question that they had asked, Heaven Girl? What is the question that they had asked with respect to this? Only spotter, or they had asked something more than the spotting this X-ray? Say it is TOF, yes, tetralogy of Fallot. So Karen Sabot, so spotter. So it is tetralogy of Fallot with the reduced pulmonary vascular markings, right? So yes, you all know it is a case of tetralogy of Fallot, the most common cyanotic congenital heart disease. And when you have this picture along with the right axis deviation, unless otherwise proved, it is tetralogy of Fallot. When you have left axis deviation, most probably it is tricuspid atresia. So I don't think you have very difficulty in answering this question. Let me go to the next one. So is this something related to spotter like with respect to pincer grasp, or they had asked something else beyond this? What is that actually? You all know that pincer grasp usually occurs by about pincer grasp. So you have mature and immature pincer grasp. Immature usually starts by 9 months and gets matured by about 1 year. So what is the question that they had asked? What is the question? I would like to know the question to answer you. I know something related to pincer grasp was asked, but I would like to know the exact framing of the question. If it is possible for you to post in the YouTube messages, let me be. Okay. So what is that crawling, creeping? So crawling by about, crawling, creeping. So which one is crawling? Which one is creeping? Creeping. So Shivam, I would like to know the exact question framework. Question framework. Child can sit without support. Child can sit. So usually tripod is by 6 months. That is with support, without support by about 9 months. 9-month-old child with some activity, which of the following happens during this time? So by about 9 months, pivoting can also happen. Apart from pincer grasp, pivoting. Pivoting is nothing but turning diagonally back, sitting without support. That is called pivoting by about 9 months. What else? So 9 months you have pivoting, 9 months sitting without support, as well as immature pincer grasp started. Pivoting can also happen by 9 months. Option is creeping. So when does crawling happen? When does creeping happens? So you have crawling by about 8 months. Crawling is abdomen touching the ground. Creeping is abdomen off the ground, that occurs by about 10 months. Crawling by about 8 months, creeping by about 10 months. What else? I would like to know the exact question framework or the options. Crawling is about by 8 months. Creeping by about 10 months. Damn sure. No doubts in that. Okay. So basically this is we will come up with options that were given in the examination paper. This is a wrap-up session actually. So what is this? Then there is some question with respect to rickets, widening of. So with respect to rickets, what did they ask? So one is widening of wrist. Apart from widening of wrist, what does it mean? So what is this? Valgum or varum. So this is varum. This is varum, not valgum. This is varum. Both valgum and varum occurs in case of rickets. So what is the exact question that was asked? Apart from widening of wrist, as if you keep some rum bottle in between knee. That's why you need to remember varum means it goes away. It is not, it is opposite of knock knee. So what is the exact question they had asked? This is tibia varum and this is widening of wrist. Would like to know the exact question framework. Bharatish, fluorosis. I don't think it is related to that. Something related to rickets. I would like to know the exact question framework with respect to rickets question. Cupping, fraying. Yeah, what are all the radiological features? You have cupping, you have fraying, you have widening, and many people used to forget. You also have generalized osteoporosis. Porosis. Yes, it is vitamin D deficiency. Usually from 6 months to 2 years is the period you get nutritional rickets. Less than 6 months, it is always either vitamin D dependent rickets type 1 or vitamin D dependent rickets type 2. No image. Then what is the question framework? You tell me, let me try to answer you. Okay. Then there is a question on Down syndrome, typical phases, mongoloid slant, epicanthal folds, smiling baby, flat nose, brachycephaly. So what is the question with respect to Down syndrome? What is the exact question with respect to Down syndrome? Yes, simian crease, sandal gap. What is the question that they had asked? Yeah, you have epicanthal folds, upslanting eyes, brachycephaly, hypotonia, simian crease, sandal gap, borderline IQ, hypotonia. Okay. And then there is one more question with respect to webbing of neck. You all know that Turner syndrome is X0 and newborn manifestation is cystic hygroma. Another point is you have edema involving hands. Edema involving hands. So would like to know what is the question with respect to Turner syndrome. What is the question with respect to Turner syndrome? What is the exact question they had asked? They are more prone for gonadoblastomas. They are prone to have coarctation of aorta and hypertrophic cardiomyopathy. Okay. And okay, so this is all from your pediatrics. So we will be meeting you soon with the correct framework of stem of question along with the correct answers. Over from my side. Thanks a lot.
Hello, my dear friend. A very warm welcome to all of you in this recall session. Let's discuss the question which came from the PSM part. This first question was actually one of the exact question which we discussed in our 100 question guess part also before the exam, that if there is an aniline dye industry exposure in the past and we are comparing the occurrence of bladder cancer in two group of people, one who are working in aniline dye factory, one who are not working there, only based on past record, not future follow-up, only based on past record. So if we are doing only past record, that is retrospective cohort, because only past work record history was there. You can see only past record history is there. If along with past record they also have future follow-up, then it would become mixed cohort or ambispective cohort, which is also known as nested case control. So here only past record, so the answer was retrospective cohort. If past record plus follow-up is there, then it will become mixed ambispective or nested case control. Otherwise it is retrospective or historical cohort. Okay. The next question was blood stained cotton swab, where does it goes? All of us know it will go in yellow. The confusion was chlorinated or non-chlorinated. So actually chlorinated bag has been banned in the recent guidelines because it releases polyvinyl chlorides and a lot of pollutant which can cause natural pollution plus some cancers also. So chlorinated bag is no more used. That's why we are using only non-chlorinated bag. And of course cotton swab as a soiled waste, and soiled waste goes in yellow color. Then the question was based on Africa, and we all know Africa is endemic for yellow fever. So if someone is coming from Africa to America, he must take yellow fever vaccine 17D strain, and yellow fever vaccine gives immunity after 10 days of taking it, and the immunity is lifelong. Then the next question was that a man is working in stone factory and he developed on chest x-ray, you can see egg cell calcification. What is the thing? So again, this was the exact thing which we discussed, that if on the x-ray lung they are talking about egg cell calcification in lung field, that is silicosis. But if they are talking about calcification in the peripheral lung field, that is mesothelioma, which occur in asbestos factory worker. So both the question came, egg cell calcification, which was previous UPSC question in mediastinal area, that is definitely silicosis. And if they say mesothelioma cancer and all, then that will become asbestosis. So let's go to the next question. Actually, in the recall session, I have specifically said that they ask question only from complete extension again and again. And my family is an exact example of complete extension. I have 2 kids and my wife has gone through vasectomy. So now there is no more chance of kid also. So what happened in complete extension? Birth of last child occur and till first child leave home. Our family belong to complete extension because my youngest girl child is 3.5-year-old only. So she will not leave home soon, hopefully. And therefore, our family belong to this phase, complete extension, which they ask again and again. We think extension is there. So if first child leave home, it will become contraction. No. Till first child leave home, it is extension. When first child will leave home, then we will join into contraction. But till that time, till my kid is not adult to leave home, our family belong to complete extension. Last child was born in 2023. That is in complete extension. And this exact thing, again and again, they ask complete extension part only. Next thing was being asked and discussed in all the TNDs and all the things, open vial policies, which I said is very easy to remember. You just have to remember 4 things: Hep B, PCV, all tetanus, all polio. These are the 4 things which follow open vial policy. And open vial policy means we can use it till 4 weeks of opening the vial. So what are those? That is only 4 things: PCV, Hep B, all tetanus, all polio. So when it comes to all tetanus include, of course, the DPT also, the pentavalent also, the DT also, and the TT also. And all polio include OPV and IPV. Of course, fractioned IPV. And so it's simple to remember: PCV, Hep B, PCV, all tetanus, all polio. So these are the vaccine which we can use even after opening the vial till next 4 weeks, if stored adequately between 2 to 8 degrees Celsius. So what we have to keep? We have to keep pentavalent and throw MR. So use pentavalent, throw MR. This is a exact repeat question from INI-CT. That's why we should solve some of the question of recent INI-CT also. Now, again, one more question which we already discussed in guest thing, that when we talk about OCP, O for OCP increases outside cancer. OCP increases outside cancer. And what are the outside cancer in a female body? Of course, breast and cervix are outside. But nowadays there is a debate on breast cancer, but cervical cancer for sure increase by OCP. But OCP decreases inside cancer. And what are the inside cancer? The inside cancer is the ovarian cancer and endometrial cancer. So ovarian and endometrial decreases, outside increases. So the question here they are asking is chances of which of the cancer is reduced? Definitely endometrial will get reduced, breast and cervix will increase, oral cavity cancer have no effect. Okay, so it's simple. Then if we are dealing with TB patient having schizophrenia and all, then it is telemanas through which they will coordinate. And telemanas is dealing with mental health consultation, and it's NeXT we report TB patient. But here they are talking TB patients having mental illness through which teleconsultation we will discuss. And NeXT is not teleconsultation, it is for reporting of TB patient by both government and private doctors and hospitals. Okay. Then the second question was that if you are giving training to A&M and she has to throw cotton, cotton will definitely go in yellow. Then syringe is made up of plastic, so it will go in red, and the needle will go in white. But if there is syringe with fixed needle, that will also go in white. So here syringe with needle in black is definitely wrong. Black is for garbage, plastic wrapper of syringe and other garbage goes in black. Then used vial in translucent white container. No, all vial goes in blue container except the cytotoxic drug vial. If there is vaccine vial which is broken or not broken, they will also go in blue. But if there is cytotoxic vial, only they will go in yellow. So here they are not talking about cytotoxic vial, so that is also wrong. Cotton swab in yellow bag is definitely correct if that was one of the answer. Okay. Then the next question was that in a child, if there is a scar formation is not there after taking BCG and the parent came to you that sir scar is not there, what to do next? Then in that case we just have to reassure, because even if the scar is not there we consider it to be given, and that is the answer that we just have to reassure. Okay. The next question was to find incidence and prevalence, which we discussed in all the last guest paper series, because in just recent INICT they asked question on incidence calculation. So when we calculate incidence simply means new case by population at risk who are at risk of developing the disease. That is we put, and we can multiply it by 1000 usually. So how many new cases are there? Let's find it out. In an area with population of 10,000 and 100 TB cases, 30 was cured and 10 died. So 20 new cases were reported. New cases were 20. And 5 of them were cured before 31st December 2024. So find incidence and prevalence. See, we all know prevalence means total case. Old plus new case is prevalence. Okay, new case they are saying 20. Old case which still have the disease, you have to discuss it very patiently, we can do it. See, 100 TB cases are there. In January 1, 2024, 100 TB case was there. And then in this 1 year, 20 new case also came. So total case was 120. But out of this 120 total case, there is this story that 30 was cured and 10 died. So you have to remove this 30 who get cured plus 10 who died, because prevalence means total case at present moment who still have the disease. And because they are cured and die, we have to remove them from 120. So if you remove 40 from 120, it will become 80. So total, acha. So you understand the thing. Prevalence will be 80 because there were 100 cases at the starting of the year, 20 new case came. So total case 120 and 30 cured, 10 died, we have to subtract. So total case become 80, out of which new case is 20 and old case is 100 minus 40, 60. 60 were old case, 100 minus 40 and 20 were new case. So prevalence is simple. Now let's discuss about one more thing we can discuss here is that okay, total 80 case was there, but they are now complicating it. New cases was there, but 5 of them were cured before 31st December. So 5 of them out of this total 80, because they are cured, but so they are cured, so that means at present moment they are not suffering from the disease. So then we have to subtract this 5 more case also, and finally the prevalence will come 80 minus 5 because they got cured, 75. So it is actually new case is 20 minus 5 because 5 got cured. So at present moment only 75 have the disease. Now let's think about incidence. Incidence have 20 new case. So incidence means new case. It do not matter whether they got cured or not. So new case, in case of new case, we will put 20. What is the population at risk? Total population was 10,000. But out of 10,000, 100 were already having TB. So that means it is 10,000 minus 100. This is the population at risk, because जिनको ऑलरेडी टीबी हो चुका है अब दोबारा थोड़ी होगा. Those who have already developed TB, they will not develop it again. So it is 9,990 denominator, 20 as the numerator, and then multiplied by 1000. So I think the options do not match here, but this is the way to find it out. Of course, the recall is never correct in any of the FMGE exams, plus it is the same day session. So we will take a separate session. I will definitely take it, where I will discuss all these questions with correct options probably, and with complete better accuracy we will discuss it. Okay. Next question is, this is the logo of biohazard, and then in the radioactivity things there is different logos question has came, and that is also a big controversies about all those logos which came. Now absolute contraindication in IUCD is one of the, definitely it is if pelvic inflammatory disease is there, if there is history of ectopic pregnancy, then also we don't give. If there is hyperlipidemia also, then we also don't give. If so we can tick hyperlipidemia here, but the better answer we will discuss with proper reference in our next session. Now this question we discuss with a very simple example, that if you are comparing the time taken to do work and to do chit chat, this is work sampling. So let's say you want to recruit a surgeon in your hospital, and there are 2 surgeons who applied. First method is you will call their hospital and you will take feedback from many people how where they are working. That is Delphi method, when we took feedback from group of people. But if you are giving them surgery to do and you are comparing how much time they are taking to do surgery and how much time they are doing extracurricular work and all, that is work sampling. And if you are checking their cost effectiveness, that they will take the same 3.5 lakh salary, who will be more productive for the hospital. If you are comparing cost effectiveness, then that will be system analysis. So in work sampling, we compare the time taken to different work, which is here. Then if we are talking about registration of family planning and marriages, these are done at sub-center. And at sub-center, there is multi-purpose worker female, which is known as ANM or health worker female. And they make all this detailed entry of marriages and all in the register, which is at sub-center. If they are talking about birth and death registration, that is done at PHC, because PHC has an MBBS doctor, and we can rely on MBBS doctor for birth death registration, which is more legal thing. Marriage registration at sub-center. So sub-center, we have, you all know, there is ANM, which is also known as health worker male or multi-purpose worker female. She will do the registration. Okay. Then there was question that if you have, there was calculation of 95% confidence interval. The data we did not get properly, but I hope you all know the formula, that if we have to find confidence interval 95%, we will do mean plus minus 2 standard deviation. It was a calculation based question, which we can definitely, if we will get the correct option, we will come back with the correct options in the next sessions. Then this question was based on which test we will apply, and they are saying there is 2 different group, and we are using blood pressure and standard deviation. So you can see there is 2 group. This same question we discussed, 2 group, and there is something which is quantitative data. Quantitative means we can measure, like BP we can measure. So if something we can measure and there is 2 group, the answer is student t-test, which is also known as unpaired t-test. So here also there is 2 group, and we are measuring BP, which we can measure. So whatever we can measure is quantitative. Therefore, the answer become unpaired t-test. Okay. Then the question was, In workshop, panel discussion and symposium, which type of communication occur? So the communication is of two types, didactic and Socratic. Socratic means there is two-way communication, and didactic means the communication is one way. For example, Modi is coming on radio and saying Man Ki Baat. So he's saying it, but we cannot say that you are saying just anything. And we just have to listen on radio, TV, newspaper. All of these are just one-way didactic. Lecture is also didactic. So whenever we talk about radio, TV, lecture, these or Man Ki Baat, anything that is didactic. Socratic means two-way discussion. And when we do workshop to teach people how to give IV injection, suppose you are doing ASA INM training. So in the morning you will teach theory, in the evening you will ask them to perform it. And of course they can ask the question. Similarly, in panel discussion symposium also audience can ask question. Panel discussion is done in no fixed order. Anyone of the expert can speak at any time, and audience can ask question in between. But symposium, a fixed order is there and audience asks question only at the last. So the point is, in both, all the three, because audience can ask question also, they can interact also. So the way of discussion is two-way. That's why it is Socratic. Okay, not didactic. Cervical cancer screening, which core test is used? So there is a big controversy in this question, because in part textbook they have written that first we do VIA, then we ask the patient to come to hospital. If VIA thing is there positive, we send him, the patient, to such a center where we can do pap smear with biopsy. So VIA and then we do pap smear and biopsy, that is written there. But in the recent Park edition, which I was just reading before discussing all these questions, that they are saying that nowadays HPV DNA is something which WHO is recommending. So this is one answer where I also need to be sure before answering. So we will come back with it in the final discussion session. Now, this was one question where they are saying that the patient is coming with 25% burn, which category he should go. So this extended sickness benefit is the one where we give 2-year leave in addition to 91-day leave of sickness benefit. And this 2-year leave is given for 34 diseases. And in those 34 diseases, they have used this word, more than 20% burn is one of the disease in this 34 disease. So this is a serious thing which need long leave. So that's why we can give leave for 2-year extended sickness benefit written in Park. Then a child who eat paint will develop lead poisoning, plumbism. Paint is of lead is sweet in taste. So the child keep on eating and develop lead poisoning. Then if water contamination is there in the village tank, we have to check for a lot of things. Arsenic, nitrates also, fluoride also we definitely discuss. Plus we check the TDS level and a lot of levels. So fluoride definitely we check, because if fluoride is more than 1.5, dental fluorosis can occur. And if fluoride is more than 10, skeletal fluorosis can occur. So we do have to check for the fluoride level. And what is Longlier saturation index? Longlier saturation index is telling us that what is the amount of calcium carbonate level in the water, which decides the pH level of the water. If the calcium Longlier saturation index, which comes 0, it means it is ideal water. But if the Longlier saturation index is coming, let's say +1 or +2, it means the water is corrosive. So it is talking about corrosion and water balance scaling. Let me explain it a bit more. If the Longlier index is coming, let's say between less than 0, suppose it is 0. Less than 0, let's say -0.5 or something, it means water have scaling. Water has scaling property due to high amount of calcium carbonate. Scale white, you must have seen it. When you boil water, white thing deposit on the utensil. What is that white thing? That is calcium carbonate. Calcium carbonate do not cause hardness. It only deposit after boiling. So if calcium carbonate is based on that calcium carbonate concentration, we calculate Longlier saturation index, which decides the pH of the water. And if Longlier saturation is less than 0, that calcium carbonate will deposit like a scale. If it is more than +1, +2, in this case, corrosion will occur. So what is it deciding Longlier's index? It is discussing what scaling and corrosion. What is the concentration of calcium carbonate? Based on that, we can decide the pH and pH will decide Langier's index, and if Langier's index is more than 1, corrosion, water can cause corrosion. Again, if they have seen the mesothelioma thing, definitely mesothelioma occur in asbestos factory worker, peripheral lung filled will have it. And if a male is coming from Assam and present with leg pain and bowing of leg, so this is indicating high fluorine level, and high fluorine level is in all the area which has water scarcity plus Ganga belt. This two area, Ganga belt and water scarcity area, they have high fluorine level. So what are water scarcity area? Only 2 districts of Rajasthan, Jaisalmer and Badmer, have some water crisis. Not that too, not the whole district is dry. Plus some part of Gujarat like Kutch district, some part of Tamil Nadu and Telangana can have it. And Ganga belt is UP, Bihar, Assam also come under Ganga belt. So all this area have high fluorine, which can deposit on teeth, leading to dental fluorosis, depositing on bone if fluorine is more than 10, causing this symptoms of skeletal fluorosis, okay, bowing and leg pain. So that is there. Then this last question was again directly from one of the this question which we discussed in our last session, that if the person is only eating pulse and rice, and then he developed stiffness so that he can walk only with a stick, then he need vitamin C for the treatment, because he is a case of neuroletharism, and in neuroletharism we give vitamin C 500 mg 2000 milligram. This is a repeated NEET PYQ of 2023. So we will give vitamin C. Okay, so these are the questions which we have got till now, but I will come back with a detailed explanation of all the question with proper referencing from Park, and with more question also probably, and in detailed manner in our next session, which we will take within probably 1 week, detailed explanation of all these things. Okay, so thank you so much, my dear friend, for this participation. If there is anything you want to ask or say, you can always say. Okay, so there are some point which you are trying to say. One is that yeah, of course, the recall questions can be wrong. Don't blame us for that, because FMG exam occur in 2 sessions, and after 1 session no one ask us from us also ask for recall, because this is the time to relax. And after 2nd session, no one is in mood to recall, because you have worked hard since the morning till night. So recall is always not good. So don't blame me if I am putting some wrong recall. It is expected to happen. And that's why I always request my student to do NEET PG question also, 7 year, so that you can cover the real language can come from NEET exam, because it has only 1 session. Okay. Now let me discuss some of the question. The question was that some kind of maggot was present on an elderly patient, and after cleaning, where will you put the cotton swab? So this thing I am telling you after discussing it from surgeons also, and after taking the reference from biomedical, from BMW chapter of Park also, that if it is pyogenic waste, pyogenic liquid, then in the past, pyogenic liquid used to come in chlorinated yellow bag. That was the past thing. Only for pyogenic liquid in past, not now. Now the guidelines simply say don't use chlorinated bag. So we are only using non-chlorinated bag. So if it is maggot or anyone who is there, and still we are wiping it with cotton swab and then throwing it, definitely it has to go in non-chlorinated bag only. I also thought by applying common sense that it should go in chlorinated bag. But then I came to know through Park and through national guideline from our, because biomedical waste come under Forest and Environment Ministry. So they have this guideline that now chlorinated bag we don't use. We always use non-chlorinated only. So the answer was definitely non-chlorinated, no doubt about it. Then one more question was saying that, yes, very good. Telemanas aaya tha, yes, very good. Retrospective was there, yes, correct. Now, anything you want to change? Sir, won't cure TB patient come under susceptible population? Yes, if you are cured means the this thing, sputum smear has came negative. So if you are cured with TB, you can be susceptible for next round of infection. And that definitely correct for the TB cases, that you are cured, but still you can develop TB. So you are right, cured patients should also come under susceptible population. And Kaushika is saying that extended was not in the option of this this occupational health question. She is saying that extended was not in the option. This is not possible. Extended will be in the option, because I was just reading the PARC and it has clearly written it that if it is more than 20% burn, it comes under extended sickness. So definitely extended was in the option, but you have given the exam, you know it more correct. If it was not in the option and you agree, most of you agree, do let me know in the chat box. I will come back to you with more correct answer. Then, yes, so that is there. Questions were totally different. Yes, there were 2 questions about disasters. Do let me know what were those questions, and in the next session, which we will take within a week, I will try to explain those questions. So kindly, whatever question you think I am discussing wrong, feel free and directly WhatsApp me the question, and I will definitely find the correct answer through some reference book and then discuss it with proper reference. So if you have any question, anything which you want to say, do say me directly on my WhatsApp number, and I will try to come back with much better recall in just next 1 week. Okay. So thank you so much for this participation. Love you all, and don't take stress, because there is a lot of mistake which occur in recall. So don't take recall as exact thing. Okay. Thank you so much. Over to the anatomy, sir. Thank you.
Thank you. So hello students and good morning. So anatomy start karte hain and we'll finish off very fast. ठीक है? So most of the questions must be known to you by now. We'll start. So after parodectomy surgery, a patient complains of excessive sweating and redness over the parotid region. Clinical diagnosis. ये आपको पता है Fraze syndrome. ये हमने lectures में भी discuss किया है Fraze syndrome. There is sweating of the skin over the parotid gland. There is mixing of 2 nerves, the auriculotemporal nerve and the greater auricular nerve. जो auriculotemporal nerve parotid को supply करती है, the greater auricular nerve supplies the sweat gland. There's a mixing of fibers. So when a person salivates, the person starts to get sweating of the skin over the parotid gland. ठीक है? ये था Fraze syndrome. So आंसर था इसके लिए Fraze syndrome. Fine. दूसरा, ये सिमिलर स्लाइड होगा. इट मे नॉट बी द सेम स्लाइड बट सिमिलर स्लाइड होगा. ये क्या है? Obs paralysis, राइट? ये है Obs paralysis and which are the nerve roots affected. बच्चों ये भी हमने बहुत बार डिस्कस किया है. Nerve roots affected in Obs paralysis. बताइए कौन सा ट्रंक है? Which trunk of the brachial plexus is that? Upper trunk. And upper trunk is formed by C5, C6 nerve roots. Correct? So the nerve roots involved, आंसर क्या होगा इसका? C5, C6. Obs paralysis, upper trunk of the brachial plexus. ये आपको पता है, ये बहुत बार डिस्कस भी किया है. There's no second thought to it. So, which is this vein affected? बोलिए बच्चों, ये कौन सी vein है? This is the great saphenous vein, great saphenous vein. And this great saphenous vein drains into femoral vein. ये है varicosity of the great saphenous vein. So the vein affected in this picture shown is great saphenous vein. ये पता है, ये भी हमने डिस्कस किया है. स्ट्रेट फॉरवर्ड MCQs है, easy MCQs. Yes, identify the bone. ये मार्क था, ये जो bone है ये मार्क था. क्या लिखा है इसको? क्या लिखा है? ये bone. What is this? This is the navicular bone. Navicular bone, correct? So ये navicular bone है, the tarsal bone, one of the tarsal bones. So this is the navicular bone. Straightforward question था. There's no second thought to it. Correct ना? सबने तो लिखा ही होगा, सबने आंसर किया ही होगा. Yes बच्चों? ठीक है? The next one, ये picture था. What is this sign? हाँ, बताइए. That's the anterior drawer sign. Anterior drawer sign, the tibia is displaced anteriorly with respect to the femur. कौन सा ligament है ये? Which ligament is injured? यस, द एंटीरियर क्रूशिएट लिगामेंट, करेक्ट, ये भी बहुत इजी था. सो एंटीरियर क्रूशिएट लिगामेंट का इंजरी है, द टिबिया इज पुश्ड एक्सेसिवली फॉरवर्ड्स, दिस इज द एंटीरियर ड्रॉअर साइन, एंटीरियर ड्रॉअर साइन. ठीक है. अच्छा, ये एक पिक्चर था, मे नॉट बी द सेम पिक्चर, ये हमने एमसीक्यू बनाया है, बट ऑन द सिमिलर बेसिस. पर्सन वॉज कंप्लेनिंग ऑफ टिंगलिंग एंड नमनेस, 3.5 fingers, विच इज द नर्व अफेक्टेड. ये कौन सी नर्व है? व्हाट इज दिस नर्व? दैट्स अ मीडियन नर्व. सो एरो पॉइंट किया था मीडियन नर्व के पास, आई एम श्योर आपने आइडेंटिफाई किया ही होगा इसको, मीडियन नर्व. कार्पल टनल सिंड्रोम है ये, अफेक्शन ऑफ द मीडियन नर्व. Tingling and numbness over 3.5 fingers and 5 muscles of the thenar eminence are affected. ठीक है ना? सबने लिखा? Median nerve. Correct. हाँ, फिश बोन इन द पायरिफॉर्म फोसा, ये सवाल ऑलरेडी डिस्कस किया है. विच इज द नर्व इन द पायरिफॉर्म फोसा? दैट्स द इंटरनल लैरिंजियल नर्व. ये है सुपीरियर लैरिंजियल नर्व की ब्रांच, इंटरनल लैरिंजियल नर्व. दिस इंटरनल लैरिंजियल नर्व पियर्सेस द थायरोहायोइड मेम्ब्रेन, एंड फिर ये पायरिफॉर्म फोसा में आती है. अगर कोई बोन अटक गया पायरिफॉर्म फोसा में, तो विच इज द नर्व अफेक्टेड? दैट्स द इंटरनल लैरिंजियल ब्रांच ऑफ सुपीरियर लैरिंजियल नर्व. आई एम श्योर ये भी आपने आंसर किया ही होगा. तो एज फार एज एनाटॉमी इज कंसर्न, क्वेश्चंस वर वेरी स्ट्रेट फॉरवर्ड, easy to answer. Singer cannot raise the voice post thyroidectomy. Okay. So raising of voice, which is the muscle which helps to have a pitch of the voice. हम लोग जोर से चिल्लाते हैं, वो pitch of the voice, कौन सा मसल है ये? क्रिकोथायरॉइड, करेक्ट, क्रिकोथायरॉइड. एंड क्रिकोथायरॉइड को कौन सप्लाई करता है? एक्सटर्नल लैरिंजियल नर्व. दिस एक्सटर्नल लैरिंजियल नर्व accompanies an artery. कौन सी है ये आर्टरी? सुपीरियर थायरॉइड आर्टरी. सो सुपीरियर थायरॉइड आर्टरी लाइगेट करते समय द एक्सटर्नल लैरिंजियल नर्व may be damaged. The person complains of paralysis of cricothyroid, so loss of the pitch of the voice. ठीक है ना? क्रिकोथायरॉइड इज अ टेंसर ऑफ वोकल कॉर्ड्स, तो पिच ऑफ द वॉइस इज लॉस्ट. सो इसका आंसर होगा एक्सटर्नल लैरिंजियल नर्व, एक्सटर्नल लैरिंजियल नर्व. आई एम श्योर यू मस्ट हैव आंसर्ड दिस, ऑल ऑफ यू. ओके. which nerve fiber carries pressure sensations? तो इसका आंसर है अल्फा, ए बीटा फाइबर्स एंड ए डेल्टा फाइबर्स. आई थिंक दिस वाज द एमसीक्यू. आई एम नॉट श्योर अबाउट दिस. ओके, कोई एमसीक्यू ऐसे था, अ चाइल्ड विद क्ले कलर्ड स्टूल्स. हाँ, चाइल्ड विद क्ले कलर्ड स्टूल्स. द रीजन फॉर दैट, बिलियरी एट्रेसिया. अब यहाँ पे तो कमेंट्स दिख नहीं रहे. ओके, ठीक है. सो चाइल्ड विद क्ले कलर्ड स्टूल्स, बिलियरी एट्रेसिया. कोई एमसीक्यू था जिसमें फ्रैक्चर ऑफ मिड शाफ्ट ऑफ द ह्यूमरस था. यस, मिड शाफ्ट ऑफ द ह्यूमरस. वो कौन सी नर्व होती है? वो स्पाइरल ग्रूव के अंदर जब मिड शाफ्ट फ्रैक्चर होता है, सो विच नर्व इज अफेक्टेड? The radial nerve, radial nerve. I think this was an MCQ. I'm not sure about this. So mid shaft fracture nerve involved is radial nerve, radial nerve. ठीक है? Okay. ये एक सवाल था, नर्व इंजर्ड इन दिस इमेज. ये एक इमेज दिया था जिसमें फुट इज गॉन डाउन, ये है फुट ड्रॉप. द फुट इज इन्वर्टेड ऑल्सो. जब फुट इन्वर्टेड होता है मतलब लैटरल कंपार्टमेंट के लेग मसल्स आर पैरालाइज्ड. लैटरल कंपार्टमेंट में कौन से मसल्स थे बच्चे? कौन से मसल्स होते हैं? द पेरोनियस लॉन्गस एंड पेरोनियस ब्रेविस. उसका नर्व सप्लाई सुपरफिशियल पेरोनियल नर्व. अब foot drop, which is the nerve which supplies the anterior compartment muscles, that's the deep peroneal nerve. So deep peroneal nerve भी involved है, superficial peroneal nerve भी involved है. मतलब इसका आंसर क्या होगा? common peroneal nerve. common peroneal nerve injury, दो nerves involved होता है, superficial and deep peroneal. deep peroneal anterior compartment को supply करती है, तो foot drop हो जाता है. superficial peroneal lateral compartment, they do eversion, so eversion is lost, so the foot is inverted. So foot inverted होता है, foot drop हो जाता है. ठीक है? So this is injury to the common peroneal nerve. I'm sure you must have answered this. ये भी हमने बहुत बार डिस्कस किया है क्लासेस में. ये एक सवाल था, ये भी आपको पता ही होगा, इसोफेजियल कंस्ट्रिक्शन एट T4. हाँ, तो C6 पे क्या है? क्रिकोफेरेंशियल जंक्शन C6. T4 पे क्रॉसिंग ऑफ आर्च ऑफ एओर्टा. ठीक है ना? एओर्टिक आर्च का क्रॉसिंग है T4. T6 is crossing of the left bronchus and T10 is entry into the diaphragm. So esophageal constriction at T4 is due to arch of aorta. इसका आंसर होगा arch of aorta. ठीक है? तो ये थे questions as far as anatomy is concerned, and these were straightforward questions. I'm sure you must have answered it very well. Thank you to all of you. Thank you. Over to the next teacher, please.
Hi guys, hello. So of course, good morning since it's after 12 and what better to start the day with than with anatomy. So after that, I think I can, if I can. Hi guys. So of course we started the day with anatomy. It's after 12 a.m. So jaldi se we will try to start the session. And if I can quickly see the chat, and the way we are going to conduct the session is, if there is anything jo miss ho raha hai ya any options which you feel are not correct, so please let me know in the chat. And if I can see the chat, please. ठीक है. So microbiology में there were 13 pure micro questions, out of which I feel 9 were like direct one-liner direct questions, and other 9 are, other than the 13, the 9 questions were integrated with PSM, derma, pharma, ophthalmology. Majorly derma, most of the questions were overlapping with derma questions. So starting very quickly with the first question, this has just been taken by Ashwani sir also. That in which bag should soil cotton be disposed after cleaning maggots infestation? So even if they had not written maggots infestation, even if they had written soiled cotton, bloodstained cotton, any kind of cotton, we know that it has to go in the yellow bag. And the chlorinated and non-chlorinated debate has been settled by sir, of course, because now it is only the non-chlorinated bag which needs to be used, because it has been updated in the CPCB, the Central Pollution Control Board guidelines also. And also, if you use your common sense, ultimately all of this has to go to an incinerator, right? So in an incinerator at very high temperatures, if you will burn something which is carcinogenic or chlorinated, it can produce toxic fumes. So of course you will not put anything chlorinated in an incinerator. So you will not put red bag contents. You will also not put a yellow bag which is chlorinated. Yes. So this has more or less been sorted only. The next question was straightforward, pure micro question. Male after eating salad, even if salad was there or not in the question, there is some controversy. There was definitely milk and cheese in the question which was there. And of course, you had to look at the 3 hours timeline which has been given. So this has also been covered in our lectures, where we focused on the 1 to 6 hour diarrheas, which can either be Bacillus cereus or it can be because of Staph aureus, right? Zoom chat. Right? So that's the thing. So if it was Bacillus cereus, they would have given you the history of fried rice, right? They would have given the fried rice history to you if they were talking about Bacillus cereus. So only 2 organisms which will cause diarrheas within 6 hours. So of course the answer is Staphylococcus, and we had also discussed it during the FMGE marathon. Yes, as you can see. Now here, this is the question in which it was given HIV positive. So of course, you have to think of all the opportunistic infections. And very smartly, all the options that they have given were opportunistic infection options. So if any of the options you feel is wrong, then please let me know. And the CD4 count, I have come to believe, was also given to you. So if it was less than 60, please let me know. But then it became a very easy question because there was a crushed ping pong ball appearance term given to you. Please let me know if there was also the mention of treatment with Cotri. Please let me know if there was also a mention of treatment with Cotri. Okay. So, and if the image was also given, please let me know if the image was also provided in the question or not. There was salad. Okay, it does not matter if there was salad, because if they had given milk and cheese, then that was sufficient. No treatment. Okay, so I will remove that. Treatment was not given. Was the image given? Was the image given for the sake of accuracy? Yes, image was provided. So I believe that it was the same image that we have discussed so many times in the marathons, etc. This is the crushed ping pong ball appearance, which is shown by pneumocystis. So of course it is pneumocystis jirovecii, which is going to lead to PCP, which is an opportunistic AIDS defining illness. Yes. Quickly, we will move on. So I want to ask if this was a direct question. If had they given directly that Sporothrix Schenke's culture media, or they had asked something about the asteroid bodies, or did they mention the flower-like arrangement of flower-like conidia, which we have discussed
in the lectures as well as at the time of the FMG marathon? And what were the other options? So of course, if it is any fungal infection, it is going to be SDA, right? Any fungal infection it's going to be, or any fungal disease diagnosis, it is going to be sabrodextrozagar. So was there any other options given? My question is, was it a direct question? Or was it associated with any history? Was there any history, or was there any asteroid bodies that they talked about? Or was it direct? And if it was direct, was BHI with blood also an option? Okay, can I quickly get a response on my question? Was there also, so if, okay, till the time I get a response, if BHI with blood was also given as an option, then that would also have been correct. But I think it was quite straightforward that the answer was SDA. Okay, if you can find out, was it a direct question or there were more details given, or whether BHI with blood was given, then we will take it up when we do the detailed recall. Right. Next is HIV patient, again HIV positive with diarrhea. So size of organism on stool microscopy. So this also we have discussed at the time of when we did the FMG marathon, right? We had discussed the sizes, and I have come to believe that it was also mentioned in the question that 2 sporocysts are there. So that is how they have tried to confuse you in this question. They have mentioned 2 sporocysts. So you are going to think about both cyclospora and cystoisospora. And then the size that they have mentioned, 11 to 22 microns, it is overlapping. So if you look at the size of cyclospora, it is 8 to 10, and the size of cystoisospora is 20 to 30. You know, we always say just say 5 to 6, then double it and then double it, right? So since the upper limit is very large, since the upper limit of the size that they have given was 22, so it is definitely going to fall into the cystoisospora category. Was there an image given to you? Okay, so for the previous question, you are saying that one of the options was east. How can it be east? Dr. Gautam, you're saying that same image was given. So same image was given for, are you talking about sporothrix or are you talking about coccidian parasites? Right, okay. So for the sake of accuracy, I'm asking these questions to you. If you get to know, then please update us later. Mycelia cells at 37 degree, other option. Okay. No. Yeah, 2 sporocysts, this was given, definitely this was given, and that is how they have tried to confuse you. So since the other size that they've given 22, so it's definitely going to be cystoisospora, right? Okay, mycelia can never be present at 37 anyways. So this mold forms or the mycelial forms will be seen at 25 degrees Celsius always, right? This will be at 25 degrees. At 37, it will be the asteroid bodies or the yeast forms. Okay. Okay, till the time, if you guys can just report back with the correct options, then we will take it up in the proper recon. Right? Okay. So the next question was it, I have come to believe it was not a direct question, Candida cultured on. It was a diabetic patient with whitish plaques on oral cavity, and a KOH mount confirms BYC with pseudohyphae. So if they have given BYC with pseudohyphae, of course, they're talking about Candida. Then they have asked what is the most appropriate culture media. See, because they have given chocolate agar, Thayer Martin is definitely out of the question because that is for Neisseria gonorrhoeae. LSS is for diphtheria. So for diphtheria, you will have the membrane on the larynx or the uvula or the tonsils, right? The pseudomembrane, not the whitish coating. So it is definitely Candida. So was it Chrome agar or was it SD in the options? So if either of the two, any of the two was given, it was the correct answer. So while chrome agar is a better option for candida because it helps us differentiate between the different species, SDA is true for any fungal infection. So whether it is yeast or mold, any fungal infection, SDA is going to be there. Okay. Then they had chocolate agar used for. So my question is, had they mentioned the word gram negative in the question? Had they mentioned the word gram negative? Because if they had mentioned gram negative, then it would become very easy. So definitely it won't be E. coli because the GNBs grow preferably on McConkey agar, right? Not even Listeria. For that you have the Palcum agar. Strep pneumoniae can be grown on chocolate, but the answer that they were looking for was H. influenzae because it needs the factor X and V for its growth, which is provided by the hemolysis of RBCs. So it was a direct question. Yes. Hand, foot, mouth disease. I think this has been discussed in dermatology as well. So there is some confusion about the options which was given. Some of you have said that enterovirus was also mentioned in the question. So when we had read it in the lecture, we know that it is Coxsackie A16 or enterovirus 71. So if it was enterovirus and Coxsackie virus, both options given, then definitely the better answer will be Coxsackie virus. Okay, the better answer would be Coxsackie. So if enterovirus was not mentioned, then it becomes a straightforward question. Okay. Sudden onset high-grade fever, rash with retained tampon use. So this is very, very straightforward. Retained tampon use, we definitely know that this is toxic shock syndrome caused by Staph aureus. Staph aureus. Nothing else. We don't have to look at anything else in this the moment they are talking about retained tampon use. And if you know the fourth option, then please write the fourth option as well. So Zank smear, was the image of multinucleated giant cells given, or was the question what is the smear done for herpes simplex? So this is controversial. We don't know what was asked. Whether they had asked on Zank smear, they are seeing multinucleated giant cells. So what is the organism? Or had they asked what is the smear done for herpes simplex? Or had they asked what type of image will be seen on Zank smear for herpes simplex? So some of you are saying that yes, gram negative was mentioned. So if it was mentioned, then it becomes straightforward because H. influenzae is going to be pleomorphic GNB, right? Pleomorphic GNB it is going to be. BYC on KOH simply means budding yeast cells. Budding yeast cells, which is characteristically shown by the Candida species, right? Okay. So even if whatever the scenario be, we have to understand that Zank smear is done for herpes simplex and it will show the multinucleated giant cells on the Zank smear. Okay. If you can find out the other options, then please do let us know. Okay. So dentist with lesion on finger. So this is quite straightforward. Must have been discussed in derma also. So we had discussed in our lectures the herpetic vitiligo, which is caused by the herpes simplex 1. Because everything above the waist is herpes simplex 1 and herpes simplex 1 is transmitted by the oral secretions and the saliva. So the dentists, they are going to get exposed to the oral secretions and saliva of the patients. So they are going to get the herpetic vitiligo, right? So HSV1 is going to be your answer for this, straightforward. Herpes simplex 1. Some of you are saying HPV was also there in this question. In the hand, foot, mouth question. Okay. So till the time we get a confirmation, all of these questions will become more accurate at the time of the final recall. Right. Till the time, please do keep chipping in. So a 6-year-old, we move on to the next question. A 6-year-old presents with multiple small firm skin-colored papules on trunk and face. Each lesion is dome-shaped with central umbilication. I mean, they might have just as well told you the answer. So was HP bodies mentioned in the question or not? Please let me know. Of course, it's going to be molluscum contagiosum. Molluscum contagiosum with the dimpled or the umbilicated papules. Also already covered in derma. Only Q has, okay. Only question was Zank smear. Okay, fine. So you're saying that question had Zank smear only. Okay. Myonecrosis or gas gangrene. Please tell me if this was a direct question, because it becomes extremely simple. Some of you have said that there was a history of crepitations provided. Some of you have said that it is direct gas gangrene they had asked. And they had just simply tried to confuse you between the different species of Clostridium. Right? So one thing that I want you to note, that the new name for Clostridium difficile is the Clostridioides difficile. Right? So, but your answer here is of course going to be Clostridium perfringens, which causes gas gangrene. So even if there was a history of anything given, road traffic accident or whatever, and they had given you the crepitations, which is because of the gas produced by this organism, the answer is going to be Clostridium perfringens. It was a direct question. Okay, you are saying it was a direct question, so no history of crepitations was given. Okay, great. Okay. HPV most commonly causes which of the following head and neck cancers? This has been taken by ENT already. So you know that the answer is oropharyngeal cancer. We know that HPV has tropism for skin and mucous membrane. So wherever it will find the skin and mucous membrane, it would like to go. But they have asked most common. So the answer is oropharyngeal cancers. Now, this question you really have to help me with. RNA virus with... So was there an image of the virus given to you? Or the question was that an RNA virus which has neuraminidase and hemagglutinin? Or was the question that it does not have these two? Because when we had read in the lecture, we know that the the influenza virus has both hemagglutinin and neuraminidase separately on its envelope. And we know that amongst the paramyxoviridae family, we have also covered it in the lecture, that we would remember it with the mnemonic PMMRM. Yes, and then we knew which had the neuraminidase and hemagglutinin both, and we know that measles is measless, and इसमें क्या नहीं है, ना नहीं है, and हाँ है. Right? Measles virus में हाँ है, ना नहीं है. That is what we had read. So it was HA positive and NA. So were they asking both negative? If they were asking both negative, the answer will be HSV. RSV. The answer will be respiratory syncytial virus, RSV. So had they given an image of the virus, or they had asked simply about the presence or absence of the proteins? Because if they had asked for the presence, then all the three options have both. This is the only one which does not have either. So was it an image-based question? Was it a direct question? What was it? Please do let us know. Just know from this table now that neuraminidase and hemagglutinin is both going to be present in all of these options that they have given. And in RSV, neuraminidase and hemagglutinin both are going to be absent. And please let me know if an image of the virus was provided or not. Okay, NA is absent in PIC. Okay. So whenever you guys can recall, maybe fresh in the morning, please let us know, so that we can give the most accurate final recall to you. Okay, great. Can we move on? So this was very simple. This is also crossing over with ophthal. The contact, so you had the history of a contact lens misuser, and we know that only two organisms, Pseudomonas and Acanthamoeba, are going to be responsible for contact lens misuser keratitis. They had given the option of a beach vacation, so you know that they're related to a water body. So Acanthamoeba was supposed to be your best answer because it's a free living amoeba which is present in water bodies, right? Was Pseudomonas mentioned in the options? That is the catch. Was Pseudomonas mentioned? No, it was not mentioned. So it becomes clear cut. It becomes clear cut Acanthamoeba. Okay. So now this question is also controversial. They had given, was it pneumonia or diarrhea, or was it after exposure to cattle parturition products or unpasteurized milk? What was the question asked? Anyways, in either of the scenarios, the answer is going to be Coxiella burnetii, because we had read that it causes the Q fever and there is going to be no rash. And the rest, all three options that they had given were the rash causing, the fever plus rash bacteria, right? The rickettsial group and the scrub typhus, they are all going to be the fever with rash kind of a group. And Coxiella burnetii, we know that you can either get it by ingestion of unpasteurized milk, or it is also seen, it can also, the spores can, it can also be inhaled from the dead and decaying cattle. Okay, so it could be the parturition cattle products. Another option for acquiring an infection from that could be Brucella abortus, but I think that was not mentioned in the question at all. So even if it was pneumonia after exposure to cattle parturition, or even if the question was diarrhea after unpasteurized milk, in any scenario, the answer is going to be Coxiella burnetii. So for the sake of accuracy, please let us know what was asked. Then we had a patient with fever returning from a forest trip. So usually it is the scrubby vegetations and black eschar. So quite obvious they are talking about the scrub typhus, right? The scrub typhus, which is by the bite of the chigger, right? Also called as chiggerosis. Chiggerosis. So this is borrowed from pharma. Correct answer is doxycycline. So for all of these, the drug of choice is going to be doxycycline. Just remember that since black eschar they have asked, and they've given the option of forest strip, so they were talking about strep typhus. Now this is a direct NEET PYQ, which I have also discussed like in the NEET PYQ session that I had taken. So traveler going from Nigeria to USA. So this, they're talking about Africa, obviously. And this Africa question was asked in a NEET PG exam. So of course, they're talking about yellow fever. So it's going to be 17D vaccine for yellow fever, right? Straightforward. Now this is also controversial. They were talking about borderline tuberculoid leprosy. So had they asked which type of hypersensitivity or which type of lepra reaction? Because in borderline tuberculoid leprosy, we know that there is the reversal of tuberculoid leprosy, right? The reversal of tuberculoid leprosy is seen in lepra reaction type 1, which is a type of type 4 hypersensitivity reaction. If you remember, we had discussed in the lecture that there is a reversal of the tuberculoid leprosy in lepra reaction 1, which is a type of type 4 hypersensitivity. So it depends. If they had asked lepra reaction, it's going to be type 1. If they had asked hypersensitivity reaction, it's going to be type 4. What was asked? So I'm getting mixed answers. So it depends on how the question was framed. There could be two answers. Okay, it was just borderline leprosy. It is also correct if it was just borderline leprosy. But then both the type of lepra reactions can be seen there. So they must have definitely mentioned the type of borderline leprosy. Okay. Earliest antibody to rise. I mean, this is the easiest question one could ever ask. Of course, it's going to be IgM. We know this always. Now, this asking questions on antibodies is very common, very common. Be it INI, be it NEET PG, be it FMG, this one question definitely comes from antibodies. So, earliest to rise is IgM. There is no doubt there. Was this question asked? Retroorbital pain and body aches. Was this question asked? It is kind of direct. If this was asked, then of course, dengue fever, hemorrhagic something. Hemorrhagic. Okay. Okay, so can you recall some keywords? Fever, hemorrhagic fever was mentioned. Okay. You have said that hemorrhagic fever was mentioned. Long history. Abdominal pain with bloody vomiting, arthralgia, hemorrhagic dengue. Dengue hemorrhagic fever. So you have said that there was something to do with the dengue hemorrhagic fever. And the answer was dengue. Antibody dependent enhancement. Okay, you have said that ADCC was asked. Chikungunya was there in the option. Hepatomegaly was also given. Okay. Okay. Hepatomegaly. Right. So if it was retroorbital pain, body aches, hemorrhagic fevers, and they had mentioned directly about ADCC. Yes, answer is dengue. But what was the question? Positive tourniquet test. So we will have to confirm. Okay. So we will have to confirm. But in any scenario, any case, retroorbital pain was also mentioned, you're saying. In any case, dengue fever is going to be one of the options, is the correct answer. Right. Okay. So that was, we had to wrap up quickly because it's very, very late. So even though micro had a whole lot of questions, we have very, very quickly gone through them because almost most of the questions were direct questions. So all of the questions that I have left for you guys, please get back to us with those so that we may come back with the correct recall. Okay, thank you so much, guys. So sleep well. Over to Vineet, sir. Bye-bye.
Hello, guys. We'll be discussing anesthesia. So shall we go ahead? Yes, guys, am I visibly and audible? Okay, so let me start. Okay, I got a yes from Dr. Gautam Raj. Let me finish off anesthesia questions as fast as I can. So from anesthesia, what I could see were almost about 7 to 8 questions, and they were all overlapping with other branches. The two things that I made out of this was that the questions were all based on concepts, and they were all integrated questions. And without wasting any more time, let me discuss the anesthesia part of it. This was the first question. If you guys can correct me wherever you want, I have not got the correct things in all the questions, so please help me out also, and we'll try to finish off fast. This is the first one. Identify the monitor. In this case, the image was given of the capnography. So it was very simple questions. Questions from anesthesia were very simple. You just had to go through anesthesia once, and you would have given correct answers. So this was the first one. The correct answer is capnography. Everyone knows this is a graph of carbon dioxide being exhaled or expired. Okay, this was the first one. Other options, if there are any changes, I think other options can be something else, but everyone knew the answer was capnography. People are very sure about it, right? The next question. This again, all these questions we have discussed, guys. Capnography is a whole topic that we discuss. The next question also has been discussed in every exam, every recall that we take, in every, every Dr. Gautam Raj says capnography, yes. In whatever we have taken, whether it's on YouTube or lectures, neuromuscular monitor, always we've discussed this, and this is directly a PYQ of NEET PG, right? The image shows a neuromuscular monitoring, and which is the most common nerve used. You can see it, it's the ulnar nerve. So the correct answer here is ulnar nerve. This was the second question, a PYQ from NEET PG. These two questions, very simple ones. You don't even have to waste time on that. The third question, now here there were some students who said that, sir, we got an image of endotracheal tube, and some students said we got an image of tracheostomy. However, both the set of students said that the question asked was the same, that is, what is the function of the marked part in the image, and the marked part was a cuff. And all the students did say that the function, one of the options given was to prevent aspiration. So whether it was the tracheostomy tube or it was the endotracheal tube, if they have given the option of the cuff, if they have marked the cuff, of course, the function of the cuff is to prevent aspiration. That's the whole point of putting an endotracheal tube or putting a tracheostomy tube. So everyone got this answer correct, right? Dr. Gautam Raj says tracheostomy image. Okay, so Dr. Gautam Raj says tracheostomy image. So from options given, forget now, endotracheal tube was not there. The students who said tracheostomy image, so we are going with tracheostomy image, right? Only tracheostomy says Dr. Saif Ali Khan. Okay, Dr. Saif Ali Khan, thank you. So 3 questions done. They were all simple questions. You did not even have to study the depth of anesthesia to get these right. Okay, they were superficial questions. And as I said, integrated with other branches also. Now, a next question which we discuss always, and I say this is one of the most important question which comes in the exam, and that is regarding malignant hyperthermia. Last year, they had, out of the local anesthesia topics, last year in NEET PG, they had asked about EMLA cream, they had asked intravenous regional anesthesia. But for quite some time, they had not asked direct questions about malignant hyperthermia. And I think this was a question in FMGE. If you can answer me correctly, there was one question on this malignant hyperthermia. Maybe the clinical scenario that I mentioned is not correct because the students were not able to recall as it a proper clinical question. They did say it was a clinical question where they mentioned about few things. The question had mentioned about RYR gene. The question had mentioned about malignant hyperthermia, and it had mentioned about the calcium release from various channels. So we have always studied that this RYR gene, so malignant hyperthermia, is a genetic disorder of sarcoplasmic reticulum, which has a ryanodine receptor gene abnormality, and ryanodine receptor is nothing but a calcium release channel. So therefore the answer is calcium channel. Okay. Correct, guys. So from whatever you guys have said, calcium says Dr. Rohan, right? So I think it was an easy question again, but you had to remember malignant hyperthermia. Problem is when this comes as a clinical question, you tend to forget which branch it has come from or where have you studied this. So malignant hyperthermia, you've studied in anesthesia in detail. You must have studied this. And this is the first thing that we discuss about it. It's a calcium channel abnormality, calcium release channel. So this was the third question, the fourth one, right? And all these were very, very simple, whether it was capnography, neuromuscular monitor, endotracheal tube, tracheostomy tube, and this RYR gene. Now, this was a tricky question. Here, I think options, you will have to correct me if I am wrong. I got this sentence from the students. They think that the point question was not eligible for a daycare surgery. Initially, they had told me options like ASA1, ASA2, ASA3, and ASA4, which made it simple. But then other students gave me option that there were other options given, which was clinical scenarios. And the clinical scenarios was patient without an attendant at home. Patient's home is 1 hour from the hospital or distance from the hospital. Patient being ASA grade 1 and patient undergone a general anesthesia for more than 1 hour, right? It was grade 3 in option says Dr. Rohan, ASA grade 3, right? So that's what I was saying. A lot of students did tell me ASA grade 1, ASA grade 2, ASA grade 3, right? And there was Dr. Gautam Raj says these are correct options. Dr. Saif, which are correct options? ASA 1, 2, 3 or patient without attendant, home from 1 hour, ASA 1. So the point is, see, there are two things. Out of the 4 options which we have, if a patient is without an attendant at home, in that case, this becomes the answer, because if someone is not having attendant at home, then how can you go for a daycare surgery, right? Daycare means you're going to go home the same day, right? 1 hour from the hospital is not a problem. You need to have a good proper attendant to take you home. ASA grade 1 can undergo, because remember normally it's ASA grade 1 and 2 that undergo daycare surgery. Sir, only third option was ASA 3. Dr. Jawad says patient underwent surgery for more than 1 hour. Acha. All mentioned here. Acha. Patient undergone surgery for more than 1 hour. Okay, instead of ASA grade 1, you are saying that was ASA grade 3, right? This is the correction that I have to make. Okay, this is the correction. So I think you have said this is ASA grade 3. Am I right, everyone? But daycare are for 1 hour normally. So what if the option is ASA grade 3? Okay, guys. So normally remember, normally without an attendant, out of the two options, if someone will ask me, so whenever we teach, now this is a confusing thing because normally it is ASA 1 and ASA 2. These two are the class of patients that undergo daycare surgery generally. ASA 1 and ASA 2. Because ASA 3, guys, remember, is always uncontrolled, right? It is not a mild systemic disease. It becomes a severe systemic disease. So ideally, a severe systemic disease also does not go daycare. But if you have to think about it, if there is someone who's undergoing a cataract surgery or something like that, so that also becomes kinds of a daycare surgery, right? A diagnostic procedure is also daycare surgery. So in that case, if you will ask me out of the two options, if it is given without an attendant and ASA grade 3, right? Dr. Guisolo says history was cholecystectomy. Okay. So patient not eligible for daycare surgery and the surgery undergone was cholecystectomy. So guys, in that case, यार दोनों ही options में ना, both the options are actually okay. You will not want to take an uncontrolled patient for surgery straight away, but still, even if it is ASA grade 3 given, guys, I will go for a patient without an attendant for the simple reason that they have said that it is a daycare surgery. In a daycare surgery, you can't go home without an attendant, right? You can't go without an attendant. According to me, that is the point, right? Even for cholecystectomy, normally it is ASA 1 and 2 that undergo daycare. But if you guys, all of you are saying, I was thinking it is ASA 1. So फिर तो आंसर बहुत easy था. Had it been ASA 1, it was very simple that the answer was option A. But you have mentioned ASA grade 3. In that case, ASA grade 3 is a severe systemic disease, right? Which is sort of uncontrolled. And in that case, ideally, even that should not undergo a daycare procedure, right? दोनों ही नहीं होना चाहिए. But if you will see, practically speaking, without any attendant, you will not going to get any surgery done. If a patient is not having attendant at home or patient not able to accompany an attendant, तो उसके बाद you never undergo a daycare procedure. That is the point. You always have to have an attendant. Even if you think practically, यार, someone is undergoing cataract, तुम खुद सोचो ना, you must have seen some, some distant neighbor of yours, someone undergoing a cataract surgery. You will find someone is always accompanying the patient and taking the patient back home. So without an attendant, it is still not possible. So even if the answer is ASA 3, I will try to go for ASA 2. For option A without an attendant. Patient drive 45 minutes from hospital. अच्छा एक और option मिल गया. Patient's home नहीं. Good यार. You guys, even at night, hats off to you people. You people are sitting since evening, and I know, touch wood. मतलब seriously, you guys still remember all these options, right? Patient drive 45 minutes from hospital. So patient's drive means home drive is 45 minutes from hospital. तो ये ठीक हो गया. Patient without an attendant at home. Patient's house is at drive of 45 minutes from hospital. तो ये भी कट हो गया. Patient is ASA grade 3 and patient undergone general anesthesia for more than 1 hour. Answer is cholecystectomy. So in that case, the ideal answer not eligible for daycare is without an attendant. ठीक है? या तो ऐसा भी हो सकता है. Which of the following is eligible? Are you sure it was not eligible? In case if the question becomes that patient is, which of the following is eligible for daycare surgery, right? तो उसमें से सिर्फ यही आंसर एलिजिबल होगा. Patients drive 45, because in that case patient undergone more than 1 hour, again question mark, right? Patient ASA grade 3, again question mark. Patient without attendant, again question mark. तो क्वेश्चन अगर आ गया eligible for daycare surgery, तो ऑप्शन B हो जाएगा. अच्छा, डॉक्टर रोहन says not eligible था, तो let's stick with our option. Let's not change it. Correct. Let's not change. Done. So we will go. But कोई और ऑप्शन रहेगा तो मुझे बता देना. बट मेरे हिसाब से विदाउट एन अटेंडेंट होगा. दैट्स टू बेस्ट ऑफ माय नॉलेज. नो वन कैन से दैट वी हैव कंप्लीट नॉलेज, बट फ्रॉम द बेस्ट नॉलेज दैट आई हैव फ्रॉम माय पॉइंट ऑफ व्यू, इट शुड बी ऑप्शन ए. ठीक है, कुछ और पॉइंट्स होगा तो डू लेट अस नो, एंड देन इन दैट केस वी विल चेंज इट फर्दर. बट गुड, you guys have recorded it correctly. Thank you so much for helping me out with this one. Okay, the next question, I think this also has been taken up by Dr. Siraj sir, and opioid antagonist I think was a question, and the simple thing is naloxone, right? Everyone knows the answer is naloxone. Okay, we always say about flumazenil and naloxone every second year. One of the question comes, and this time they ask opioid antagonist. And me being from anesthesia, we teach opioids in anesthesia also. So naloxone also was a question according to me, right? But that's the only essay question they asked, says Dr. Slayer. हाँ वही question था, right? Right. But do let me know, guys. Put it in the comment box. I'll not waste more time. Let me go forward. Right. So there's another two questions that I have. One was this. I don't know whether again it's correct or not. A patient was tried to intubate in emergency, but resulted in failed intubation and ventilation. And the point was next appropriate step. Means someone was trying to intubate in emergency, but could not intubate, could not ventilate. Failed intubation and ventilation means this is what we study in the difficult airway pathway. So do you want to re-intubate again? No, because you were unable to do so. Tracheostomy is going to take time. The correct answer is cricothyroidotomy if this was given, right? If this was an answer. So this was another question that we got, and I don't know the fourth option which was given. But in case the patient is in emergency, you are trying to intubate, but your intubation has failed and we were unable to ventilate, the next step is straight away cricothyroidotomy, right? Fourth option is nasal airway. Very nice, guys. You guys still remember so much. Wonderful. Don't worry, all of you will pass. All of you will clear. It means your concepts are clear. If you could remember it so well till now, don't worry, all of you will clear. Very nice. They said in question they mentioned less than 1 hour. Previous question, less than 1 hour. For surgery mode, less than 1 hour. Okay. Good. This is correction by Dr. Soumyaranjan Panda. Correct? They said full oxygen flow, but not appropriate for patient. Full oxygen flow. ये कौन सा point है? Full oxygen flow. मतलब इसी question है. Patient resulted in failed intubation and ventilation in spite of full oxygen flow. Am I right? But not appropriate for patient. But not appropriate for patient. Correct ना guys? ये तो हम लोग हमेशा discuss करते हैं ना? You will find always this point has been discussed by all of us, right? Just give me 2 seconds more and I'm done. I don't want to waste more time. So guys, simple point है, अगर patient को emergency में intubate नहीं कर पा रहे हो, ventilate नहीं कर पा रहे हो, you're going to do cricothyroidotomy, and you said the option was given emergency, right? So emergency cricothyroidotomy is the correct answer. All right. According to me, again, according to me, depends as to what the situation was. If this is the question, in that case, this is going to be the answer, cricothyroidotomy, right? They said flow is seen, but patient is not showing some relief. Dr. Slayer, in spite of full oxygen flow is seen, but patient shows no relief. But patient shows. Guys, I think हो सकता है ना पूरा clinical question हमको नहीं मिला है. So let's wait. We'll just find out the complete question and then we'll come back. But from whatever we have the point right now, the focus was on failed intubation and ventilation. If that word failed ventilation and intubation has been mentioned, if this has not been mentioned, then it's a different thing, guys. Remember, if failed intubation and ventilation is not given, फिर तो question change हो जाता है. But if they have mentioned failed intubation and ventilation, which was told to be by most of the students, if they mentioned that, then the answer is cricothyroidotomy. Okay. Emergency was not mentioned. लेकिन फेल इंटूबेशन मेंशन था क्या गाइस? अगर फेल इंटूबेशन मेंशन था तो आंसर क्रिकोथायरॉइडोटोमी. ठीक है, अगर फेल इंटूबेशन वेंटिलेशन है तो आंसर क्रिकोथायरॉइडोटोमी है. सिंपल. ओपियोइड एंटागोनिस्ट क्वेश्चन, नैल्ट्रेक्सोन वाज आल्सो देयर इन द ऑप्शन. अरे गुड यार, नैल्ट्रेक्सोन. हाँ, तो वो भी ओपियोइड एंटागोनिस्ट है. करेक्ट, नैल्ट्रेक्सोन. तो इसके साथ और भी कुछ लिखा था, नैल्ट्रेक्सोन. मेरा पूरे क्वेश्चंस तुम लोग ने हेल्प किए मुझे. थैंक यू सो मच. नैल्ट्रेक्सोन, ये कहाँ गया नैल्ट्रेक्सोन? ओके, ठीक है, नैल्ट्रेक्सोन भी मेंशन था. बट एनीवेज, यू नो व्हाट, द मोस्ट कॉमन यूज इज नैलोक्सोन. ठीक है, ऑल ऑफ यू ऑलरेडी नो दैट द मोस्ट कॉमन यूज इज नैलोक्सोन, right? So you will go with the answer unless until it is said which of the following is not opioid antagonist, or they must have given naloxone, naltrexone and nalmefene. अगर ये दिया होगा और लिखा होगा which of the following is not opioid antagonist, तो आंसर तो चौथा ऑप्शन बन जाएगा. The fourth one will be of the option, right? But otherwise naloxone is the most common used. ठीक है, let me see the next one. Intubation failed in 20 minutes and then something like it. Failed intubation was mentioned. Guys, please, अगर failed intubation mentioned था ना, तो उसके बाद पेशेंट को सेव करने का सिंपल तरीका, if you have a failed intubation, you are supposed to save the life. You are not trying to re-intubate straight away. Cricothyroidotomy is the answer. Let's stick to that, okay, from whatever you people have said. Done. One more question. narrowest part of the adult airway. Again, we teach it when we are teaching intubation, right? Narrowest, we teach the narrowest part of the pediatric airway and we teach the narrowest part of adult airway. So normally the narrowest part of adult airway is always the glottic opening, because subglottic is what we say is for the pediatric patients, because pediatric airway is always cone shape or funnel shape and adult airway is always cylindrical in shape. So this we always teach, that the narrowest part of adult airway is always the glottic opening or the glottis, and for a pediatric patient it is the subglottic. ठीक है? Failed intubation mentioned था, glottis. ठीक है guys, all of you marked correct answers. Let me think. और ठीक है, so these were 8 questions already, which I got from anesthesia. ठीक है, कितने हो गए? 1 2 3 4 5 6 7 and 8, right? So these 8 questions are correct. और एक और किसी ने बोला था, was there a question on cannula? I'm not sure. A 9th one, but question mark. Otherwise, we got 8 questions overlapping with anesthesia and other branches as well, but 8 questions from anesthesia. Right? Was there a question on cannula? Anyone? Otherwise, we'll end the session and let Dr. Sandeep take over. Okay, everyone got confused with supraglottic. Boss, supraglottic is always a laryngeal mask airway outside the glottis. यार हमेशा बोलते हैं हम लोग supraglottic airway. Whenever we say supraglottic, it is outside the glottis. Supra मतलब उसके ऊपर. Supraglottic मतलब outside the glottis. So that is what is a laryngeal mask airway. Glottic मतलब glottis हो गया, तो narrowest portion is glottis. ठीक है? Question about cuff was there. Dr. Slayer, cuff वाला include कर लिया ना? ये देखो, cuff वाला आ गया ना ये. I've discussed that to prevent aspiration. Dr. Rohan says best test for kidney percussion. वो beyond my limit हो जाएगा यार. Not my branch. ठीक है, अब सब ब्रांच का मैं ले लूंगा, सब लोग मेरे को मारेंगे. Everyone will hit me now. Okay, I'm going to take question from all the branches now. ठीक है, inspiration noise was there, says Dr. Udyuman. Inspiration noise किसमें था? Strider. अच्छा, narrowest part of the adult airway and strider. Was it after surgery? इस वाले क्वेश्चन में strider. अच्छा, इसी में कफ भी था क्या? चलो ठीक है guys, what do one thing, put up in the comment box. I'm giving you my Insta ID also. My Insta ID is dr.vinish. You can connect to me directly. You can message me directly on that. Okay, dr.vinish, because Dr. Sandeep is also waiting. It's getting quite late. Let him continue then. Okay. Inspiration noise was there. Perfusion. Blue cannula coagulant. Blue cannula coagulant. Dr. Udman says that's why I marked supraglottic. अच्छा, oh, that's why. Strider था, इसलिए he said he marked supraglottic. अच्छा, so that would change the question, doctor. You're right. Patient was admitted and was intubated for weeks. His SpO2 was falling. Something like that was the question, says Dr. Pramila Lama. Wait, so in that case, patient was admitted and he was intubated for weeks. तो अगर intubated for weeks होगा तो okay, let's understand. अगर patient को stridor है and intubated for week होगा तो क्या हो जाएगा? Let's think about that ना. Endotracheal tube डला है, इसमें cuff डला है. Because of the cuff, there's going to be a inflammation over here, and once the patient gets extubated, there's going to be fibrosis. और अगर fibrosis होगा तो आंसर subglottic होना चाहिए. That stenosis is going to be a there is a tracheal stenosis, a complication of intubation that we say, right? But is the question asked that way? Is the question asked in such a way that you're talking about tracheal stenosis? अगर वो tracheal stenosis के बारे में question है, then the answer would become subglottic. But if it is not about the tracheal stenosis, and if they've just asked the narrowest part of the airway, then it becomes glottis. Is that okay, guys? ठीक है, मेरे हिसाब से these are the two options. If they have asked that it is about tracheal stenosis, if the question is about long-term intubation, its complications, which is tracheal stenosis, the trachea gets stenosed from within, तो आंसर subglottic होगा, because उसमें नीचे से narrowing हो रहा है. This is what is called tracheal stenosis, right? So if there is tracheal stenosis, answer is subglottic. Otherwise, the answer is glottis, according to me, right? I'm not always correct, but this is the thing that I think. The last one, if there's something about the green colored cannula, let me know. Otherwise, let Dr. Sandeep take over. Guys, thank you so much for joining us at this session. All of you have contributed so much to us to find out the recall questions as well. All the best, and I know all of you will clear. You've done well with the amount of questions that you could recall. I think most of you are going to clear. Don't worry about it. Be confident. Be just confident. I think Dr. Sandeep should take over. Thank you, guys. Thank you so much. Okay. Take care. All the best.
Hi, guys. Thank you, Vinisha. Thank you so much. So I'll be taking up from here. Right. So surgery ka session was, I think, okay. I mean, I would say not bad. because when you go back and see the whole component of it, just अगर आप मोटा मोटा देखोगे, we did a small series on YouTube, right? And this was about our marathon series that we ran. ठीक है, तो all the questions from surgery, precisely exactly how it existed in the exam, was from this video. If you have missed out it, it's like I would highly recommend it before the exam. But okay, anyhow, ठीक है, तो अभी जो रिकॉल है ना, मोटा मोटा हम जल्दी जल्दी देख लेते हैं. Will not try to put you so much across it. Just give me a second. Chat box. Hi guys. Yeah, sorry, I was not able to access the chat box. तो थोड़ा सा उसमें glitch है. Fine. Yeah, I know surgery was lengthy, but every single point and every single topic that we have discussed was from here. I'll go with a quick recomponent and recall. There was a question that was asked on the breast cancer. I think the image was given something like this, where you had the indrawing of the skin. And when we all know when there's an indrawing of the skin, what is that called as? Okay? And that is what we call it as the dimpling of the skin. And why is there a dimpling of the skin? We have been speaking, I mean, like multiple times I've spoken about it. The dimpling of the skin is going to occur because of involvement of Cooper's ligament. Okay? So here the answer is going to be, yeah, so which ligament? The answer is Cooper's ligament. Same thing we have already discussed in our, if you see the recall series also, I've explained about TNM, I've told you about what is T4A, what is T4B, what is T4C, what is T4D, and I've given reasons for each one of them. Just make a note of it, you can go and look at the recall again. Okay? Question number 2. Now this, I've been screaming on top of my voice ki agar liver resection aega, to liver resection mein they will ask you about the terminologies. They've asked you in the left lobe of the liver, if you're doing a left hemilobectomy, ठीक है, तो left side में कौन कौन सा जाएगा, यहाँ पे देख लो 2, 3, 4A and 4B, and this is what we explained it. So answer here is going to be 2, 3, 4 and 4A and 4B. So here the answer is going to be B for Bombay. That is going to be 2, 3, 4. Correct? ठीक है? Nothing spectacular about it. Absolutely. Then we had a question, this one. Which of the following is the correct sequence of the damage control surgery? Again, same, ditto to ditto. This is the screenshot from our series. I've just taken across here. Stage 1 is patient selection. Stage 2 is primary exploration. Stage 3 is ICU care. Stage 4 is secondary exploration. Stage 4 is a definitive abdominal closure. So you can see the answer is going to be 1, 4, 2 and 3, which is in the same sequence. I've given you across here. ठीक है? ठीक है? चलो. Say left side hemi hepatectomy or hemilobectomy is the same beta. Okay, next is your the type of ulcer which is shown here. Again, same. We had from our series only, which was done marathon. You have given you the ulcers image. I've explained you. Gator's area mein hai. It is going to be pale, scanty, unhealthy granulation tissue. There will be sloping edge. There will be shallow ulcer. All these points towards your venous ulcers. So answer here is going to be B for Bombay. Again, nothing spectacular about it. ठीक है. फिर आई बारी इसकी. ठीक है. Again, same. ऐसा इमेज दिया हुआ था, बोला था कि कौन सा, व्हाट इज द डायग्नोसिस. आई थिंक डायग्नोसिस एवरीबॉडी नोज इट इज वैरिकोज वेन. अगर मीडियल एस्पेक्ट ऑफ द लोअर लिम्ब में इन्वॉल्वड है, वी ऑलरेडी टोल्ड यू इन आवर सीरीज आल्सो दैट इट इज गोइंग टू बी व्हाट, इट इज गोइंग टू बी इन्वॉल्वमेंट ऑफ ग्रेट सफनेस वेन. ठीक है, मीडियल पे ग्रेट सफनेस वेन है, लैटरल पे शॉर्ट सफनेस वेन है. परफोरेटर इनकॉम्पिटेंसीज में यू हैव टू नोटिफाई विद द एग्जैक्ट साइट ऑफ इट. सो आंसर हियर इज गोइंग टू बी एट द ग्रेट सफनेस वेन. यही सवाल था. ठीक है, एज इट इज सी. ठीक है, Again in the predictor series I told you ऐसा कोई एग्जाम ही नहीं है आपका जहां पे you will not have a question from varicose vein. They love varicose vein, पता नहीं क्यों. They love seep classification, they love varicose vein. Every single exam they have one question which pops up from the varicose vein. This is question number 5. Question number 6. Again, a suturing technique. Every single time I take a lecture, I tell you that suturing is also very, very important. There are various techniques we have already discussed. This is the screenshot from our regular marathon series that we took. And you see, I've explained you everything. Is it a simple continuous? Is it a simple interrupted? Is it a vertical mattress, horizontal mattress, or a subcuticular? Okay. Now, I want you to tell me that what image did you see in the exam? Is it 1, 2, 3, 4, or 5? Quick feedback. कौन सा image देखने को मिला था आपको exam में? Which image did you see? ऐसा कौन सा image देखा था? जिस इसमें देख के बता दो. Was it this one? 2, 2, 2, 2. So answer is going to be 2, 2, 2, 2, 2. That is your simple इंटरप्टेड, ठीक है, इट इज अ सिंपल इंटरप्टेड, ठीक है, एब्सोल्युटली करेक्ट। बेटा मैट्रेस के लिए ना, इन ऑर्डर टू हैव मैट्रेस यू नीड टू हैव 2 pricks ऑन वन साइड, 2 ऑन दी अदर साइड। अगर सिंगल लूप है, अगर ऐसा बना हुआ है तो मैट्रेस है, ठीक है, अगर नहीं है तो सिंपल इंटरप्टेड है, एक डॉट यहां पे, एक डॉट यहां पे, एक डॉट यहां पे, एक डॉट यहां पे, ठीक है। आई टेल यू इन एवरी सिंगल क्लास, डू नॉट फॉरगेट अबाउट इट, एब्सोल्युटली स्पॉट ऑन, ठीक है। सो दिस इज अबाउट योर, if it is going to be image number 2, then the answer is going to be simple interrupted. It is not going to be C, it is going to be D, right? So I gotten the image wrong from the student, so I think this is the answer which is going to be correct. Absolutely beta, okay. Question number 7, again repeat exam question we've been asking you. I have a 2 years old child with a scrotal swelling since birth, okay. It's a congenital hernia that you have, okay. Now painful, red, irreducible, then it is going to be what? It cannot be hydrocele, it cannot be, see for a torsion testis since birth it cannot have it. Orchitis, again unlikely since birth, so it is going to be a strangulated hernia. It is A for Ahmedabad, I've already spoken about it. But if a torsion testis, if a torsion testis is there, it has to be sudden, you cannot have swelling since birth, okay, so that's not acceptable. Question number 8, chylomlymphatic cyst, okay, what is the treatment? Again same screenshot from our marathon series. I told you very specifically that you have to remember that. See, I've said 3 important ones: Meckel's, Macular's, Bouchard's and Trillox. I told you about these important triads. All 3 will be asked in your exam. Trillox is about your mesenteric cyst, and I told you it is enucleation of the cyst is the surgery of choice. Okay. Okay, for the torsion testis question, I would require a little bit more input, but let's keep it to that component. Since birth agar mentioned hai, correct beta, it is enucleation. It is only enucleation. There is no need to resect the adjacent bowel. There is no need to resect the adjacent bowel. It is only enucleation. It arises from the mesentery. It is a mesenteric cyst. Okay? Answer is going to be A for Ahmedabad. Then this was my favorite question. Agar aap jaoge video mein again, you will find it. I have asked you 4 scenarios in which they can ask you question. Same to same ditto question. It is about post-cholecystectomy pain. Post-cholecystectomy pain mein kaise manage karoge? I have given you everything. Patient has to undergo ultrasound with LFT. USG mein significant fluid collection hai, the next kya karoge? USG guided aspiration. And hence the answer is USG guided aspiration. No rocket science. Every single thing we have already discussed it. Okay? All that? Chalo. That's a question number 9. Question number 10. You have a patient who is going to have GERD in the second and the nodule in the second part of the duodenum. Which hormone is to measure? Okay. Now you need to know very simply GERD kyun hoga when there is reflux of acid. Acid kab banega? When you have gastrin producing tumors, that is you're having gastrinoma. Right? We have already discussed this also in the neuroendocrine tumors. So when you have a gastrinoma, they produce increased amount of gastrin. When they produce increased amount of gastrin, they now cause excessive stimulation of parietal cells. When the parietal cells get excessively stimulated, they produce excessive amount of hydrochloric acid, and this, when it refluxes, causes GRD. So agar GRD hai or koi luminal tumor hai, then the answer is going to be gastrinoma. You cannot goof up on this as well. Okay? Question number 11, again same. You go back to the series, you will see a comparative table, and I'm discussing this table with you for the same context. I'm saying there is an intestine protruding from the abdominal wall without the covering. What is the next step? हमेशा diagnosis पूछते थे, इस बार step पूछ लिया. अगर आप यहाँ देखोगे, I told you very specifically, अगर you have omphalocele, what to do? If you have gastroenteritis, you put silo bag. Look at here. कितने प्यार से मैंने बैग बना के बताया भी था और बताया था कि ये पॉसिबल एग्जाम क्वेश्चन है. तो आंसर हियर इट इज गोइंग टू बी, इट इज टू कवर विद साइलो बैग एंड वेट, लेट इट रिड्यूस, and then you have to, it's also for examination, and then you go to primary management. Okay, that's the question number 11. Question number 12, identify the pathology. It is your umbilical hernia, and when you see this, I've given you again a comparative table between all the hernias, especially the childhood hernias. I told you the age of presentation in a very comparative manner. I told you this is again a potential exam question. You cannot afford to miss this as well. फिर बारी है बर्न्स का है. अगेन दिस थोड़ा ट्रिकी हो जाएगा यहाँ पे. अ चाइल्ड हुज हैविंग अ 20% बर्न. ठीक है. नाउ यू रिमेंबर आई टोल्ड यू एनी चाइल्ड एज लेस देन 10 years, more than 10% ऑफ द बॉडी सरफेस एरिया बर्न इज सिग्निफिकेंट बर्न. तो ये अपना सिग्निफिकेंट बर्न हो गया. लो यूरिन आउटपुट भी हो गया. ठीक है. after 6 hours and there's cold extremities, the baby is in shock. ठीक है, now I have to give bolus of fluid. Regular fluid से बात नहीं बनेगी. Colloid should be given after 24 hours. I've told you again and again, so this cannot be answered. If you wait, then you are stupid. You cannot wait because baby will die. If you give bolus, yes, this can save the baby. Maintaining the same fluid rate, because see, अगर इस fluid rate पे normal होता तो यूरिन आउटपुट भी adequate होता, that indicates it is not. So if you apply common sense also, you'll get the answer as C for Calcutta. Nothing less, nothing more. ठीक है, nothing spectacular about it, as simple as that. Now, question number 14. ठीक है, this, if you go back to my trauma lectures, you will find the answer in a very precise manner. Patient who is going to have your facial trauma cannot be intubated or ventilated. What will you do? In an emergency, I do a needle cricothyroidotomy and then do an emergency tracheostomy. So this is going to be cricothyroidotomy. Okay? Answer here is going to be cricothyroidotomy. Then question number 14. Now here, if there is an 14-year-old kid with acute testicular pain, absence of cremasteric reflux, the diagnosis here is going to be torsion testis. Now, if you are having a patient who is having a torsion testis or suspected, you do a USG Doppler. Right? After USG Doppler, I will take for exploration. Right? Now, here I cannot do a venous Doppler. There is no point because it's an arterial component. And exploration of testes makes sense. No antibiotics. If you wait and watch, the baby loses the testes. Okay? Among the given options, it is going to be your exploring the testes will be a right answer. Now, this again, I told you that familial cancer syndromes are very, very important. Peutz-Jeghers syndrome, as you can see, I told you to remember PJNH, that is polyps with pigmentation seen in jejunum and hamartomas. If you have hamartomas polyps, see every single word that I've mentioned is your exam question here. Hamartomas polyps with mucocutaneous pigmentation, the answer is going to be Peutz-Jeghers syndrome. It is going to be Peutz-Jeghers syndrome. You cannot deny the fact. Okay? Same screenshot, same series. Now, another one, same. Again, same question, same series. Nothing spectacular. I've been telling my gut out that if you follow this series, you will not miss even one single question. And that was a promise that I made to you and I lived up to you. Okay? Just go and see. You will see every single component here. A patient with a severe head injury with poor GCS and a normal CT. The normal CT is the Q point and the death within hours. This is the only possible in diffuse axonal injury. I told you here, if you see again here, कोमा में है, CT नॉर्मल है, क्या करोगे? MRI करोगे, MRI में क्या मिलेगा? Punctate hemorrhage between white and the gray matter, and that is what we call it as diffuse axonal injury. ठीक है? Now, question number 18, I've given you a lot of urographs. Uretrocele का image दिया हुआ था, so answer here is going to be uretrocele. I'll show you the images as well. Then 19 में आपसे पूछा था कि blunting of calluses दिया हुआ था, क्या है? That is hydronephrosis. I told you in hydronephrosis there will be a soap bubble sign, so answer here is going to be hydronephrosis. They didn't mention all those. Which one, beta? Okay, we'll look at the question options if it is not mentioned. Okay? Chalo. Then you had in a chest trauma, there's a penetrating chest injury with tracheal deviation that indicates it is open pneumothorax. It is a open pneumothorax. Okay? So it is an open pneumothorax. So here, क्या component बनेगा? So emergency में it is going to be, next immediate step is going to be your needle decompression. ठीक है? Again, the pneumothorax was discussed extensively in our lecture that we have discussed it. ठीक है? Now we all know tracheal deviation is present. If it is on the opposite side, the air is filling up. Do a needle decompression. Definitive. It is going to be what? Your ICD drain placement. Intravenous pylography was one option. अच्छा ठीक है बेटा. किसमें intravenous pylography was the option? Just let me know about it. Okay? Gustatory sweating, I think everybody has spoken about it. ENT sir has spoken, your anatomy guy has spoken, our medicine guy would have spoken. So everybody. So it's going to be phrase syndrome, nothing spectacular about it. ये repeat हो गया है. So I think it is going to be, as most of you said, it is option number 2. Option number 2, it is going to be simple interrupted suture. This was wrongly given here. I think there was a cannula question that was given. If it is given, I've already discussed that in our regular series also. That is a marathon that we did. You can see color coding green है तो 18 gauge and 90 ml per minute is the flow rate. ठीक है? बेटा, the ICD वाला जो question है, I need to get a correct component. ठीक है? Can we do 2 intercostal? See, the next step when they're asking it is needle decompression followed by tube thoracostomy. Okay. Okay. So if you look at overall, surgery was quite doable. There are no such extensive bounces that we have. Sir, wide bore needle in the second intercostal space. Beta, agar patient adult hai, to wide bore needle has to be put in the 5th intercostal space. Okay? So repeat the option. Agar second intercostal space mein needle or 5th intercostal mein ICD diya hai, to answer will become 5th intercostal space. I repeat again, open pneumothorax mein you have to go with ICD insertion and that too in the 5th intercostal space. ठीक है? Emergency में अगर आप बोलोगे then it has to be your 5th intercostal space in the mid axillary line for adult. तो सवाल देख लेना. Okay? अगर ई फास्ट भी ऑप्शन में था, ठीक है, इफ ई फास्ट, सी ई फास्ट वुड बी डन फॉर ब्लंट ट्रॉमा. ये पेनिट्रेटिंग है तो ई फास्ट नहीं करोगे. ई फास्ट हैज टू बी डन इन ब्लंट थोरासिक ट्रॉमा, इन दी ब्लंट थोरासिक ट्रॉमा. ठीक है, सॉर्टेड है, राइट? So this is all in all that you have gotten the recall from the surgery. I mean, my job was quite simple because मुझे कुछ ज़्यादा पढ़ाने की ज़रूरत नहीं पड़ी है. ठीक है, and everything was already discussed in our recent series of marathon. I took the screenshots, I put down there. ठीक है. Now, everybody who's watching us live, सबके लिए एक बहुत इंपॉर्टेंट मैसेज है. आप लोगों ने बहुत मेहनत की है, आप लोगों ने बहुत जान लगाई है. 6 महीने यू डिड नॉट नो व्हाट एग्जिस्ट एंड व्हाट हैपेंड इन वर्ल्ड. नाउ इट इज योर टाइम टू कम बैक. ठीक है, हो गया है, एग्जाम खत्म है, आपका लेवल हेडेडनेस वापस आ गया है. ऑल दैट स्लीपलेस नाइट्स छोड़ो, खत्म करो, होगी दुनिया पुरानी, जाने दो. कल सुबह से नया दिन है. ठीक है, और नई शुरुआत है. ट्रस्ट मी, यू विल हैव ऑल दोज एंग्जाइटी इश्यूज जो कल रहेंगी, उसका धीरे धीरे सेटल हो जाएगा. तो मेरा आपसे ना एक ही एडवाइस है, या फिर आई वुड लाइक टू टेल यू ओनली वन सिंगल थिंग, कि ना कल से जब तक रिजल्ट नहीं आता ना, पढ़ाई के बारे में भूल जाओ. ठीक है, जाओ, जो जितनी रातें आपने जो स्लीपलेस नाइट्स बिताई है ना, उन सब का मिला के एक साथ सो लो. ठीक है, और जो जो आपको ऑल दैट क्रेविंग्स दैट यू हैड विच यू आर नॉट एबल टू फुलफिल, जाओ पूरा कर लो. जितनी मूवीज रह गई हैं सारी देख लो, जितनी सीरीज रह गई हैं सारी देख लो. घर जाना है घर जाओ, दोस्तों के साथ बिताना है दोस्तों के साथ जाओ. दुनिया के बारे में फर्क नहीं पड़ता. ठीक है, टेंशन नहीं लेना, छोड़ो. From tomorrow till you get your results, live your life, and after the results you will live even better. And I'm telling you, every single one of you, you all will pass. You will get through the line. And I'm telling you, I will see you again in a different marathon series, in a different discussion series for a NEET PG. And I know you will top there as well. ठीक है, तो जितनी all that you had now for all these days, खत्म करो अभी. ठीक है, एग्जाम था जो भी है. ठीक है, लेट इट बी, मान लो कि डिफिकल्ट है, सुपर डिफिकल्ट है, इजी है, मॉडरेट है, किसको फर्क पड़ता है? हो गया ना एग्जाम. ठीक है, एंड आई विल टेल यू व्हाट, एक पॉइंट ऑफ व्यू से अगर आप देखोगे, बिकॉज यू वर इन द एग्जाम, यू वर इन द जोन, देयर वाज सो मच अमाउंट ऑफ प्रेशर, देयर सो मच अमाउंट ऑफ टेंशन, देयर सो मच अमाउंट ऑफ एंजाइटी, आपको खुद नहीं पता आप वहां क्या करके आए हो. उस टाइम पे आपके ब्रेन और आपकी बॉडी ने जो रिस्पॉन्ड किया है, दैट यू हैव डन इट. अगर अभी आके ये सोचोगे मैंने वो लगाया था, ये लगाया था, नहीं याद आएगा. इट्स ओके, इट्स फाइन. द रिकॉल is done only for you to get a grip of things कि ठीक है, कल को कभी कुछ लगा anxious कि यार मैंने उस सवाल का क्या जवाब दिया था, I'm not able to get it, just come back and watch it. That's it. That's all about recall. ठीक है, so from tomorrow onwards, let's just have fun. ठीक है, if you have anything you want to reach out, you know where to get us. You can just text us on our MedEd Telegram group. You can text me directly on my Telegram channel or my Instagram, that is your surgery guy. I'm there for you. ठीक है, कुछ भी बात करना है, कुछ भी पूछने का है, कुछ भी करने का, एक मैसेज डालने का, I'll get back to you immediately, and trust me, we'll have a lot of fun. ठीक है, with all that, let's wrap this session for today. We had a lovely time with everyone who has participated. You guys are amazing. You have done well. You deserve every single bit that you want to do in your life. ठीक है, कल से रिलैक्स करने का, चिल करने का, आराम से खाना पीना खाने का, सो जाने का. ठीक है, and trust me, to bring this recall is not a very simple thing. Every single teacher in our PW MedEd have worked really hard. All 19 of us have really put every single word, every single sentence that you can give it to construct a question. So all 19 of us do deserve a little bit of credit, and I would like to thank the entire MedEd family for doing that. We had a huge set of people. You can see only 19 of us coming in front of the camera. You have hundreds of people who have been working and helping us from behind. So shout out to every single person who has helped us. Special mention to our favorite Aditya, who is the studio guy who actually did every single thing, a bit of it to stitch it together. It's night around 1:30. He's still awake and live with me. Thank you, Aditya bhai. You deserve a special ovation from all of us. And of course, our set of people, special thanks goes to Dr. Hara Prasad, Dr. Manish Munchandani, Mamu. We have Raman sir, we have Manish sir, we have Abhishek sir. All of you, without your support, we couldn't have done that, right? Thank you so much, guys. Love you all. And stay with us, right? Chalo, we'll see you guys again. Bye. Take care. Have fun.